Good morning, class, and then we start the first lecture today. Yeah. Okay, we are going to finish 11 cases, 11 common disease today. So as last time, we'll get 2 break in the morning, and then we get 6 disease finished in the morning, and then another 5 in the afternoon. This is what I'm going to do, right? Good. Go. Yep. It's no problem. So let's go. The first common disease we are going to deal with is 静治. 静治 is a Chinese term. Of course, the term is called palpitation. Palpitation. That means heart beating. And in Chinese medicine, we can divide this 静治 into 2 types. One is what you are reading your book. You are just watching television. Suddenly you feel your heart beating. Okay, this kind of thing we call palpitation. Nobody can hear your heart beating sitting here. I'm sure everybody here, you cannot hear your heart beating. Once you can feel your heart beating, this is a problem. This is a morbid stage, right? Second is while you're sleeping. Suddenly you're scared, and then you jump up from your bed because of the heart beating. And this is also what we call the palpitation. Okay, so there are 2 types of that, and both of them belongs to this type of cause. So for palpitation, this is let's look at the description here. For palpitation, you can see, this page for this one. Dealing on chapter 1. And palpitation refers to your own feeling. Okay, and then you cannot control yourself. And this situation will happen on people suffer from insomnia, forgetfulness. Remember, forgetfulness is going to be aging. Many aged people, they got this thing. And sometimes they got tinnitus. Okay. And then, of course, in Western medicine, they just regard this palpitation associated with some heart attack or heart disease, just like, the hypertension and also the arrhythmias. That means the rhythm of your heart get, irregular, either faster or slower, okay? And hypertension, and also something we call it because anemia. Some people, they got neurosis. That means a psychological problem. They usually get this one because in this situation, in this large city, just like Toronto, Vancouver, and also Ottawa, so many people are engaging in business. So many people are involving in their studies, and then they got some psychological problem. And of course, palpitation is one of the sign and symptom for this kind of the palpitation. Okay, second, when we are dealing with the cause, the etiology, as I mentioned, in many cases, this kind of psychological problem either caused by long-term disease, that means prolonged disease, or sometimes because of the emotional, not sometimes, most of the time, the palpitation caused by what? By the emotional disturbance. That means that people, they worry a lot, they always suffer from emotion, and sometimes people, but not the most time, because of the the hard laboring, because they do too much. And some people told me that in Canada, if you buy a house, you suffer a lot of the problem. Either you have to cut the glass, or in the winter time you have to remove the ice. Yeah, in Michigan, the ice, be careful. Many people get sick. After they finish the cleaning up all the ice in the backyard. You know why? One, because the weather is so cold. Sometimes after they work, they will just sweating, and the sweat will absorb, they will get cold, right? The other thing is the over stretching. They because they work too hard, they will exhaust their kidney, especially the kidney young. In this case, they will also hurt their body. And sometimes the kidney will affect the heart, and because they decrease the insufficient blood in the heart, they got it. And some are not most of the time. Those palpitations is caused by exterior syndrome. But exterior syndrome doesn't affect the heart unless you let the palpitation enter into the body. That means you are leading the palpitation in the interior from exterior. This will be the last cause. Why you get those palpitations? Because in Chinese people, they call it a disturbance of the shen. That means so what you're going to do is tranquilize your mind. This is what they're going to do. And when you when you have this kind of disease, of course, besides palpitation, you feel really discomfortable. What do you feel discomfortable? That means you get dysphoria. Sometimes at the station you feel really, in the chest here. So we are going to share about the etiology and also the pathogenesis of this disease. Okay, and this is very important for us to know that. Yeah. Okay. Yeah. Go to the most important part. As I told you before, introduction is not important. The name of that, of course, you have to recognize this kind of palpation. However, the most important thing is differentiation syndrome. In this textbook, it's called the identification pattern. As I mentioned before, because you got lots of experience in your mind, you get a lot of the mind map, the background knowledge, which you deal with the data bank. And then once you are in the clinic, you get this pattern, and then try to match the pattern with your data bank. So we call it this identification of pattern. So what is the pattern? We get Chinese medicine, the mention of pattern. What's the pattern of these people who got the palpation? And the pattern will be always feeling discomfortable. Dysphoria in the heart. And this kind of disease will come, on and go, happening in your body. Sometimes you cannot control yourself. And you get all this kind of heart beating. Heart beating is very serious. Sometimes it will affect their sleeping, affect their daily life. Okay? Some people got what we call the acute fright. Suddenly we are scared. Some people are scared of being alone. All those symptoms, most of the time, associated with what we call the palpitation. Okay, in this case. Now next time, when we have all these symptoms, we try to classify them into different categories. Okay, the first one we're talking about is the heart and bladder deficiency. You know what is the function of gallbladder? Etymologically, this is for what? For secreting the bowel juice for digestion of the fat, right? However, according to Chinese medicine theory, the gallbladder is going to determination. You make a judgment. This is quite curious for me to think that people with the gallbladder removed, they cannot make their own decision, right? This is sometimes not true, but according to the Chinese medicine theory, the gallbladder is going to make determination and make judgment. So here, if we mention the first patient, which is heart gallbladder deficiency, that means the heart blood is insufficient, while the gallbladder, also the gallbladder qi is not insufficient. Okay, it's not enough for that case. So what we are going to do is we try to tonify the heart and also to suppress the gallbladder in this case. So the most important thing is how do you know? There are 11 people sitting here, all with palpitation, right? Some of them due to reason of a heart gallbladder, some of them due to, for example, the heart blood deficiency, some of them due to maybe the liver blood deficiency. We don't know, but the most important thing is first of all, we look at their signs and symptoms. Okay, so for example, in the first case, people suffering from gallbladder and heart deficiency, they will have lassitude. Lassitude means lack of spirit. Always sleeping. You do not have enough spirit for doing. Second is about the insomnia. Of course, as I mentioned in the last lecture, insomnia always associated with this distress or with the depression in this case. And dreaminess, it is another thing that distinguishes whether you get fire or not. Everybody gets dream, right? But you got dreaminess. That means you always find that you are in the dreamland. You know that you are now having a dream. I think this is the most terrible thing. In that case, we can just conclude that you guys get fire. However, the fire, where did fire come from? Either it's a heart fire or the blood gallbladder fire, the gallbladder fire. So you got some people will say, okay, depends on which kind of dream. Sometimes it's a horrified dream, sometimes it's a peaceful dream. I don't say that. But the most important thing is, if you know that you get many dreams within a night, after you wake up, you know that you get all this. This is a terrible thing. Question.
What about this gallbladder removed?
gallbladder removed it,
Yes.
it doesn't mean that the gallbladder removed, you know.
You still have the same symptoms?
Of course. As I mentioned before, dreaminess means because of heart fire, gallbladder fire, liver fire, right? If you remove the gallbladder, it doesn't mean that your heart will not have fire. Your liver may have fire, right? In that case, you just eliminate one of the possibilities, but the other possibility is still happen, right? Depending on the body. So this is very important for us to know. Sometimes dreaminess. Yeah, questions.
Sorry, Leo. You just mentioned dreaminess can be heart.
Yeah, can be heart fire,
liver
fire, gallbladder
fire.
Yeah,
so there's a lot of fires in different organs.
Yeah.
Can all lead to dreaminess.
Yeah.
Okay.
However, you can ask me, how about lung fire? How about spleen fire? How about kidney fire, right? But I can tell you, well, there's no kidney fire. And spleen fire, we seldom talk about that. You can just spleen yang. Spleen yang is beneficial to our body.
So
however, there's a lung fire.
No kidney fire and no spleen fire.
No kidney fire. Spleen, you don't say spleen fire. You just say spleen yang. Spleen seldom gets spleen fire. And why? Because spleen fire will what? If the spleen get fire, it will just descend to his partner. Where? Stomach. Stomach will get fire. And the other thing is the kidney never get the fire, right? Once the kidney get the fire, it will downflow to his partner. You will never regret it. You will never regret that you get fire, right? So it's very, very common for us to know that some organs may not have fire, but the fire will downflow or transfer to his partner.
Just one final thing. There is no quality about the dreams that can lead you to a certain organ. For
No.
example, what if you have nightmares, which are violent dreams, let's say, scary dreams? That doesn't point you to any organ.
Except you say sometimes we refer to the liver. Sometimes we refer to
Nightmares,
Yeah,
violent
nightmare,
dreams,
yeah.
scary dreams
Yeah.
can
It
be
brings you,
liver.
not just the,
Yeah.
it
Yes.
brings you to irritability.
Yeah,
right?
you're right.
They're going to bring
No,
you to irritability.
there's different theory. But of course, just like many research now available in the mass media and saying this and that. Some people say eating too many potato will make you something wrong. I think those are in research stage, but we will not accept. Chinese medicine is what? Is some kind of theory which has been proved and then transfer from one generation to another generation, right? So for some research, I will not accept it at the time being, unless we find in the classical, Chinese medicine literature. In that case, okay. So sometimes that's why we say traditional Chinese medicine. We don't say Chinese medicine. Because Chinese medicine is still under research now. We get a lot of that, right? But traditional one, of course, we are taking the old theory, but which is found useful still now, right? This question.
Yeah, but my nightmares, is it the same thing for children? I have my grandchild, 4 years, she always dreams a monster is coming, a ghost is coming, and she wake up at night. Is it because of fire and liver?
Not really. Yeah, I can just attribute because of pediatrics, something different. The kids, they play at the daytime, they get excited in the daytime. Usually you get much more during the night. Okay, this is one of the emotional disturbance. You cannot stop, you cannot help, right? Because once you can play in school, you play with the kids, and then the only thing is to stop him playing too vigorous. Otherwise,
exactly, that's not enough. She went to school.
Yeah, exactly. Yeah, the second stage maybe you're right because in pediatrics we mentioned that the kid's body is more delicate in this case. You can easily get hit, easily get hurt, right? Sometimes when you giving some McDonald's French fries, sometimes Kentucky chicken, you eat too much, you will just get fired. So it's also another possibility that the kids will get fired easily. Okay, unlike the adult. The adult will get it, maybe in a later stage. But kids, it's very easy to observe. Once they take it, and then the manifestation and the expression will be easily defined, right? Just like congested eye, nose bleeding, and then sore throat, easily get it, right? So you can say that sometimes if you find the kids, just your grandson to get this nightmare, maybe due to the heart fire. He still observe his tongue, pick his pulse, see whether it's very wrong, right? This is, you can do all these things for your verification, right? Okay, yeah, then good. The first reason is because of the heart and gallbladder deficiency. Second is because of the heart and spleen deficiency. This is very common. Spleen deficiency is because the digestive power or the absorptive power is in a very, very poor stage. And according to Chinese medicine, we just mentioned the function of the spleen into two T's. One is transformation, The other is transportation. Okay, that means the lung is not able to transport or transform the food, so we make it the spleen deficiency. Of course, in this case, what happened? What happened? If you do not have enough blood, the first thing you get dizziness, right? Because the blood cannot go up to the brain, to nourish the brain. Second, you feel you're with a blurred eyesight because you don't have enough blood too. So in this case, you can see that poor appetite. Because what? Because of the spleen deficiency. Some disease, some signs symptoms belongs to the heart deficiency. Sometimes belong to the spleen deficiency. So in this case, it's wise of you to try, well, while you are reading this, you try to classify them which one belong to spleen deficiency, which one belong to heart deficiency. Because heart and spleen deficiency actually is the two organs, the problem two organs. For example, poor appetite, that means spleen deficiency, right? How about the face? I mean the pale complexion, of course, is due to blood, right? Due to blood. And then we got insomnia and more dream. What's the problem with that? Sometimes you can say heart, but if I just ask you heart and spleen deficiency, sometimes you can't go spleen. You know why? Chinese people like to take the nice snack. Nice snack, that means just before they sleep, they like to eat more things, otherwise they can't sleep, right? But this is harmful to the digestive system. You know why? While you're sleeping, your stomach is still working. Your stomach is working. In this time, your stomach will affect the cortex. That means the outer layer of your large brain. We got the cortex of the cerebellum. Okay. While you're sleeping, and your cortex still gets stimulation. Of course, this is the cause of dream, right? So it's insomnia with many dreams. Of course, this besides the problem of the heart, it can be the problem of the spleen tube. Of course, the most important is to see the tongue. Tongue, okay? Pale tongue, the pale tongue with a thin coat. I'm sure that pale tongue, people can know that this is a deficiency of blood, right? Yeah. About the thin coat. Thin coat, I can tell you, has no implication for anything. Because the thin coat is a normal situation for a normal person, okay? Because in normal, as I'm teaching in the class of diagnosis, I will tell my students that in order to study diagnosis, you set up a normal case. How can you learn? You must a normal, compare with the normal with a normal with a normal. And then you will know, right? So while we teach, I will ask one student, okay, this is a normal case. Try to compare with him. Oh, yeah, this is too red, this is too pale, right? So learning by comparison is one of the the technique, the teaching technique. Because when I was studying education, doctor of education in England, we also mentioned this. Okay, learning by comparison is a good way for you, because especially for you guys going to practice here. Okay, and the third reason is because of what? Because of the Before I start the third reason, I had mentioned about the pulse. The pulse. In case of a heart and spleen deficiency, you get the pale tongue with a thin coat. You always get a fine and weak pulse. Okay, what do you mean by fine and weak? Of course, both of them denote deficiency. Understand? So that's why I asked you to remember the 8 principles. 8 principles consist of deficiency. So in this case, you can just use your concept, the principle, telling the examiner that now you know that fine and weak pulse due to deficiency, right? Okay, the third type question.
Wiry, is that the same as fine and weak?
No. Why? Because that means this layer string, when you are using a blouse, you can just this a string there. It's really tough, and then those tough pulse we can call wide pulse. Yeah. So fine pulse doesn't mean it's very tough. It's usually the string is the same, but it's very fine, very thin. Thinness of wine, basically what we can find. Okay, yeah, and also, the third type is yin deficiency. And this yin deficiency, of course, will have some dysphoria, and also insomnia, and in this case, the patient will suffer from dizziness, poor eyesight. However, there will be something more just like the tinnitus. And something about the lower back. Some people call the lower back Something called the noise, L-O-I-N, noise, soreness. Yeah, when it is not severe, it is just you find soreness, but it's getting to be more severe, you get pain. So lower back pain is really common in Canada, right? 80% of the patients visiting our clinic get the back pain. This is very common. Whenever the back pain, everybody sitting here should know that this is concerned about the kidney. Why? According to Chinese medicine, kidney governs the lower back. Anything concerned with lower back, please refer to kidney. But for time being, I don't know kidney or kidney chain, but it depends on the other, concomitant signs symptoms. You know that, right? So this is besides you get the tinnitus and the lower back, you have to know that this is dry mouth. Okay, if somebody get lower back pain with the dry mouth, of course, you can. Yeah, you can. Please assure that.
Sorry, can you just stand for?
Okay, yeah, okay.
Like just
yes.
Better audio sounds.
Okay, yeah, this one. Okay, so in this case, when I mentioned that if you guys get the lower back pain with the dry mouth, we can, again, we can prove that maybe yin deficiency, right? More, of course, you can collect more. And on top of that, when you observe the tongue, now you can see the tongue is red tongue with little cold. Okay, we are from 60% to 80% proof. And then you also see the pulse. Now the pulse is fine and rapid. Bingo, right? You at least get 1, 2, 3, 4 pieces of evidence to prove that this is kidney yin deficiency. So very, very clear. And the fourth type of the fourth pattern of the publication will be the this will be the pulse. I mean the blood vessel. The blood vessel obstruction of the blood vessel. Actually, if you dissect the heart of the pig or animal's heart, you can find that within our heart there's a very distinct blood capillary, lying across the heart, which we call the coronary artery. Coronary artery is responsible for carrying the blood back to the heart so that the heart can work. Okay, everybody working should receive your pay, even a heart, so hardworking that it supply all the blood to the whole body, but it needs the salary. So one of the blood capillary will return back to the heart itself to supply the blood with oxygen and also nutrient. However, when you find this coronary artery blocked or obstruction, the problem is there. Okay, there are two causes for heart attack. One is the blocking of the blood vessel. Second is the commotion, or what we call it the pucker, the spasm of the heart muscle, the cardiac muscle. Okay, so in this case, you will find that people when suffer from the obstruction of the heart muscle will experience the problem of the chest oppression. Sometimes many people just hold this one. So whenever you see patients coming into your clinic with this position, you know there's something wrong with his chest. Okay, this part may be heart, this part may be stomach, or sometimes even they got the circulation, microcirculation around this part get blocked also. Okay, if people suffer from blood vessel or main obstruction in the chest, we've got the chest oppression. On the other hand, is shortness of breath. Okay, shortness of breath is easily found because whenever you step, go up slope uphill, or whenever you climb up the staircase in your house, you will find shortness of breath. Those will be one of the symptoms for getting the heart blood obstruction. And sometimes lassitude, tired, and how do you know that you get the stagnation? Nobody knows. We observe the tongue. First of all, the tongue. Usually the tongue color is light red, right? But when you see the tongue turning into purple, this is a very serious case of blood stagnation. Or some people will find, sorry, I can't find the whole tongue, getting purple. Just the two sides. I mean, just on the surface, you can just see some blue stain there. Okay, this is preliminary. You can just imagine that this patient will suffer from blood stagnation, and then ask him to roll up the tongue to see the two capillary, the two veins under the tongue, which we call the hypoglossal vein. When you see hypoglossal vein is bulging out, also get thick. Okay, this is another way to prove that this guy get the blood stagnation in this case. Okay, So you can read from the from your book that sometimes you get the blue stain, sometimes they get the the dark color there, and then you get. Of course, the most important thing you must confirm your pulse. Usually people getting the stagnation in their body or obstruction in the blood vessel, they got choppy pulse. What do you mean choppy? You guys use it to use a knife, okay, to impale the bamboo, and Chinese people like to eat sugar cane, right? You use a chop to get sugar cane. Whenever there's a knot, your knife will encounter some difficulty. Chop, 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 chop. So whenever you push you feel your pulse, you find the pulse running with difficulty. The feeling one is a chopping, impeling the bamboo. The second feeling is like walking in the water. When you run in the water, you experience more resistance, right? Those are the feeling of what we call the choppy pulse, And here in your book, you mentioned about the rough pulse. The rough pulse is a name, but usually you get choppy. CHOPPY, choppy. Okay, the choppy pulse, and also this choppy pulse, or sometimes you experience irregular. What do you mean by irregular? That means sometimes you get a stop. Okay, listen, big pop, big pop, big pop, big pop, big pop. This is irregular, right? But sometimes what we got in the middle is big pop, big pop, big pop, big pop, big pop, big pop. Lost one pulse, right? Those we call it intermittent pulse. Intermittent pulse sometimes will indicate that there's a heart problem, or this is a blocking of the blood vessel, the heart vessel inside the body. Okay, so this is the pattern. And the other way is let me see now. Yeah, and then the other reason, because what we call it the water qi invading the heart. This is very difficult to explain. How can I say? And actually, there are many people, especially women, they suddenly have feeling that there's a water qi coming out from the urinary bladder and moving up until it reaches the heart. And when this water qi reaches the heart, she will feel a feeling just like sitting in a boat, a rolling boat, and then it's just just like you're playing the game with the how time.
Is that like congestive heart failure when the water fills up in the heart?
Yeah, this is heart feeling. You're just moved by the water, and this is we call it the water qi invading the heart. In this case, what's the problem? The problem is because of excess water inside your urinary bladder. Okay, so in this case, you will feel the oppression. This oppression is not because of the liver, not because of the heart, but because of your urinary bladder. You get the water stagnation inside your urinary bladder. So we bring the feeling of that. This is a kind of you in addition you feel a lot of phlegm and also sputum while you are sleeping down. In this case, this belongs to cold, according to a principle, cold. Okay, and how about the tongue condition and the pulse condition? Of course, if it belongs to the cold, your tongue will be white, and also covered with lots of slippery. That means a lot of water. The water is clear. Clear and much water. Your tongue looks like somebody dumped your tongue in the water and pick it up. It's all wet. Okay, so we call it slippery. The other thing is the pulse. The pulse will have a slippery. What do you mean by slippery? Slippery tongue is easy to understand because it's all wet. But when you have a slippery pulse, what does that mean? It means what? It means you are holding some beads, B-A-D, beads under your finger. Okay, those beads will striking your finger in different direction. So whenever you feel the pulse, it's not in one direction, but in different direction. Okay, front, back, left, right, front, back, left, right, in this. So you got to be very careful to feel this kind of pulse. This kind of pulse we call the slippery pulse. Slippery pulse implies what? Implies stagnation. No matter the stagnation of water, accumulation of water, accumulation of undigested food, accumulation of phlegm, accumulation the stagnated blood or qi, and then you also get this kind of slippery pulse. Okay, and also the other stagnation. It's not bad, but stagnation of baby. Whenever you get a pregnancy, and then you feel. This is my experience that some women who do not have the menstruation cycle and late for 10 days, and she will suffer from whether this is anything wrong with my body, and then ask me to check. after 10 days, I can, tell whether she get pregnant or not by feeling on his pulse, because her pulse will, indicate this kind of sleepy pulse. But of course, you have to differentiate the symptom. She should not suffer from, stagnation of blood, stagnation of chi, stagnation of water, other thing, and only it's just normal in this case. Questions?
Yes. How do the pressure on the pulse? Sometimes I'm trying people, you press hard, you don't feel it. Some people, just when you put, you feel it. Is it like make a difference? Some people you cannot feel their pulse. I mean, they have a pulse, but you have to push hard to. What does that mean?
I totally understand what you are meaning, right? This is the first class in my diagnosis on pulsation. Actually, pulse can be divided into 28 types of pulse. And then I'm not supposing all the students will get known of all 28, but just ask them to be familiar with 8 categories, which is floating, deep, rapid, slow, large, small, and then we get long, short, okay? What you mentioned is floating and also deep pulse, right? In my thinking, 80% of people coming here get a very deep pulse. And then that means what? As you mentioned, we feel the pulse. We cannot feel it until we put down the. So in the technique, we call it those lifting. That means a little pulse. And then we get pressing. When we press, we still not can do it. The third technique is called surging. Surging. That means you press it down and pull away all the tendons until you reach the bone. And then you get it. So this type of pulse, we do not call it deep pulse. We call it what? Hidden. Hidden. That means hidden in the bottom. Which denote the interior symptom. That means the disease is really deep inside the body. Okay, deep inside. So with the interior symptom, we got the deep pulse. Understand? Usually,
how somebody new can get the right diagnosis from that. If we don't understand it, like we need maybe years of experience, how we can get the right diagnosis from that?
Again, I can tell you guys, even my students spend about 120 hours in diagnosis. I also gave them a lot of the hands-on experience and asked them to test themselves. After they graduate from this course, they don't know what is the floating pulse, don't know what is the deep pulse. So this is you guys' responsibility. When you study this, you practice more. One, you practice on yourself. Two, you practice on your family member and friends. Later on, of course, you practice on your patient. The more cases you meet, the more knowledge you get. Right? Experience. Okay. I just want to draw one more. Usually, we just sit out and we can look the pulse. Right? This is skin. This is the bone. This is the blood capillary. The blood capillary. Okay. Usually, the pulse is in the middle. The pulse is in the middle. Here, right? So when you usually the pulse in the middle, this is normal. But when you feel just in the folding pulse, this pulse appear here. Appear here. That means little bit you just lifting and then you can feel the pulse. What you mentioned, the pulse down here, and then you pull down the blood capillary low, and then going down here until you get reach the bone. Then you get the what we call it the deep pulse, or even sometimes even down here, and the pulse will, and then we call the lying just hidden on the bone. Okay, so as you mentioned, it depends on the experience, right? You feel the pulse, and sometimes also we consider the constitution of the patient. Some people get the skinny, just like me. You can just easily feel the pulse. Just like your body, maybe you just press it down because you get more fat, and then you push down, right? So all depends. You have to eliminate some of the possibility. You have to take something into consideration, right? So to end this slide, I just repeated that for the public patient, when you consider about the differentiation syndrome, you can divide it into 4 types. Even this is because the heart gallbladder deficiency, you get the heart spin deficiency, and then also you get the yin deficiency transforming into fire. I think we'll explain this later. And then you get the blood vessel obstruction or the heart vessel, heart blood vessel. Later, and after all, you also get the phlegm. I mean the water chi, invading the heart. So those are the one of the things one of the important guy you have to read it. Okay, and also, how about the treatment? As I mentioned before, why do you come to my clinic? Because you want to get treatment, right? But before before I get treatment, of course, I can undergo a lot of process in my mind. Okay, I will just divide your pattern with the pattern I made before and match, and then I just design my treatment principle. Of course, every problem you can have your treatment principle. However, the arrangement here is not too good because of what? Because it doesn't mention principle before and then just go straight into the treatment. This is all I can say pragmatic, really utilitarian. Many TCM practitioners and also acupuncturists, they are so lazy that they just come in the patient and then they just decide the treatment. I think this is wrong. Although you can say there's much more experience, but for the most of them, I can criticize that they do not undergo any judgment or decision. Just come and match and then do any case within 3 minutes. I think this is not professional. But what you think is you must, as I mentioned before, do a lot of analytical work, determination, judgment, and then you just put your experience. I think this is what we are going to do. Okay. So I'm not going to spend too much time there because we don't have enough time. Okay. How about the treatment? Yeah. Question.
When you look at the beginning here, when you put them into 6 different categories,
yeah,
they're not exactly matching the ones you just pulled out.
You are right. This is because I didn't compare it. You can just inform the office. The general office. How about how can they? Why they do not match each other?
What do we go by? Do we go by this in terms of?
Yeah.
Okay.
In terms of the I think the the summary page is just for the sake of you guys. If you got this kind of symptom differentiation, you can just refer to that. But for me, I just need to go through all the etiology and pathogenesis and also the differentiation syndrome, and now I move to the treatment part. Okay. For the treatment part, the palpitation, of course, everybody knows palpitation concerned with the heart. So the 2 points in heart must not be forgotten. One is a PC6, 内关 here, PC6. Second, what we call it is HT7, 神门. Those 2 points are really popular. So when you are doing your examination, you luckily have a palpation, please remember these 2 points. Okay, one PC6, 内关, the other is 神门, HT7. And those 2 points are very important. Besides that, you can just turn to your back. You find a lot of vessel in the back, right? Which deal with all the organs inside the body. Please look for BL15. 肾虚 means the vessel point of the heart. You remember, the vessel point is for tonification. We never use a vessel point for sedation. No. So if you find your palpitation is because of the deficiency, you can just tonify. Okay, and here you find the 内关, that means PC6, HT7, and also the BL15. And the other thing is here. The G, this is CV14. CV14 actually is a leukonotic point of the fun mood point of the heart. So anything concerned about heart, you must consider that. The other point to have the PC6 is the PC4. Why? Okay, you get the semen here within this 1.5 inch here, 1.5 inch here. 1, 2, 3, 4. You can divide this 1.5 inch here, into 4 points, namely HT4, HT5, HT6, HT7. So they easily mix it together, right? But however, we just know the last point here is HT7, and the first point is the HT4. Both of them can be used for dealing with the case of the palpitation. Okay, so here is the general and also the principal point. Concerning about the supplementary points, as I mentioned before, there are 4 types of differentiation syndrome, 4 types of pattern. First pattern, if you got heart and gallbladder deficiency, of course, please look for the gallbladder, the best point for the gallbladder. The best point for the gallbladder, we call it 胆素, that's the BL19. And also we look for the other tony. Actually, tony is within here too. Remember the 4 points around here, right? HT4, HT5, HT6, HT7. Now, besides HT4, if you got some problem in the gallbladder, you please look for HT5. That means 4, 5, 6, 7. Okay, and here, actually, if you got the heart and gallbladder deficiency, please look for the 胆素. Of course, the second is about the heart and heart and spleen deficiency. This time, please find the 皮素 at the back. That means the BL20, which is the best shoe point for the spleen. Because it is spleen and heart deficiency, right? So we're looking at spleen points here. And the other thing is, since spleen and stomach, they are brothers. So we are looking for a very famous point, which is universal for tonification. We call this ST36. This is the 足三里. You will meet this term on and on this course, because I always say that 足三里 is a universal tonification point. Whenever you get deficiency, please remember ST36. Okay, so in the pattern of yin deficiency transforming to fire, please got the the kidney 肾素. Why? Just before, just 15 minutes before, I told you guys we have confirmed that this yin deficiency is because of kidney yin deficiency. Please look for the kidney at the best shoe. And the best shoe form of the kidney is BL23. Okay. And besides that, another point for tonifying the water, the kidney yin, is Ki3. What is it? Tai C. Tai C is at this point, this is the angle and this is the back. In the middle of the angle here, this is Tai C, right? It's just midway between these two. Okay, this Tai C Ki3. Ki3 is for tonifying the water in your kidney. And then when we look for the third pattern, the fifth pattern, which is the water qi invading your heart. Okay, this time please make sure that you have go up to the CVA. Why? Since I told you guys that this is because there's too much water. Okay, water edema, you can see the ascites in the urinary bladder. So we are going to deal with the water and also the urinary point or urinary bladder point. The first thing you're going to see a navel. Okay, navel is a point you never pin. Don't use a needle here, except you can use a moisturization. Some people put a piece of ginger, some people put the salt on here and then put the moisturization there. You can moisture the navel. Okay, there, and you can also consider the qi hai, because this is because of the qi deficiency. And there are 2 points for tonifying the blood, the qi. One is a CV4, 关元. The other is CV6, 气海. Okay, 关元气海. CV4 is CV6. Yeah, okay. And sometimes, which we doesn't mention in the prevention syndrome, some people some of them acute fright. That means suddenly you got frightened. Okay, in this case we consider one more point, which is PC6 dialing. Dialing is easy to get. You know where is it? Here. Just in the middle here. When I was young, the teacher asked us to fill the post, and many classes made us put here to fill the post. Actually, no. Many people misconception, right? Before the post here. Actually, this is the point we call it the dialing. Actually, just in the middle, because the the PC channel run all the way from here and then go up here, right? So this one is the point we get as a dialing. Let's see. We call it the PC7. Hydrosis, we got too much water, which got the Gao Hong, that means BL43, at the back, this is during the water. And sometimes we get the restlessness and also fever, and also this point, we got the 劳宫, we get 2 points in the palm. Okay, one is here, and this 劳宫 is easy to get it. When you hold your fist here, this point between the second and the third finger. Second and third finger. Can you get it? Here. So this is the fifth. We got 劳宫. 劳宫 actually is the second last point of pericardium. So we get PC6 here, PC7 here, so PC8 here, and PC9 here. So there are 9 acute points in the pericardium. Okay, remember 9. Also 9 acute points for the heart. So heart 9, PC9 all over these 2 points. Understand? Good. So 劳宫 here is the second last point for the pericardium, which when you guys feel tired, and then you can just press on this point, and then it's just easy and get rid of your tiredness. This is 劳宫, very useful. Okay, when I'm teaching, the community center about those, the acupressure point, I will teach them how to do it. So in case of tinnitus, usually tinnitus is caused what? Caused by the liver blood deficiency, right? So you can just consider what is 中居. Where's the 中居? As I mentioned before, this is the 关冲, right? And then going down here, we got the 一门, and then 中居, this is what we call it the T1, and then T2 here, T3 here. Yeah, this is T3. Okay, so T3 we call it the 中居. Yeah, yes.
Can tinnitus also be from kidney yin deficiency since the kidneys
Which
go
point?
down to the ears? Tinnitus?
Yeah, you're right. But here we consider about the tinnitus because of the palpation. But usually, whenever you are in your clinic, sometimes some people come in and telling you that suffer from tinnitus. Of course, in this case, first of all, you suspect this is liver E blood deficiency, and in addition that there will be also liver and kidney yin deficiency. So you're right. Consider kidney yin deficiency also another cause for the tinnitus. Okay. So I will just let you, and last one, edema. You remember that the problem of the water invading the heart also because of edema. In this case, you consider how to get rid of the edema. Of course, there are many water points in the body. Get rid of the water, right? One, you consider ST40, 丰隆, get rid of water. Second, you consider the 水分. 水分 what's the 水分? 水分 is a CV9. Remember CV8, this one, navel, just 1 inch. Okay, one chin. From that is 水分. 水分 we call it CV9. 水分 is also a part to getting rid of the water, right? Yeah, those you got the 水分. Yeah, exactly. Thank you. Yeah. Okay, that's it. Okay, we spent lots of time telling you about the differentiation symptom and also the treatment. Yeah. On this page, got to explain why do we use those points. You are not necessary to write down some C point or UN point or something like that. I think the most important thing is you have to know that why we use those points. And of course, for simplicity, or you can just remember the function of those points. Of course, if you get good memory, of course you can remember C point and also the Lu connecting point and also Fun move point. Those are very important. However, please remember that some of the points they can just tranquilize their heart spirit. Some of them they can regulate their qi. Some of them can supply the to tonify the blood. Okay, those are the important points you got to explain, right? Okay, yep, I finished that. Let me finish this. Okay, other treatment. Okay, of course we are not going to deal with those treatments. Okay, this, as I mentioned before, you must advise your patient. Okay, you advise your patients on not taking too much salty thing, fatty food, and also spicy food. This I think. Okay, so let me. Are there any people going to major in TCM, taking the TCM examination? No, all of them are acupuncture, right? Okay, sorry. Okay, I would like to explain more because if you are not TCM, I will just skip this part. Okay, now I need to before I take the break. Okay, for any time people suffer from heart and spleen deficiency, please consider a very famous formula which is called the 桂皮汤. If your memory is not bad, we have mentioned this formula for many times last time. 桂皮汤 is for tonify the heart and also spleen deficiency. Using in what? In palpitation and also in insomnia. Okay, so 桂皮汤 is one of the solution. And the second, we got the heart yang deficiency. This is another formula called the 桂枝甘草龙卯汤. 桂枝 is one of the herb. 甘草 is another herb. 龙卯 means 龙骨, 卯粒, and those are for settling down the floating yang, so they can be used in dealing with the problem of the heart and heart yang deficiency. Okay, those are modification. And also we are talking about the excess fluid. The excess fluid, invading the heart. And there's very useful formula which is called 苓桂熟甘汤. 灵桂属根呢，灵 means 茯苓，桂 means 桂枝，you know, 甘 means 甘草，okay, 熟 means 白熟。Actually, there are 4 herbs in this formula, which is useful for settling down excess water in your urinary bladder. Okay, the 6th one, yeah, it's because of the 6th one is because of the obstruction of the heart vessel. This time, please remove the stagnated blood. What can we do? The principle is to move the blood and move the qi, activate the blood so that the stagnated blood will go away. What we're going to do is a 桃红西乌汤. Here we call it 桃仁红花剑. I'm not pretty sure in this formula, but what I'm going to do is 桃红西乌汤. That means 桃仁红花 plus 西乌汤 together. This is in my formula, okay? And the 7th one, flame fire. Remember, every time we get the mental disease, we Chinese medicine, we use the method of removing the flame fire from the patient. This is the only way we can do to deal with people who suffer from mental disease or schizophrenia, or some people suffer from being killed, being chased by other people, and also we can use this formula, okay? And this we can use a 黄连温胆汤. Actually, I know the formula of 温胆汤. 温胆汤 has many purposes, but when we add 黄连because we want to cure heat, so this formula is able to cure heat and also to deal with that. Okay, I'm so sorry that we have just finished one, but I just want to give you guys a break first. Okay. Yeah, welcome back to the class. If you guys want to have lunch at 1 o'clock, we switch now. Okay, this is 10:44. So we get 3 more cases to go. I found that the following case is 黄疸, this is jaundice. It's a very large topic for us to share because it's really common for these days. Okay, and usually, how can you know people who suffer from 黄疸? You get 3 yellows. 1 yellow in the eye, 2 yellow in the skin, 3 yellow in the urine. If you find all these 3, you get those 黄疸. That means yellow in the gallbladder. In Chinese, 黄 means yellow, 胆 means gallbladder. So you get this is always a concern of yellow color and also the problem of the gallbladder. Okay, and usually we can in Chinese medicine classics literature you divide the jaundice into yang wang and also the yin wang. That means yang jaundice and the yin jaundice. Okay, and in however, when you are studying Western medicine, you got the name of many diseases, just like hepatitis, cholecystitis, and also what we call it it's kind of all sorts of names, just like cirrhosis and also hemolysis, and also sometimes because of the other problem, we call it atrophy. That means the constriction of the liver. The liver will have some abscess or the atrophy. All those will all belong to the category of the differentiation. Okay, differentiation of the symptom in this jaundice. How about the cause? Usually when this type of disease, we always have 2 categories. 1 external, 2 internal. Okay, exteriorly because you suffer from exterior symptom, common cold, flu, or any kind of disease coming from outside. Second, internally, will not be away from 2 reasons. 1 is the eating disorder. Second, emotional disturbance. Okay, that means internally always concerned about the GI problem. GI means gastrointestinal problem. Okay, and we also concerned about this is because of the internal injury, and then we can try to divide all those different patterns as follow. 1, exteriorly. For exterior, of course, as you guys know, wind is the leader of all evils. Wind can bring in cold, heat, dampness, also dryness inside the body. And this disease of the jaundice, we can just know that this is because of damp heat. Whenever we concern damp heat, it means damp and heat together. Sometimes in some kind of disease, just like what we call it the pestilence. Pestilence, that means some epidemic or formulating pathogens. And this thing coming into the body and form some kind of disease which obstruct the flow of blood and qi. inside the body, especially in the middle jaw, in the middle energizer. That means in the spleen and on the spleen and also the stomach. Okay, and when this water or dampness, obstructing or accumulating in the middle jaw, and what will be the cause? What will be the result? The result is that the liver will lose its normal function. Anybody remember the function of the liver? The function of the liver is very important in our body, right?
Distributes the blood?
Yeah, according to the Western medicine, it's going to distribute the blood, right? It's store the blood. It's store the blood. Okay, the liver is going to store the blood. If you don't have enough store the blood, not insufficient, but you can got a lot of problem. You can see, you can hear, you can grasp food, you can walk, right? However, the the liver has a very important function because it's going to express itself, right? If once it get stuck, that means the qi will stay inside. We call it liver qi stagnation, right? And the other thing, since gallbladder and also liver, they're close together. Many people, once they get the liver problem, just hepatitis, is always, you always will get the gallbladder sick already. So in this time, the gallbladder will secrete his bile juice in an abnormal way. Okay, and this bile juice will pass outside and into your skin, into your eye, even if found in your urine. That's why you can see your urine getting yellow. And in this case, Chinese medicine practitioner will always regard this thing as damp heat in our lower jaw, lower energizer. And here, if the case got worse, and then this hepatitis will got some infectious will cause infectious to other people. Okay, and this will show that the heat not only in the qi level, it also go into the blood and yin level. This is when the disease get into acute and also severe case of jaundice. So you can see various degree, various seriousness of this kind of jaundice in here, this case. Second, internally, as I mentioned before, the internal problem always caused by what? Always caused by either the food or the or emotion. Okay, whenever you get a food, the diet disorder. Yeah, this is because we sometimes eat too much, sometimes eat too little. In this country, in this city, many people just forgot their lunch. They do all the business, they do all the study, so this is why we get eating disorder. Some people, because they're talking the business with other people, they eat lots of, feast. They do of banquet outside, and it always cause them, overloading in their spleen and stomach. Okay, and if their spleen and stomach get too much work, it will stop working either by on strike or just cannot transform or transport the food away. And what is left, according to Chinese medicine theory, what we eat is water, composed of water, and also the grain together. If you cannot transform all food away, leaving what's left in the stomach is water. What's left in the spleen is water. That means the water accumulation in our middle energizer. And so what's the result? The result is it will hurt about our liver and also our gallbladder. Obstructing is normal function. Okay, and the other thing is not because of overeating. Sometimes you eat the same thing, but you eat the cold nature of food. Okay, you eat too much cold food and also too much raw food. Raw and cold food is no good to our body according to Chinese medicine. So if people eat too much cooling and also damp food, of course it will hurt the function of our spleen, and the spleen is not able to perform its own function, and then leaving all the water, especially cold stagnation in the middle energizer. It will obstruct the flow of the gallbladder, the bile juice, and this bile will also transform the outside of the body and accumulate in our muscle and also skin. So in the jaundice will be formed. Okay, and the fourth one may not because as you guys know, there are three types of etiology. One is external cause, the other is internal cause, and third one is non-external, non-internal. Okay, now the fourth cause of the jaundice is because of some, the gallstone and also ascaris. Ascaris is not common in this, time of the 21st century, because in old China, in ancient China, people get very, very bad sanitary system, and kids always eat their finger with all those eggs of the tapeworm or roundworm or rubworm. Okay, they get all the parasitic infection in their body, and this is one of the reasons they got the jaundice. And the other reason because of the stone. Nobody will eat the stone inside. Nobody will get the stone inside the body. This stone actually is the crystallization of the bile juice, because you get too much bile, right? Bile juice, and this bile juice will stop at the middle of the bile duct. The bile duct is linking between the gallbladder and also the duodenum, and in this part is really short. If you get too much bile juice, the bile juice will stop there and crystallize there and become a stone or even a sand, and this is what we call the gallstone. The gallstone, once stopped there, you will feel pain, and then later on the bile juice will also overflow to other parts of the body. So any people they feel the pain at this position, that means this is equivalent to our gallbladder. So you will suspect there will be something wrong with the gallbladder or in secreting of the bile juice. Okay, so this is another cause for that. The fifth one is because of the accumulation. This accumulation, nobody knows. Sometimes there will be some masses accumulated in our abdomen. Some women, they get the masses in their uterus. Okay, all those things will also the cause of the jaundice, and this is because of the obstruction. Then these masses, originally is not masses. Sometimes because of the chi stagnation, and if you do not take care, the chi stagnation will develop the blood stagnation. And blood stagnation, of course, later on become tissue stagnation, which is sometimes we call benign. Of course, a good one, right? For bad one, we call that malignant. And of course, the malignant cell always turn to the cancer cell later. Okay, so you guys have to take care about this, the stagnation there. Okay. Somehow here we go to the summary. So the summary here means that the etiology of the jaundice is because of the damp heat. Sometimes it's cold heat. In considering about those organs, and then we can know that which is the damp heat, which is the cold heat. Just considering other factors, other concomitant, signs and symptoms. However, we know that damp and heat most of the time come together. Okay, and for those people who get easily get the heat, for example, the skinny people always get the fire, while the fat guy always get the dampness in this case. And if therefore there are many different causes, and this development will not be the same for every people. So in this passage we just talk about the different pathogenesis of the case in the jaundice, which I'm not going to deal with too much. You guys just refer to the summary page, and then you will know that. Okay, what we are going to do now is to concern about the mechanism. Use the page you have, the same page you have. You don't have this one, sorry. Yeah, no, go ahead, go on. Yeah. You have this diagram in your book. Okay, it concerns all about what, how the exterior symptom affects the body, and which will form heat and become of yellow jaundice. From yellow jaundice, of course, will become how it affects the middle jaw, and also how the liver and also the gallbladder being affected. Do you have this one? Okay, just we'll do this one. I'm sorry that because I got this one. I thought you had this one, but no problem. You can just make a PDF to you. I think, yeah. So this is good for you guys to know. Well, of course, you don't have this too, right? And this is very important. Yeah. Go down.
No, we don't have
No. Okay, this one. Yeah. For this one, we just want to differentiate between yang jaundice and yin jaundice. Okay, for yang jaundice, yin jaundice, of course, you can find the color is more bright, while the yin jaundice is a dull color, dull yellow. Okay, it's concerned about what the for yang jaundice we have a more heat. For yin jaundice we have more dampness in this case, and then you can just find the treatment. Of course, treatment is different. Sometimes when we treat the damp and heat, we consider more damp, more less heat, or less damp, more heat. And we can use different treatment for doing that. Okay, so I'm not going to concern too much, and then we just move to the differentiation. Yeah, we use the diagram to sum them out, but however, yeah, one more please. Yeah, the when we consider the causes of the disease of the young, okay, and another yin, we sometimes we discriminate between the young jaundice and also the other jaundice, we call it Wei jaundice. Okay, the reason is that sometimes the young jaundice will suffer from more heat than them, and also so that the liver and gallbladder cannot operate normally. And this is the characteristic of the yellow, the yang jaundice. Okay, and the other thing is the we, which will not appear in your examination. Okay, I just give you more information. The we, the we jaundice is always caused by worm and food. Okay, this is also common. Of course, both of them will cause obstruction of qi and blood inside the body. Also, the result is the same because we got all the yang here. Okay, so this is what we are going to talk about that. And this one, of course, we go to the treatment type. Okay, whenever we call the treatment on the different patterns. First of all, let's consider the yang jaundice. Okay, as I mentioned before, yang jaundice there are three types. One is more heat than damp. More heat than damp. How do you know say more heat? Because when you see the color, one is the bright yellow. Bright yellow, that means heat more than damp. Okay, so light is shining, brightness is shining, and then when we look at the urine will be dark and scanty. And this way we call it more heat than damp. Okay, and also there are some accompanying symptoms, just like thirsty, the dysphoresis, and also the fullness in abdomen, and some of them contain nausea and vomiting. Okay, and the most important way to distinguish it by looking at the tongue condition and the pulse condition. You can observe that the tongue this time will display what is a yellow tongue, and with the red tongue with the yellow coating, while the pulse, as I mentioned before, are wiry and rapid. That's why in the sample question, we always mention about wiry and pulse. What does that mean? That means what? It means the liver get the heat, or gallbladder get the heat. So when you guys see the cup here, TAUT, same as wiry. Okay, you can just correct this one because according to the college, they use the word WIRY, wiry instead of TAUT. Okay, so be careful with that. Okay, and next, when we do analysis, we can just say that this analysis is based on more heat than damp. So because of the gallbladder and also the urinary bladder cannot get rid of the water, so we can have more bowel juice there. And when bowel juice going up, of course it will cause dysphoria and also nausea, dry mouth, cause the tongue displays yellow coat, and all those are because of damp heat in the gallbladder. Okay, and also the liver. And how can we deal with that? You guys remember, anytime we get dampness, of course we have to resolve or eliminate. Some people call it eliminate, some people call it resolve the dampness. Heat, of course, the only way to deal with heat is clear. So clearing heat and also removing dampness is one of the ways. Or in your book you say eliminate dampness. I think the same. The examiner will accept both terms. Okay, what formula we're going to do for those two people who are going to major in Chinese medicine practitioner? You should know there's a very important formula called the 阴晴浩套. 阴晴 Hao Tang, to make of Yin Qing Hao, which can deal with mostly the dampness. I mean the dampness in damp heat inside the body. And this is the modification. Of course, we're not going to deal with modification. You guys just need to remember the representative formula. I think this is good, right? And this is the formula. I'm not going to spend too much on it. First time, heat more than damp. And second time is dampness more than heat. Please, Amanda. Second time, go ahead. Yeah, second time is heat more than damp more than heat. In this case, you can see although they get yellow face, but the yellow coloration is not as bright as an orange. It will get the color will be douch yellow. In that case, it's not bright as get the heat. And in the accompanying symptoms include what? Fever, and the body suffer from heaviness. As I mentioned in the last lecture, any people suffer from dampness will get the headache has wretched by bondage, and we also got all the heaviness in the body because the joints are full of water, so you get heaviness, right? This is a heavy sensation in the body, and always you get thirsty. But the thing is, you are not getting the real heat. So if we are given a cup of water, we just put it a little bit and just spill it out, because this drying only in the mouth part. Our body is full of water. So for people suffering from damp heat, they are not going to drink, but they still feel thirsty. Okay, but thirsty but not to drink too much. And this another characteristic, they feel what? The chest, fullness in chest. Why? Because the dampness here will obstruct the upflowing and also downflowing of the qi and blood. So you get anything stuck in the body, we got the pain there. Okay, and also you can see this kind of people will get the fullness in the abdomen, and they do not like to eat greasy thing, and they will have nausea. And the other thing is, any people suffer from damp will get the diarrhea. Remember, diarrhea mostly caused by damp heat. Sometimes because of the deficiency. Okay, so whenever some people visiting the clinic getting diarrhea, you have to make sure whether it's caused by damp heat or caused by deficiency. Questions?
If it's a yang jaundice, why would it be more dampness than heat? Wouldn't that be a yin? If you have excess dampness, wouldn't that be a yin jaundice, not a yang? How can a dampness overpower heat in a yang jaundice?
No, to make it short, and just say more heat than damp is yang jaundice. More damp than heat, that is a yin dampness. But even in the yin dampness, we still find both damp and heat together. We cannot find one thing is more dampness. The dampness will overcome the heat. No, that is not jaundice. Jaundice should have both damp and heat together.
It's relative.
Yeah, relative. You're right. Right, just measure. Okay, just as we have chilly and also chill and fever in exterior symptoms. Okay, how can we distinguish whether exterior cold and exterior heat? We always measure the relative. Okay, relative portion of that. You're right. Okay, so I think the most important thing you guys will notice in this slide is the tongue condition and the pulse condition, right? And here you got the thick and greasy coating, which is can be distinguished from the yang jaundice, okay? Because in the yin jaundice, it's more damp than heat. So you can see the tongue coat is more damp in this case. And also the pulse, we get more slippery. Sometimes we get what we call soggy, S-O-G-G-Y. That means sometimes it will more soft and also more, thin and soft on the surface, which is soggy. So here it means about low pulse and weak pulse is not enough. You can never more S-O-G-G-Y, soggy. Soggy pulse can also one of the pulse for people getting dampness. Okay.
Retention of cold damp pathogen. It's an excess or
cold damp pathogen, right?
Yeah,
I cannot say because whenever you just mention about cold and damp, but whether it's excess and deficiency, we cannot know. It depends on the pore, whether the sweat pore is open or not. But if you get stagnation, of course, most of the time it's excess. Cold dampness, yeah. stagnation inside the body.
Retention of blood status is an excess.
Exactly. Anything visible in your body is also an excess, just like stagnated blood, undigested food, or cold dampness, because of phlegm. All those things we can say most of them belongs to excess. Okay. In analysis, we know that since the bowel juice cannot be taken away, it's staying in the body, so it make you all feel yellow. And since this is the dampness more than the heat, right? Since the dampness belongs to the yin pathogen. So in this case, we are going to have some more dampness instruction inside, and this dampness will obstruct the flow of qi and blood inside the body, make you feel heavy. So heavy sensation is because of dampness. So next time when you see any patient suffer from heavy sensation in the body, you just doubt whether he suffer from any dampness inside the body. Okay. Of course, if you get dampness in the stomach, of course, does not like to eat anything. This is why you hate eating the greasy food and get away from any fatty substance, fatty food. Okay. And the tongue, as I mentioned before, is greasy and yellow. Okay. And also the pulse, you get the wiry and slippery pulse there. And what we're going to use, okay, you guys, if you are going to major in acupuncture, please just note all the signs and symptoms. Okay, just note all the pattern. But for those of you who major in TCM, of course you remember we are using this Yin Chen Wu Ling Shang. Wu Ling Shang is to get rid of water. Yin Chen is specifically for removing the damp heat in the gallbladder and the liver, right? And this is the modification. We are not going to deal with too much. And the third type, please remember, the third type we call the excess heat inside the body. And this excess heat is because of what? It's because of your acute, the sudden onset of the heat inside the body. And at this time, you will find the color of the yellow in the face is much more than the yang huang, because the onset is really sudden in this case, right? So the color will be more than yellow, sometimes golden yellow in this case. Why? Because in the same time you will find high fever, right? If the jaundice coming with high fever, of course it will be very serious. Why? Because when the people get high fever, you will got what we call the delirium. That means a wild talk. Some people will talk without any conscious, and then without any meaning. And all in addition, we go very thirsty. So exactly, this is a kind of fire, right? Heat more than fire. And sometimes we even call it toxic. In Chinese medicine, toxin means what? Means extreme heat. It doesn't mean the poison, okay? But here the toxin will cause people getting sick, getting fever, getting delirium, and sometimes even you will find the blood in the feces, the blood in the stool, blood in the urine. Or sometimes you can see some, the bluish patches on the skin. This is internal bleeding because the blood coming out from the capillary under the skin. Those sometimes because of the too much heat inside the body. Okay. In this case, you find the tongue have a very special color, which is not red. We call crimson, crimson. Crimson, that means deep red. Okay, it's purple as much more than color, just like those color is crimson, just like the red day. Yeah, this is crimson. And then you got the tongue cold yellow, but in addition, besides yellow, the tongue cold is dry. What does that mean? Because the heat consumed mostly the body fluid, and leaving the tongue cold is dry. Okay, and the pulse, of course, remain wiry and slippery. Okay, wiry, of course, is straight. Slippery, that means you're going striking your finger in different direction. It means what? Stagnation, and also strong heat. Sometimes some people get, in the contrary, they get a fine and rapid pulse. Why? This is very important. Can you see the two different? One is tough and slippery. The other is fine and rapid. The reason is we have many cases in our student clinic. Many people get hit. Not the first time they get hit when the disease onset. They sometimes get yin deficiency. Okay, yin deficiency and then leading to the hit, and this hit will be stronger in this case. So sometimes we get a fine rapid pulse. That means it start from the beginning of the yin deficiency. Later on, when all the water consumed and the body will become hot, this is time we get the fever. This fever is because of empty heat. So the pulse will sometimes will be big, sometimes large, sometimes will be slippery because of the jaundice. The jaundice due to the excess toxin here, right? So you can distinguish these three types of pulses here. Okay? Yeah. Analysis. The analysis telling you guys why we. Yeah. One more, please. No. Yeah. The analysis telling you guys why we got all those diseases, because this is the what we call it the dam hit, with the toxin. Dam hit, coming with the toxin, or we got the toxin is coming to the highest stage. So this is why the onset of the disease is so quick, and then it causes other fever and also the thirsty. Why? Because all those fever force the bile juice outside the body and leave it in the skin and the muscle. That's why you get the golden yellow color in the face. And also the heat will force the blood going astray. The blood originally flowing inside the blood vessel. But when there's high heat, high fever, the heat will force the blood bursting open, break off the capillary. So some blood will flow outside the blood vessel and leaving that in the skin level. So that's why you get all the blue color, all the burst in the skin. That's because of the toxic heat inside the body. How do you deal with that? Again, heat, peace, clear. Okay, toxin, of course, you can remove. So what we're going to do is we curing heat, and removing the toxin from the blood. And also, sometimes it causes people unconscious. Have you ever seen those works just like the delirium, just like unconscious? So if the patient get unconscious, you have to add one more, resuscitation. Yeah, inducing resuscitation. So we're going to do two things. One, curing heat. Second, removing toxin from the blood. Third, if the patient unconscious, this will resuscitation, inducing resuscitation. Okay, so to get him awake in this time. Okay, those are the important issues for this thing. Okay. And also, what are we going to do? How can you save the patient from curing heat and also removing the toxin from the blood and also resuscitation? There's a very famous formula in Chinese medicine called the 细脚帝王汤. 细脚帝王汤. What is 细脚? 细脚 is the horn or the rhino horn. Although they are forbidden, you can't use that. But instead, in practice, you use the buffalo's horn. In using buffalo's horn, of course, you do large amount. If you just use about 3 grams of the rhino's horn, now you have to use about 60 grams of the buffalo's horn, okay, in order to achieve the purpose. This is what we call the 细脚帝王汤. 帝王 is another Chinese herb to cool the blood, and also to clear the blood heat inside. Okay, so this is the formula. And the example, of course, I'm not going to deal with that. The Yang Wang, yeah. Now we use the Yin Wang. That means the Yin jaundice. We talk about very vigorous disease, just like fever, delirium, yellow color, right? Yellow coloration. Now we move another type of jaundice, which dampness more than heat. So this is Yin Wang, Yin, jaundice. And Yin jaundice is also caused by cold damp. Yeah, you're right. This time we consider the cold damp. Okay, even this is a cold, but we start as a Yin because Yin corresponds with the cold, right? And yeah, one slide more. Yeah, that's right. When you talk about the cold damp, that means you can see the face color is dark yellow. Sometimes people they have the charcoal when putting on their face, this charcoal yellow is really, really damp and dark, okay, and light smoking. And the other thing is he got all the symptoms of deficiency now coming to the eighth principle. This yin wang always yin jaundice always concerned about deficiency. So you see all the symptoms of deficiency, like tiredness, deficiency, right? Anorexia, that means eating a little, deficiency. Okay, also loose stool, deficiency. Tasteless in the mouth, deficiency. No thirsty, okay. All those things, majority of them is a deficiency syndrome, okay. Especially you say, okay, when you are asked to explain the reasons for diagnosis, you must know the characteristic of each symptom. For example, tasting in the mouth. Everybody knows spleen deficiency, right? For example, you see, okay, you can see loose stool, sometimes because of spleen deficiency, right? So you have to explain each symptom by your own knowledge. So this is the time you build up your data bank, okay? And also the tongue condition, either confirm what we have. Like, for example, the tongue body, pale tongue body. Of course, pale tongue body means not enough blood. And in other case, secondary is not enough qi. Why don't you have enough blood or qi? Because your spleen cannot produce enough qi and blood, right? So spleen deficiency. Cold, white cold with greasy, that means more damp than water, right? And also this time you also look at the greasy and also fur, greasy fur, okay? And also how about the pulse? Pulse is somewhat steep and rapid. Remember, whenever we deep pulse, that means interior syndrome, okay? Slow and weak always carries a deficiency, right? Understand? Good. And what are we going to do with that? Sorry, I'm still on the herbal prescription time, right? So what we're going to do with all those functions, of course, whenever you have deficiency, either acupuncture or herbal prescription, we're going to tonify. Right? Yeah.
Sorry, can you go back when you were talking about pulse there? You said slow and deep are okay. So slow
Okay.
deep is interior.
Okay.
Why rapid? Doesn't rapid usually mean heat?
Yeah, this heat is because of deficiency heat.
Okay.
Sometimes when you have not enough water inside your body, the water going low, and then it seems to me that So rapid means heat. This heat include interior heat or exterior heat, empty heat or real heat. Okay, remember? Good. Good. So moving down here, what are we going to do? If in case of deficiency, of course, we need to tonify, right? To tonify the body. However, when you tonify the body, you have many choices. One, either you tonify the qi, or in this case, if you found the jaundice is so important, we're going to tonify the spleen. In tonify spleen, we're going to use the word strengthen the spleen. Some people like to use the word invigorate the spleen. So either strengthening or invigorating, they are the same. And of course, you regulate the stomach. However, for me, I will use another word, right? Because in Chinese, 我会, we use another way to harmonize. So in here, instead of strengthening the spleen and regulating the stomach, I would like to say invigorating the spleen and harmonizing the stomach. This is my way of expression, okay? And also the warm and removing the coolness. I think this is really important. First of all, you warm up the whole alimentary canal so that you can remove the cold dampness. Understand? This is very important. So accept the later part. In order, you can just change a little bit the first half of this sentence. Okay, this way. Okay, what are we going to use? 阴晴疏浮汤, and this is also another representative formula. 阴晴 is going to deal with jaundice, and 疏 is going to absorb the water by to improve the efficiency of the spleen, and 浮 is giving more heat to the kidney, so it's tonifying the kidney yang here. So we use this formula. And the second pattern for the yin jaundice is the retention of blood stasis. That means you get stagnated blood inside your body. What will be the symptom? The symptom is you get yellow, okay, dark yellow body and eyes. It's not only this case. For me, I would like to add one more. If you get the stagnated blood inside the body, you always get pain. You pain over the body because stagnated blood will not go away. And how do you know that these people get stagnation? Besides, he telling you that he get body pain, he get also sometimes we can look at his face, look at his tongue. Okay, as I mentioned before, for people suffering from blood stagnation, you get a blue or purple tongue, or the tongue with blue stain. And the other thing, if it gets serious, you can get some spider mark on her face. Okay, and those is, and also the face sometimes is not yellow. Even you change into what? Into some purple or purple stain in the face. And also they get the hypochondrial region here, fix the pain. Whenever they fix the pain, that means it's because of cold dampness, or because it's stagnated blood. Okay, there. And then you can, the stool getting black. Why black stool? Because the stool mixed with some blood. Why black, not red? Because the blood comes from far away, not the distant. Okay. Actually, when we mention about hemiphasia, that means the stool mixed with blood. We always concern about whether the blood comes from the stomach, or comes from the mouth part, or the blood comes from the large intestine. If it comes from the large intestine, we will get red, fresh red. If it comes from the far away, it will come from black. Because what? Because over a long time, the blood get clotted, the blood get oxygenated, so it changes from red to black here. Okay, so analysis telling us that since the stagnated blood will cause some obstruction to the flow of the qi and blood, and the new blood cannot form, so that's why our face always get purple or the damaged black color. And also you can see the tongue, even the tongue, you get the blue stain. And in addition, you can see under the tongue, we get a hypoglossal vein also get really bulging out and also get thick in this case. Those are the signs and symptoms of stagnated blood. Okay, and number 3, before we do number 3, I just tell you what the prescription. And the prescription here, of course, we will get those prescription we use it. So sorry. This is our prescription. Okay, the prescription is this is going to remove stagnated blood. Okay, and down below we got the 4th type of the the 3rd type, the 2nd type. Let me see. The treatment principle here. Sorry, I just forgot to mention the treatment principle. Treatment principle is most important, right? Whenever you find any stagnated blood, please remember one word. Okay, move qi and activating blood. Move qi and activating blood. Okay, those are very. How can you activate the blood? How can you move the qi so that we remove the blood spaces? So we are using this formula. This is in this way, right? And also the 3rd type is about the deficiency of spleen and blood. First of all, deficiency of spleen, that means the spleen cannot perform its own function. So there's accumulation of dampness there. And of course, the dampness also always include the blood. When the blood is deficiency there, you've got all the symptoms, just like blood deficiency, or you can, usually, people suffer from blood deficiency, you get a pale face, right? But if you get blood deficiency with the jaundice, of course your face, the pale face will be covered by the yellow coloration. That means still you get the yellow face. However, the yellow color in your eye and your urine will not disappear. Okay, and the urine is really get dark and obvious in the morning. You guys will know in the morning, the first time we go to the toilet, color always yellow. But for these people, their color is remain yellow even after that, right? For us, the first time yellow, second time and then the pale and the clear is okay, a light yellow. And when you consider this case, you must look at the symptoms. The symptoms not just like tiredness, weakness, lassitude, and also all those symptoms display the situation of weakness and also deficiency, right? So you can find that also there is some patients suffer from palpitation, and shortness of breath. This is because of Qi deficiency, right? However, the blood deficiency also brings the Qi deficiency. So you can still find the symptom of Qi deficiency here because Qi deficiency always brought by blood deficiency. Okay, and also you can see the tongue is pale, and also the coat is also white and thin. And what makes this symptom more significant? Please remove. Get any? Yeah, that's right. Yeah, this one. Yeah, that's right. That's right. And this one make it more distinguished. The white fur, fine and weak pulse. Whenever fine pulse and weak pulse, we have a deficiency here. So here we also got this name as what we call it the jaundice of the deficiency type here. Right?
Why they cannot rest at night?
No,
Why redness in the daytime?
yeah, because
Tired, they should.
yeah, you're right. There are many cases in the clinic that many people even get tired before they sleep. Once they lie down, they cannot sleep. You know why? Because of stimulation. Stimulation happens. This is according to Chinese because of the fire, some of the liver fire. I think in this case, because the people suffer from jaundice, also sometimes because of the deficiency of yin, and they got fire there. And in the previous case, our class may have a very good reason to say that why the people cannot sleep well at night. Yeah, this one. Restlessness at night, right? My explanation is because they got heat. Yeah, this heat is because of the deficiency of blood and also the spleen, right? This is also, and one type of insomnia is caused by excitation in their brain. The other type of insomnia because of the deficiency. During the World War II, many people cannot sleep because they don't have enough food, right? You got to eat a little bit so that you can sleep. Our stomach is very, very wonderful. It's wonderful. If you get a full stomach, you cannot sleep. If you get empty stomach, sometimes you cannot sleep too, right? So this is the reason why we can't sleep with this kind of deficiency, okay? And this, we are going to see the treatment principle. Next, please. Okay. Whenever they have spleen deficiency, remember this one, okay? Invigilating the spleen and warming the middle jaw, the middle energizer, and in order to nourish the qi and also the blood, okay? Those are the important point for it, okay? And prescription is very important formula. Not many Chinese practitioners will know this name, 小煎中汤. Next, please. This one, 小煎中汤. Okay, 小煎中汤 arises from a very famous formula which is called the 桂鸡汤. 桂鸡汤 originally is for exterior symptom, but when you modify a little bit by double the dosage of 白术, it become herb curing the chronic disease, right? Just like cure the gastritis, and also it can deal with the this kind of yin deficiency, yin jaundice due to the spleen deficiency and blood deficiency. So 小煎中汤 is a very useful herb here. So for those people who are going to major in Chinese medicine, should bear this one. Right? Okay, this is appendix. Appendix, it also repeat what we have mentioned before. So we just mentioned that Wei Wang is another type of the jaundice, which can be grouped under the yang jaundice or the yin jaundice. Okay, so Wei jaundice can be put in both categories. So how can we deal with that? In the previous session, when we mentioned about the comparison between the yang jaundice and the Wei jaundice, we just make it to how to discriminate them, right? But here, okay, we try to look at the treatment of the disease of this Wei Wang to regulate the spleen and regulate the stomach. Okay, so whenever you get Wei jaundice or obstructive jaundice, we are going to tonify our body by regulating the spleen and also the stomach, and nurse the qi and blood, the qi together. So what we are going to do is this formula. 王岐健中汤. What 王岐健中汤 is the 小健中汤, we put 王岐 inside, so it becomes 王岐健中汤. Okay, those are the modification of the formula. So as I mentioned before, to be a TCM practitioner or acupuncturist, you have to advise the patient that they have to have some lifestyle advice. So here you advise them to have more rest, and then you advise them in the diet. Also advise them, if they get the infectious type of jaundice, they must keep away from the people, right? And also to have a good emotional life in that case. So this is the measure of that. Okay, now finally we come to the acupuncture. Okay, there's no general point for the jaundice. So first of all, we talk about the heat more than dampness. So all you guys are going to major in acupuncture, you should know that acupuncture one is important because this one concerns about the gallbladder. So the best super on the gallbladder is very important. So first of all, the gallbladder one for the best super on the gallbladder, BL19, BL20, 18, yeah, BL19 is the best super for the gallbladder. This is called 胆枢, yeah. And the other point which we find useful is the GV9, 滋阳. And this 滋阳, yeah, you can see this one, and also on the lower limb, heat shield bond for the sixth spiral, we count the GB34. GB34 is very useful. How useful is that? Because this GB34, one, you can deal with the tendon of the body, but for the jaundice, since GB34 is the lower heat shield point for the gallbladder, so we can just deal with this point. And in addition, since we want to use more water to extinguish the fire, okay, to clear the heat, so we consider the water point of SP9, spin 9, which is we call it the 阴陵泉. Since liver and gallbladder, they are brothers, so we consider the 大众 LV3. So in severe case, we can just consider all heat point. Even in serious syndrome, when we got heat, we consider this one, 聚集, right? The LI11, and also the back, we got the GV14, which is 大椎. 大椎 is also upon releasing the severe heat here. And this here, remember this one. Next time you get car sick, you're going to vomit, just make a point here, and make a point here. Here's 内关, which is a PC6. Since this disease concern about the gallbladder, and gallbladder have some association with the liver, so we have to release the heat by using the point here, 奇门, LV14, this point. Okay, and the other one is a 肌高. 肌高 actually is for the constipation, but here 肌高 helps the body to release more heat through the downflow. That means if you want to relieve your constipation, we always consider TE6, which is 肌高. Okay. Of course, if you suffer from the depression, of course you can consider other points. Okay. And second, damp more than heat. You get dampness more than heat. Of course, it remains the principal point as GV9 滋阳, and also the BL19, which is the 胆枢. However, besides this GV9, BL19, GB34, and LV3, SP9, we do have three more points to consider. One is the CV12, which is 中脘. Okay, CV12. 中脘 is here, just between the navel and also the sternum. We got hit this point, right? 中脘. This originally is for what? For the stomach. But here, since stomach is covering the whole alimentary canal, so we charge a little here. The other point you should remember is the 足三里, that means ST39. ST39, which is strengthen the spine, so that water can be removed. Okay, and also we remember one point Wei Yang. Why do we consider Wei Yang? Wei Yang, I mean this one, BL39. Wei Yang is also usually Wei Yang is to deal with what? The Sanjiao, that means the triple warmer. So when you deal with the triple warmer, of course you are dealing with all the upper gel, lower gel, and middle gel to remove the heat there, right? So this is one of the points. Nausea, of course, PC6, and also the if some people get nausea, and also the a hypochondriac pain, you can just consider the 3 points I mentioned before. That means LV14, LV13, and also TE6. Okay, and the third pattern for the Yang jaundice is the damp heat with exterior syndrome. Yeah, remember exterior syndrome. Okay, of course we can just consider some exterior point for that. However, we must put the damp heat in the first place. So we still consider the the BL19, GB36, GB35, 34, and one more point we call the Yi is the what? Is the Yi. This Yi point. So we still mention here, right? This actually belong to the GB24. I can't find here, right? Can't find it. Actually, this point is GB34. 24. Qiman is we got Qiman, we got Ji, we got all those points down here, right? And then in case getting fever, yeah, you got there. In case of getting fever, of course you get the Daizhi, that means 14, and also Juqi, those are hit. And how about alternating chill and fever? This is the term we have this morning the first time. Alternate attack of chill and fever. That means the disease happened in Xiaoyang. This is the first time I mentioned about the terms in the 6 channels. Okay. Now you guys remember, whenever you see this, you must say this disease belongs to Xiaoyang disease, so that you get an alternate fever in children. And what are you going to do? This time you're looking for TE5. TE5, we got the 外观, that means 2 inches from the middle here, 外观. And the other is a brother with a 内观 with PC6. Actually, this is the outside, while the PC6 is inside. Okay, I mean in the in position. And also GB41, which is 注临席. Okay, 注临席 is what? Is also the which point? The 圆 point of the GB. Okay, so those are the the acupuncture point for the Yang. Yeah, the Yang. I mean the Yang jaundice. Okay, and how about the dam? Yeah, we got this one already. Yeah, 4th, please. 4. Yeah, stagnation of blood status. In case of any stagnation, we consider the general point. Besides those, please consider this one. 打坏. Okay, GV20. Why you get here? GV20 is a point for tonification. In order to, the bull tonify the qi and also tonify the body. So several point you can always tonify, just like ST36, just like this point. I mean the GV20. And GV26 is here. Okay, this is Ren Zhong. Some people say Shui Kao, the same thing. Okay, and here you can just have some people. If some people got the unconscious, you can just consider Ren Zhong, and sometimes the tip of the finger. Okay, we got the Xishan. That means also you stimulate this area, right? And those are for stagnation, and sometimes even falling unconscious. You can consider this one. And lastly, you get the excess, toxic heat. Toxic, of course, you guys can consider all the principal point. Yeah, we got this. I mean, GV9 and also SP9, BL20, Pishu. Pishu is the best support for the spin. And of course, the Dansu, that means the best support for the gallbladder, and also the Zhongguang. All those points I mentioned before, right? There's nothing new for that. Moving down to the 6th type, we can say cold dampness. Whenever cold dampness, of course, you have to tonify. So for me, besides the acupuncture, I would like to ask you guys to do some motivation work. Yeah. So plus A here means what? Add motivation. That means besides you're dealing with the jaundice, you guys consider below the navel there are 2 points. One is CV4, CV6, 关元气海. All those points can be tonify yourself by tonify your blood. Also tonify the qi. The qi tonify is very important. So you can see 关元气海 those points. And also the other is the 命满. Don't you say 命满? 命满 is how GV4. Usually we take that with people getting lower back pain. We consider the GV4. But in the case of people getting qi deficiency or deficiency of many types, we also use motivation to deal with this point, U4. I mean this is GV4. Okay, so this is useful too. No 6. We're going to do 5. Yeah, 5, 6, 7. Yeah, we're going to do on 7. Thank you. 7. Yeah, this one. Deficiency of spleen and blood. As I mentioned before, this belongs to deficiency syndrome, right? So in this case, we're going to tonify. What are we going to tonify? As usual, you can. This point is the first time you see 西海. This is SP10 here. How do you get it? You just hold your finger here, and then you can get this point, right? These 2 points are important in tonify the blood. Actually, in tonify the blood, we got 3 points. One is in the best shoe, which we call the gashu. That means BL17. First point BL17. Second point is the 血海. This SP10. All these 3 points can be used to tonify the blood. Okay, and also you can get gashu here, and also the blood here, and the other is the SP7. 老骨, and also the LI4, I mean the 合谷. I don't think you can use 合谷 to tonify. This is the first time I see this word. I'm not the author of this book, but for me, I will not use 合谷 to tonify. 合谷 is only to release the pain and also to release the heat, and not for this use. Okay, I will delete this one. Okay, and number 8, we cancel blood stasis. And then we can use acupuncture to hold on gong shui. Okay, gong shui is in the lung here. Okay, 孔居 is a point where we got the leukonetic point. No, this will be the secret point, of the lung, so that you can remove blood stasis. And now you can use LI4. I can use LI4 to remove the stagnated blood rather than using it in the deficiency. Right? This is this is unreasonable. So it's still you are using the tonify your stomach by using the CV12 and also ST36. And here use the G-cow, of course, to remove the blood. Okay. So what we are going to do is to move the qi and also activate the blood. On the other hand, we can just use other points to get rid of the dampness, just like the SP9. I mean the 阳明床, and the fever. Of course, we had this before. For diarrhea, remember these 2 points. Diarrhea, 天枢, because these 2 points can deal with diarrhea, and then some astringent effect. And of course, the last one is this one is this is special point. And for some disease, they get special point, just like insomnia, they got the IMAN, right? Just like the diabetes, they also got what we got the 胃温下视. And this one, when people got diarrhea, we also got another point for this. This is NCA3. Yeah, question.
Sorry, you said there were 3 points to tonify blood.
Yeah.
Spleen 10, bladder 17,
and also GB39. Okay, I repeat once again. In order to tonify the blood, one is the 血海, that means SP10. Second is 带椎, that means no, that is the 假书, this is BL17. The third point is what we call it the 旋中 is GB39. Those 3 points are sufficient for us to tonify the blood. Okay. Yeah. So lastly, is a summary of the guiding the formula. Yeah, for that. So you can see the formula for those we have mentioned before, and I'm not going to deal with that. Okay. And this what we do. Good.
Can I ask you a question?
Just a moment. Let me move this one too, because you can. Yeah. Okay. Yeah. Yeah. John, this. No, I'm not. I'm assuming this mine is yours. Yeah. Yeah, this one. Yeah. Question.
Why did you not use the connecting point GB34 when you were dealing with heat over dampness?
Yeah. Within the dampness, you are not going to GB40. GB34 is responsible for 34. You are talking about 34 or 37.
I was talking about 37. Is that not the connecting point?
GB37 we call the 光明 is for the eye, but we seldom use it for removing water. Okay, removing water, of course, we have a ST40, we have a KI7, and also we got some points just like SP6 and SP7. We seldom use GB37. 37 is not, although you can say this is some of the connecting.
I was talking about heat over dampness.
Yeah, the dampness, no. We seldom use that. No.
Okay.
GB37 is not a useful point for us. But by my experience also, or by some of the Chinese medicine literature, it didn't mention about the function. 光明 is for the eye. If you have eye disease, you just using GB37. Okay. Right? Thank you. So we are talking about the yin jaundice, For the cold dam, we are talking about using the the 黄芪健中汤. Okay, those novel. Okay, that's all for this topic about the jaundice. I think this is a very heavy topic, so we devote about more than half hour to that. So what we are going to do is now we are going to deal with the next topic, number 3. Concerning about the 隆鼻 means the urine retention. That means difficult to get urination. So I think this is a common problem for us because many patients suffer from this situation, always get the difficulty in their urination. And actually Chinese word 隆 and 鼻 also means the difficulty in urine. They are different degree in this case, right? So 隆鼻 in Western medicine, they always concern about, yeah, one more page please. Yeah, and always concern about some problem in the frequent the urine urgency, and other also concern about prostate gland enlargement, and also problem in the what we call it the urethra. And this is a very important situation. Okay, coming to the etiology and also pathogenesis. What is the cause of that? Now we can just see the cause just not far away from heat and also deficiency. And sometimes, yeah, you can just divide them either as excess and deficiency, right? For excess, we always concern about the lung heat. The lung control the water. So if the lung cannot perform its own function, it cannot distribute the water to other places and other places of the body. Okay, so this is the first reason. Second reason, some people get external trauma. You get a trauma, of course, it will hurt your abdomen, and of course, any people undergo operation, after operation, they do have some problem in the body, because we believe that if some channels in cholesterol are being cut or being injured, so the circulation of qi and blood will be affected. This is our belief. Okay, and the third reason is because of what? Because of the spin deficiency. And since it's everybody going to aging, okay, people over 55 like us always suffer deficiency problem in the spin. That's why you can't take too much food. After you take food, of course, you take 2 hours for you to get hungry again. This is because you get spin deficiency, right? And the other thing is the other organ you guys take care is the kidney. Kidney will become aging very fast. So that's why people will get forgetfulness, and they will get what we call the life gauge. The life gauge easily get failure, get enough fire there, so that you cannot warm your body, you cannot activate the urinary bladder. And the urinary bladder cannot get enough energy, it cannot produce urine, right? Remember, you guys, if you do not get enough qi, you cannot pee. Okay, if you cannot get enough qi, on the other way, sometimes you will incontinence of urination. So qi is very important. Sometimes it causes stop, sometimes it causes too much. So the two words in Wang Di Nai Jing always we see is one is efficiency, the other is excess. Here in this case too, right? So what we are going to do is we are concerned about the different patterns. The patterns. First one, excess disease. Excess disease, of course, called the hip. What is the pattern? When you see this pattern, you will see people, patients suffer from urinary retention, and the after the pee, they got severe pain. There is what called the pain sensation, painful sensation in the lower abdomen. Okay, and people, get the symptoms just like thirsty, scanty urine, and also, sometimes even the block, with the abdomen, with the fullness in the abdomen and distension in the abdomen. And since it is heat, his mouth, you get a taste, bitter taste in the mouth, and sometimes sticky. I got a patient complaining about his tongue. His tongue is always sticky. You stick at the upper jaw, stick together. I told you this is because of dampness. Because so in this case too, the patient suffer from the excess disease. Sometimes in the this kind of Long Bi can have the thirsty, but he's not going to drink. So whenever you guys see thirsty before desire to drink, this is always because of damn heat. In addition, you can find this constipation, red tongue with yellow coat. Remember, red tongue with yellow coat should most of the time be heat, and also the pulse is deep and also rapid. Rapid means interior, deep means interior, rapid means heat. Okay, this is one of the symptom for that. The other pattern is called the lung heat. Okay, the lung heat obstructing the qi and blood. In this case, since the lung is responsible for qi, so you can find the patient suffer from some kind of a qi stagnation, and then the breathing rapidly, then dyspnea. Sometimes dyspnea, dry throat and mouth, and also the tongue is red with yellow coat, and of course rapid pulse. The third time is because the liver qi stagnation. It's very common for us to see people suffer from Long Bi is because of qi stagnation. Because once the qi cannot flow through, what we see is the abdomen will have a very, very tough and also tight feeling for that. And in addition, that we got a bitter taste in the mouth. Of course, anything concerning about the liver, you will have the bitter taste in the mouth. Okay, and of course you can see always sign because the qi stay in the abdomen. And some people even get the hypochondriac, distension and fullness here, and those may not be easily seen. But if you guys are doing your diagnosis, you can quickly find that his tongue, the tongue of the patient, is red. The pulse is wiry. Okay, wiry means very tough. Okay. The last time is about the traumatic injury. Traumatic injury, of course, it will hurt some people falling from the height, or hurting the abdomen. We have the abdominal fullness. In this case, of course, after you hurt some of the body, you will have some blood stagnated there. So what you can see is the tongue always get blue color, blue tongue, and also a choppy pulse. Those are the severe case of the blood stagnation. Yeah. And we're talking about you're right, no problem. Oh, how fast. Yeah, this is right. And we are talking about the Shi Jing, that means a deficiency pattern. And on the other side of the pattern, you may find that the patient suffer from deepening block of the urine, and also they use much energy to discharge the urine out. This case because of deficiency, right? And symptom will be very, very slow. In this case, what you find is he's got a very weak qi and spin deficiency and qi deficiency, right? And also shortness of breath. Sometimes you got constipation. This constipation, not in constipation, sorry. Constipation only appear in the exercise stage. Here you got diarrhea or watery stool. So whenever you see all this kind of symptoms, you can just put the word deficiency. Okay, just like the watery stool and shortness of breath and the pulse is weak and also the tongue, you get pale tongue. All those you can see because of the spin deficiency and spin associated with qi. And the second pattern of the deficiency pattern is the kidney yang deficiency. Okay, although you can see pale face and also the shortness of breath, but the most important thing to find is the loin and knee. Okay, you always get laxative in the loin and knee, the lower part of the body, and also some people need a long time to get their feet warm once they feel asleep. This is also the symptom of the kidney yang deficiency, although it doesn't mention here, right? So check the feet is also a very effective tool. And of course, you see the tongue, pale white. The bears no much value for that. You just seen the pale tongue means, in the blood deficiency or qi deficiency. But you can see the pulse is fine, deep, and forceless. I think the forceless pulse will denote a very important, give a very important indication for the deficiency. Okay. Besides that, what we're going to do is to try to deal with the treatment. Now you get the excess time, you get the deficiency time, right? What are you going to feel with the excess time? Of course, we consider the 值班疾变. This PLO 54. This point is for what? For excreting the heat from the heat from the body, so that you also disappoint dealing with the urinary bladder. BL 54. The other is 阴陵床. So阴陵床. SP9. SP9 as I told you before. SP9 and SP6. All this point of the water. Why is water so important? Because our urine is made up of water. So whenever you have a blocking of urine or you have no urine, of course we will deal with the 阴陵床 and also the 三阴交, that means SP6 and SP9. Okay, and 中极 is important. You know why? 中极the one the front move. Where they get the 中极? 中极 is from the navel 4 inches, 4 inch. I mean a 4 chin from here. So you get all the CV3, CV4, CV5, CV6 up to CV9 under our navel. Okay, so remember 中极 is the front move point of the gallbladder. And also we got another point, 膀胱枢. 膀胱 in Chinese means urinary bladder. That means in the best shoe, you can find one point which is BL28, which is responsible for the function of the urinary bladder. Okay, all those are what we call the principal points. And in case you get them, of course, you remove the point in the water. If you get heat, of course, which at 尾阳. As I mentioned, 尾阳 is the lower heat point for the urinary bladder. So we try to find out BL39. Heat, of course, as we do usual, there are 2 points for dealing with heat. One is Li11, the other is Lu5. Lu5 deals with the heat in the lung, while Li11 deals with heat all over the body, the general heat. So you should add Li11 there. Okay, and also you get the 大中 and also the 大顿. That means LR3, LR1. All those points are responsible for release excess heat in the liver qi. So in case of liver qi stagnation, please consider the liver point and also the qi point. The another point you guys consider is to put a 痰中. 痰中 is CV14. So CV17. CV17. Whenever you get stagnation, you just put a point there. On the other hand, some people will say, if I do not have enough qi, I also find the same point, CV17. Whether CV17 is for tonification or for sedation, I can tell you both. Both. Deficiency, of course, you can find CV17. You get stagnation, of course, you can just put a point in CV17 in order to disperse all those stagnation points. Okay. As I mentioned before, if you have not enough blood, please consider the share height and also the 绝骨. 绝骨 is, the down below here. Okay, you get stagnated blood there. Okay, those are the points we need to do. Just refer to the slide. Okay, so this is the explanation. I don't want to spend too much. Okay, and then you can know all the points because we got either the shoe one move point or the best shoe point or others. Okay, for the deficiency pattern, we got to consider the major point has the BL54, but since it's the deficiency, please consider tonification. What we're going to do for 25, just as CV4, CV6, 关元, 气海, all important. But in the best shoe, please find the BL20, which is the shoe point for the spleen. And also BL22, we call it 三角shoe. This is what? This is the best shoe point for the triple warmer. Of course, you guys don't need ought to remember to tonify the kidney. And the best shoe, you can find BL23 as the best shoe point for the kidney. Okay? And how about the supplementary point? As I mentioned before, in order to tonify qi, 关元, CV4, 气海, CV6, you must bear in mind. Okay? And also, there's 足三里, that means ST36. Those are really popular. And of course, the kidney yin yang deficiency, of course, you have to consider Ki3, Tai Chi, Ki7, Fu Liu. Okay? And if you do not have urine, please tonify the qi and also find the most appropriate point for the urine bladder, which is called 局骨. That means CV2. Just a little bit about that, 局骨. And more further down 局骨, of course, you can find the 会阴, that is the CV1, but CV1 is not for here because CV1 is for other purpose. Okay, those are the definition for the points here. Others, I'm not going to spend too much time on the other definition. But here, please remember that if you use acupuncture, of course, you always inform the people that acupuncture is just for temporary relieving of this kind of disease. You get to hurt and also other measures to cope with that. Okay, before we take a break, we want to just finish the prescription. One, for dealing with the dam heat in the bladder, please remember one formula which is called 拔精散. 拔精散 is for dealing people who have urinary difficulty and also due to what? Prostate gland enlargement. We always use this 拔精散. Second, dealing with the liver qi stagnation, of course, there's a formula called the 沉香散. But for me, if I like to deal with this qi stagnation, you can just consider another formula, just like 柴胡丝甘汤 or the 逍遥散. They can also work. But if no blood deficiency, I just use 柴胡丝甘汤 instead of this 沉香散 here. Right? And also for the third one, we have for any blood stasis, you can use this 地湯丸 or 代地湯丸. These are not really familiar because this actually composed of 頭項燒湯 plus the 山楂, 川山楂, and also 肉桂. Okay? And the fourth one is spleen qi deficiency. This is a very, very famous formula in Chinese medicine called 补中益气汤. 补中益气汤, that means tonify your middle jiao and also invigilate your qi. So this is a very, even you can buy it in Tong Ren Tang and other Chinese herbal shop there. 肾气, the other formula for tonify your kidney qi is 肾气丸, or some people call it 寄生肾气丸. 寄生肾气丸 is very popular. Also for those people who suffer from, Alzheimer, we are going to have, early aging. We also induce them to take those 神气丸 and also different sort of 神气丸 produced here, right? Okay, I think that's the end of this session. I'd rather give you 10 minutes break before we move to the other two questions.
I wanted to ask you about incontinence.
Incontinence.
Should this be included in this section?
Yeah, incontinence, you're right.
Yeah.
Incontinence and urine, the same as this topic. Because when I was teaching internal medicine, I always put them together. Urinary blood in dipping blood in urination, and also this topic incontinency of urination belong to the same topic. Same.
So you use similar points?
Exactly. Same. Exactly. Yeah. Long B is same as incontinence of urination. Okay. So what we are going to do in the following, 40 minutes, we are going to deal with two problems. One is 水肿, the other will be on the other topic. Okay. 水肿 in Chinese medicine we call it edema. Edema. The first thing you see is this edema. Mostly we can check from our body whether we have a very thick skin or we can check through our leg. Sometimes, yeah, this way. Yeah, you can't see the angle. Usually, the method of test is check the angle, whether you see the angle or not. Sometimes people will get the pitting, edema or pitted edema in this case. So he mentioned that edema is marked by the swelling of the skin, or what we call the cutaneous distension, of either the upper, middle, or lower part of the body. Okay, it's always start from the upper part body. But for this is acute disease. For the chronic disease, of course, you'll find the two legs really you get fat and as the water, stay in those parts. So you can find that this is the indication for people getting this kind of edema. The reason is because the urinary bladder cannot transport the water away. Okay, and usually, as you guys learn from other disease, many disease happen because of two reasons. One exterior, another is interior. Exterior because the wind bring in some kind of pathogen into your body. Interiorly, of course, is caused by the diet disorder or long-term disease, or sometimes because of overstrain, make you too tired. And the situation we divided into two types. One is even the local area get edema just like the hands and legs, and the other is the whole body getting edema. And usually when we deal with this kind of problem in Chinese medicine, we look into the three organs: lung, spleen, and kidney. Those are very important because they are dealing with water metabolism. Okay, and besides these reasons, sometimes we can see that even the stagnated blood and also the circulation of water in the sun gel, that means in the triple warmer, can also cause this kind of problem. Okay, and in Western medicine, we also concern they find the edema in the disease just like chronic glomerulonephritis and nephrotic syndrome, and sometimes the disease in the heart or congestive heart problem can also cause this edema, or sometimes with the endocrine system. Okay, and those will be within the scope of the Western medicine about edema. Okay, and how is it developed? Okay, and as I mentioned before, those cases will start from the lower limb, and then the forelimbs, and often always it will extend to the whole part of the body. And some people even get edema in the internal organ. No kidding. Some people get edema in the throat, so make it a difficulty in breathing. Okay. Some people make the edema even in the internal organs, such as the gut and in the stomach. The stomach internal. Yeah, this is a very, very serious case.
Are we still calling it edema and not anaphylaxis?
No, this is infectious. But this is also because the edema inside. Sometimes the edema in your vocal box. That means you have a hoarse voice, right? Those also belong to edema. But edema inside is quite different from edema outside, which we can see, right? But the cause, anyway, is because of edema. Okay, and then it always sometimes the severe case you can find some people even get the retention of urine and also nasal and also the vomiting and also coma or delirium in severe case. And also the kids, sometimes they will get what we call tonsillitis. Okay, and also for those people who get weak, sometimes get septicemia. Septicemia, that means you easily will get blue in your skin. Sometimes it's headache, and then this is because of the lack of the blood platelet inside your bloodstream. Okay, all those will also be the cause of that.
Bruises?
Yeah, the bruises. Yeah, you're right. No, this is according to the Western medicine, which of course will not include your examination. This is a kind of a knowledge you get. When they use the machine to measure the body, and then in the urine you contain some protein, some the sometimes of urea and other pathogen there, and we use different measure. Okay, the most important part of this course, of course, we're trying to differentiate different syndrome. Okay, and this is the patterns we're going to look at. One, we can just divide the edema into yang edema and yin edema, yang type and yin type. Okay, and always, usually we refer to those symptoms with acute and also fast onset. We call those, and also the edema on the head and the upper limb, and then we can call those to the yang type. And for those disease, have a longer progress, and also chronic disease, and sometimes you can find the edema in the lower limb, just like the feet, just like the leg, all those, even the knee, and all those we can call the yin type, or yin edema. Okay, of course, for the yang type, it's easy to deal with, because it's due to the exterior syndrome. You just use some wind dispelling herb, or you using the acupuncture to dispel the wind, and then we can get rid of the yang edema. But the yin edema, of course, this is more lingering, because it deals with the kidney and also the spleen. It will take a long time to get it off. So usually using the method of activating blood and also removing the stagnation method to get rid of those. Okay, and sometimes according to the Chinese medicine classic Wang Di Nai Jing, he mentioned that anytime you have edema in the upper part of the body, you are using diaphoresis. That means inducing sweat. Anytime you find the edema in the lower of the body, of course you are using the method of diuresis. That means promoting urination. Okay, so first type we will consider is the wing coat type. That means exterior syndrome causing edema. This is not usual, but sometimes you get it. Of course, you got all the symptoms, just like exterior syndrome, just like aversion to cold, fever, headache, and also you get the general body aching, all those things. But in addition to that, you also find edema in his face, especially if his eyelid here, also the face got all the fat, all the cutaneous distension. What are we going to use? According to Jian Zhongjing, our father in prescription, he said we are using the Ma Wang Tang. And Ma Wang Tang is not enough. We usually add one more Ba Shu here. So Ma Wang Jia Shu Tang is what we're going to deal with. Okay, and acupuncture. If you guys want to use the needle to deal with the problem, of course you consider Li Que. Usually for exterior syndrome, we use 3 points. One, we use Heku. Second, use Li4. Second, use Lu7, Li Que. And third, you are using the GV14. And the fourth one, you use 2 needles to pin on your GB20. Okay, or those 4 points are common. However, since this belongs to the edema, of course we have to consider other points, just like the pinley. Pinley means the Li6, the pinley, and also the Yinling Quan, that means the SP9, and also in the back. Then in the back shoe you can find the Fei Shu BL13, and also you can see this is a Sanjiao Xu. This is the BL22, because we're going to get rid of water from the Sanjiao. Wei Yang, as I mentioned before, is the the lower Hishi point for the urinary bladder. Since urinary bladder is responsible for the water in dimension 2. And the other point I mentioned before, 水分 is a CV9 here. Since we want to get rid of water, just one chin above the navel. This is CV9. And 中极, of course, 中极 is just one point about the 足骨. This is what we call this the CV3. CV3 is also the point, the fun move point for the urinary bladder. Okay, and also if you're coughing, of course you can add one point in near the radial artery. This is we call the LU9. 太渊. 太渊 is also a point, for curing, the treating coughing. Okay, and also dyspnea. If you find dyspnea, there's a special point at the back, which is called the 定传. It's a special point. Okay, here you just mention MBW1, NW1. And of course, if you don't more friend, please go to ST40, 丰隆, you get it. Okay. And of course, in trying with the dealing with the prescription, you guys consider the 月皮汤. 月皮汤 actually also contain 麻黄, but that's a modification of 麻黄汤. But this time we also add 白术. Why do we add 白术 in the first formula and also second formula here? Because the 白术 is a help to absorb the water in your spleen, which we call it the removing dampness here. Okay, so here in this symptom you can find that if people suffer from wind heat, you always suffer from all sort of the exterior symptoms except you get fever, more fever. Okay, so you get floating pulse, you get the headache, other things, but in addition you get more fever than chill, and also you get the edema. This time you get 月皮 加舒烫 here. Yeah, acupuncture, of course. For acupuncture, you guys know that here we're using the same the acupoint, but here we will try to add more point to release the heat, just like just like LI11. This one LI11 is the Qiji. And also we coughing, we add some more point, just like Qiji. It means to the LU, LU5, Qiji LU5. And also you have dyspnea. Dyspnea, of course, you can add the 定传 as I mentioned before. Okay, and how about sulfur? Sulfur, if you get severe sulfur, we can just consider the LU11 to get some bloodletting for the severe case of the sulfur, or somebody get hypertension, we still consider those points. Okay, for the auricular point, ear point, I'm not going to deal with that. Okay, and how about the toxin? Okay, the toxin heat type, and then sometimes toxin type will also cause edema, but here you can find that the edema area will be more, and also you can see the tongue. If you got toxin, you can see either the whole tongue get red or the tongue tip get redness in the color. Okay, and of course the tongue coat will be a little bit yellow. The pulse always displays slippery, as I mentioned before. Slippery pulse means stagnation. Okay, now you get the water stagnation in the body, of course you get the yellow, the slippery pulse. So what we're going to do, we're going to do with a herbal formula of the 麻黄连翘七十豆豆. 七十豆 always used for boiling the soup in our family because it removes water, right? And this time, besides this 七十豆 with 麻黄连翘, we are going to use 五味消毒灵. 五味消毒灵 is very powerful in removing the toxin in the body. Okay, this is composed of 5 types of herbs, including the dandelion, dandelion, the leaf dandelion, and also the chrysanthemum, and also other herbs which are going to clear heat. As you know, some of them contain some antibiotics, in Chinese medicine. Okay. Also moving down here, what the point for those toxin heat. So we are talking about the same, points just like the LI4, LI11, those are releasing heat. But you have 2 more points from the back, not the back sole, from the deal, from the deal point, that means from the GV. One is 身处, the other is 灵台. Actually, 身处 and 灵台 are 2 points for releasing heat from the skin and also from the muscle. Okay, so GV10 and GV12 are the 2 points for dealing with the toxic heat inside the body. Okay, and other points remain the same, so I'm not going to deal too much about that. Okay, how about the P? The next piece. Yeah, how about the spin dam? Because I can't hear, right? The spin tan, you can have the common characteristic just as, they lost appetite and get all the scanty urine and also soggy pulse of that. In this case, you can consider using the famous formula called the 五皮散. What is the 五皮散? 五皮散, this is the pill of the herbs, just like the pill of the ginger, the pill of the fulling, the pill of the dai fu pi, and those I think are really important in removing the dampness, right? So those are important. Yeah, for acupuncture point, if those people get a spin deficiency, of course, what you guys need to do is to tonify the spin, right? In tonifying the spin, of course, you can add some more points, just like ST20, ST36, something like that. But here, if you got this kind of disease, of course, you consider LI11, which trying to release the heat, and of course, and the other point which is new, we call the G cow. That means in the TE6. TE6 is very important because whenever we have a constipation, we consider this one. Whenever we have damp heat, we also consider this one. So TE6, that means SJ6, will be very useful. And the other thing is, when we have other diseases, just like we have damp heat, we have a water deficiency, also consider the kidney 7, Ki7, which is important in removing the heat because it's a water pond. There are other water ponds just like as SP9, SP6. This is the Yinlingquan, and also Sanjinjiao, also responsible. Okay, in order to tonify, please find some point in your ren, that means in your conception vessel, just like CV3, CV4, and CV5. Okay, those are important in removing the dampness in the body. And be careful, BL28, which I mentioned before. BL28 we call it 膀胱素, that means the best point for the urinary bladder to dealing with all this kind of dampness and the water and the edema in the body. Okay. Now we move to the damp heat, heat type. As I mentioned, damp heat will cause also edema, right? In this case, you will find all the damp heat accumulate in the leg, in the foot. So what we got again is cutaneous distension. You will find the skin is very tight, and the people also suffer from some characteristic of indeficiency, just like night sweating, and afternoon we got the tidal fever, and also night sweating. Those are the 2 characteristics for yin deficiency. Okay, there sometimes because there's some more water retained in the body, so we can find little water left in the urine. So always you find scanty urine. Sometimes not even scanty. Even we find it's a dippling block the urine in this case. And the people who suffer from sleepy all the time, and also the tongue is thick yellow, and it's yellow coating, and then the pulse will be sometimes it's soggy and also rapid in this case. Okay, how can you deal with this problem? So when you're using the acupuncture, please consider the Sanjinjiao, that means the Sanjiao, that is the CV22, BL22, 气海, 水分, 中脘, all those 3 points, that means the CV6 and also the CV9 and also the CV12, all these points in the conception vessel are all responsible for water. So in the leg, of course, you guys will not remember SP6, SP9, And also, in order to tonify body, you have to remember ST36, okay, and to tonify. And if severe case, please remember more DG. DG is actually DG helps to solve the problem of the dampness in your body. Okay, so this is the SPH. Okay, and then the other type is called the chi stagnation, or somebody says chi constraint. I'd rather put the name chi stagnation. Okay, chi stagnation, of course, is all happening where? In the liver. These people always get the symptom of and also sign, and also has symptom of emotional disturbance. Of course, the pulse may be widely pulse, right? And also we got the formula, because it's 柴胡疏肝汤, as those people major in TCM practitioner were really familiar with this point. And of course, in order to treat the people with the stagnation, of course, you put a needle on his liver part, just like the LR3, LR2, those are important. We call those tai chong. We call those 行间, always relieve the qi. Of course, in order to release the qi, you have to move the qi. So we are going to deal with just like the 三阴交, and also 引灵泉 that means SP6, SP9 are those for dredging the cholesterol and increase more, promote the spin in that case. Yeah. So I'm not going to spend too much time on other points, but you can just get modification on the edema during the menstruation cycle, and also how about the qi deficiency, how do you about blood deficiency. As I told you guys, there's some points for blood deficiency. Okay, just like the GASU PL17 or the SP10 share high, and those are important. Okay, not those here. Okay, how about the stagnated blood? Okay, stagnated blood, of course, you will find, as I mentioned before, many people have the spider mark in severe case. But if no, you can just check their tongue. Why do women have blood stagnation more than men? Because they will get a few days menstruation cycle in a month. This has more possibility for them to get the stagnated blood there, right? So you can check the pulse and also check the tongue. And if you see the pulse is choppy while the tongue is blue and purple, then it means this is because of the blood stagnation. Okay, what we're going to do is the 血府煮鱼汤. This is a very important help for us to see this one. Pulse, I know it's easy, but when we mention about the acupuncture, all the points about the liver, just like LV14, LV13, and the back, you consider what is the BL17 and also the BL18, those you deal with the liver. Of course, in order to move the blood, again, please remember SP10, 血海, which tonify the blood, and also the two water points, SP9 and SP6, and also the one chin above the navel, which is a 水分, and the other 水道 is down below in the two, which is 归来, 水道归来, and also the Tai Yuan, that means the what? ST25 is the 10 Shu, but what we are considering about is the 水道, and also the 归来. Those points are also important. Those belong to ST28, 水道. Okay, those are the point for getting rid of the water too. So remember those things. Okay, good. You think this? Yeah, I think the second last one, 气虚, that means the qi deficiency. Okay, qi deficiency, everybody can know. If any people collect some suffer from qi deficiency, is not willing to talk, or talk with a lower voice. Okay, in this case, we are going to use a very important formula. Either we use the 补中基气汤 or 森林白术茶. But for 森林白术茶 here is more dealing with the qi deficiency with dampness. So the power of removing dampness is higher in 森林白术茶 than the 补中基气汤. So consider this one, okay? And also for the spin deficiency, please remember all the SP points. So you can see SP9, SP6 again. But sometimes we need to tonify the kidney in order to help the kidney, in order to help the spleen. So we'll needle Ki7 to help it. Okay, and there's another point for you to consider. This is wrong. This one, not our I. BL22. I just get this typo mistake. Okay, to also tonify your triple warmer here. Okay, so be careful with this one. Good. So about the P yang, that means the spin yang deficiency. Spin yang deficiency, okay, is people who do not get enough warmth inside your body, so they always get the diarrhea, abdominal pain, and also what we're going to do is a CP yin. That means to consolidate your spin, okay, so it's CP yin. So we are not going to deal with that. And acupuncture, of course, for people getting a really weak spin or spin deficiency, we always consider the same thing just as spin 6, spin 9, and also ST36, same as before. Actually, spin yang deficiency is same as spin qi deficiency. So their points are more and more similar. But of course, spin yang, we get more warmth, but the spin qi, sometimes we consider more dampness in this case, right? So spin yang will be the same. And lastly, we get the qi yin, that means the qi and yin deficiency in this case. And of course, in this case, the edema is much less in degree, and also because the sweat, night sweat, or always the profuse sweating, and sometimes you got insomnia. What we are going to do is a very famous formula called the Louis D Wang Tang, but Louis D Wang Tang is not strong enough, so sometimes we get some Wang Qi here, so it's a Louis D Wang Tang. Okay, so you can see the same points, just like if you get the qi and yin deficiency, you deal with two things, deal with qi and deal with yin. Okay, so we are taking the points of tonify the qi, just like Guan Yuan, CV4, Qi Hai, CV6, and also Zhongwan, CV12, and also we deal with the yin, that means water. Or deal with water, of course, you have the SP6, SP9, and also something concerning about the kidney, because kidney is so important. I'm not going to talk about the year points, okay? Those are not true. Okay, those tables are not usable for you because just for comparison, okay? Yeah, this is the part we are going to do. I just have 15 minutes for me to finish the chapter 5, because if we can't finish chapter 5, we can't go to lunch, because we still have 6 chapters this afternoon, right? So let's finish 5 by Yang Wei. Yang Wei is only a man, okay? So the girls can go away, and then you can go to take your dinner, take your lunch now, right? Yang Wei is very important as 5. So the Yang Wei one, means the impotence. The impotence is for people who cannot raise up. You cannot even raise up for the erection. If even you can get the erection, but there's no ejaculation. Okay, the ejaculation you get a yang wei or impotence. So impotence include 1, you cannot raise up. I mean the erection. 2nd, you cannot achieve the ejaculation. 3rd, sometimes even the ejaculation, the sperm number is so small. Okay, so weak. Some sperm are found dead. So those are the criteria for impotency. The impotency can be because of what? Because of sometimes because of deficiency, sometimes because of frightened. Some people get frightened and then they get weak, and some people because of the tendons and also the muscle weakness. In this case, no. So what is the cause for that? As I mentioned before, don't work too hard for the man. If you work too hard, of course, you lose your kidney yang. And some people, have too much masturbation during the teenager, and this also will hurt the sex ability. That means it will cause impotence. Okay, and in Chinese medicine, we always concerned about the gate of life. The gate of life. That means you have not enough fire inside your kidney, so that you can cause impotence. And sometimes some people overthinking. When you think too much and you worry too much, you also hurt your heart and also spin. In turn, it will affect the kidney too, because sometimes you get frightened, because according to Chinese medicine, frightened will also hurt the kidney and causing the loose in the blood and also the qi in this way. Okay, and this is the cause of that. So how many patterns are there? Yeah, this is an easy pattern because I can finish that before your lunch. First one, nobody knows this guy get impotent until he tell you, right? He cannot, perform the normal sexual activity, okay? And this is also the pattern. And in the associated symptom, you can see this patient sometimes get tinnitus, dizziness, and also their face is pale, and will tell you that sometimes you will get the problem of nocturnal emission. That means the seminal emission. That means the sperm will come out, involuntarily at night. Those will be also the problem of the kidney yin deficiency. And this guy, if you suffer from kidney yin deficiency, always get the cold limbs, and the tongue pale, and the pulse always fine and weak. And this is because of the deficiency syndrome. However, there are some kind of impotence caused by excess symptom. Why? Because this guy also sometimes some damn heat. How can you know that? Because some people will get some infection in their external organ. Some people in their scrotal sac. Sometimes in the summertime you will get some kind of infectious, sometimes a sores, and also get dampness. So in Chinese people call it damp heat. So damp heat is not only in men, when damp heat in men, we got scrotal sac got all infections. But the damp heat in a woman, they will also get the abnormal vaginal discharge, which also gets smelly. So this is unfair, both to men and women, right? In this case, you can get the urine is scanty and also dark and scanty. The tongue get also red and also yellow coating. Okay, so how do we treat this? When people complaining about impotence, okay, coming to see you, of course, just one thing you know is he suffer from kidney yang deficiency. So we're going to deal with the kidney and also the yang. First point, C is GV4. We call those one to be Mingman. Same as his name. This is a gate of life. If you tonify this part, of course, you tonify the kidney yang, right? However, sometimes impotence we call kidney yin. So kidney yin, we are looking for Ki3, Ki7, Ki3 and Ki7. Okay, and also for those people suffer from heart and spleen deficiency, you can just turn his back face down. We're looking for the BL15 and also BL13, and also from the leg we find ST36. Okay. However, some disease of the impotence will cause it by frightened. You just suddenly scare some people, and then this man, after going home, he will suffer from impotence. In this case, what are you going to do? Of course, you can find the GC. That means you can find in the back, you can find the BL52. Sometimes when we treat people with lower back pain, we also consider BL52. Okay, besides BL23, we have 52, which is called the GC, and also the best shoe for the gallbladder, which is a 胆素. That means it is a BL19 in that case. And all people, for those people suffer from damp heat, will just consider the Hui Yin. This is the first time you see this point, CV1. You see, CV1, Hui Yin. Hui Yin is where? The lowest part of the body, the lowest part of the trunk here. This is the external reproductive organ. This is the anus, just in the middle. So this is Hui Yin, the CV1. CV1 is the first born in our RAN, that means in our conception vessel. And this is good. Good for what? Good for people who got impotency, suffer from sudden fright. And also the yin and quan is also important. And this is harmful for the damp heat. And for those people who got insomnia because of liver problem, of course you can find the liver LI You mean the LV, not the LI, LV field. This font, be careful. I'm looking for the yeah. Taichung LV, not LI. Okay, correct this one. This is LC. Sure. Yeah. Question.
Have you used for the clock points?
For the clock point.
Yes. That.
Also, sometimes some people will do about the clock point. Yeah, but it's not for the not for this.
Dangerous or no?
Yeah, dangerous. No, you're right. You can do it. Right. Okay. Yeah. Last of all, I think for those people suffer from for those people suffer from noise and knee lassitude, of course we have to take care about his kidney. So this time we find the Yang Ling Chuan. You know this is the GB34. Okay, those are the point for that. Okay, moving down here, we got to explain the kidney, why we use those from the kidney Yang, kidney Yin. And this point we are going to share some of the experience. Sometimes in this disease may not be just using the herbs or acupuncture. Sometimes you take him to see the counselor because it's a psychological problem more than the physiological problem. This is my experience. Okay, and here. So how about the formula, the herbal formula? Of course, for those people suffer from the fire in the life, okay, we use a Jian Yu Dan, and this Jian Yu Dan is composed a lot of things which will raise our kidney yang, and also for those people suffer from, you know, the yang, kidney yang problem, sexual problem, you can use this. Second one is the heart and spleen deficiency. Of course, a really famous soup which we taught the third time this morning is the Gui Pi Tang. Usually in depression and also insomnia, but now you can extend its use in the impotence. Okay, and third, as I mentioned before, some people got frightened, sudden fright, acute fright. This time we use a formula called 代保元件. Of course, it's killed with to settle down our heart shen or tranquilize our mind. You can use this one, right? And the fourth one about the liver cheese donation, very important formula called the 逍遥散. Of course, if you got hit, you can change it to 加味逍遥散. In Canada or in China, we call it this 单剂逍遥散. They're the same thing, okay? And also for the dam hit, down floating. Of course, we will have a very important formula which can also be used to cure shingles. And we call this formula to be 龙胆泻肝汤, which is also found in your sample question. Okay, yeah, last time I gave you. And then to use 龙胆泻肝汤 to cure any dam hit or hit into your liver. Okay, this is the end of that. Okay, happily we have 4 minutes more to go. Anyway, so let's finish for the chapter 6. Okay, so we are talking about the 玄元. 玄元 in Chinese, it means dissonance or vertical. Okay.
There will be a class next week.
So first of all, let's look at dissonance. Dissonance is very common, especially for the women. Okay. And then the thing is, how do you know that they are dissonance? Everybody here, I bet, has experienced this before. Okay. Although you didn't meet the 649, but you should have the dissonance before, right? And dissonance is when you see the thing is not clear, or when you see all the thing around the ceiling as it's turning round and round. This is a kind of thing we call it the dissonance. Okay, and what will be the position? The position of it is in the head. Whenever you do not have enough blood into your head, supplying to your brain, you got all these symptoms. Okay, as what we call it the dissonance. However, when you divide them into two types, one, for example, you just sit down and suddenly get up, of course you get dissonance. Okay, there's no need to find a doctor right in this time because it's for that temporary. But if you always experience this one, or whenever you get up, you get this one. Whenever you lie down, you get this one. Of course, you see a doctor, right? And you know, sometimes it's severe, sometimes not severe. Some people will get car sick. You know, get a friend who always when they take the bus, you get a car sick. This is also another type of the dissonance in him. Okay. And what happens when you get dissonance? What happens when you get dissonance? When you get dissonance, you always get what? Get nausea, and also you get yeah. Whenever you get nausea, of course you feel very, very discomfortable, right? Sometimes you try to find a seat to sit down, right? Sometimes you don't want to get. Of course, if you have this experience, don't stand up, okay? Find something, sit down, and then even you lie down yourself. And this is in Western medicine always associated with hypertension or high blood tension. Or the other thing is what we call it atherosclerosis, or what we call it the cerebrosterosis. All those concern about the Western medicine. Sometimes anemia, of course, it is very common for people who don't have enough blood in their brain, supplying their brain. Okay, something like the ear, they don't have the balance fluid. Okay, in the trachea is not enough. It also got this kind of dizziness. Therefore, when you go to Western medicine doctor, he will give you just pills and also just medicine for it. But for Chinese medicine practitioner, we will find what is the cause. We will find which organ is being affected, whether your liver, your heart, or your kidney, or any organ will be concerned. Okay. And second, when we move to the etiology part, we try to find out what will be the cause of this disease in our body. One, of course, this is because of worriness. You worry too much, right? Become sick. Second, eat too much. But I don't think this will be most popular. I never been, getting a dizziness before after I get a big feast of dinner. No. This is not the real cause. I don't think. But the thing is, many diseases are going to become younger and younger, especially right for those diseases, hypertension, heart attack, and also diabetes. They are coming to be younger and younger. This is because of poor living style. What poor living style means? They eat too much greasy food. They take little bit rest. They sleep really, really little. Those what we call it the lifestyle disease. And sometimes it will become of overstrain, and emotional disturbance. Sometimes don't get angry too much. If you frequently get angry, of course, you will just hurt your heart, hurt your liver. Your liver will just come up, and then we call it those will be the yin and the liver yang. Either we say it's hyperactivity of liver yang, or we get upflaming of liver fire. All these two will be the immediate cause for the dizziness. Okay, and if you eat too much, of course, as I mentioned before, will not cause you harm immediately. But of course, your long-term of eating disorder will cause you disorder in your spine. What will be the result of the disordered spine? Spine is responsible for transformation and transportation. If long-term disorder, there is accumulation of much water, what will the result? Water, phlegm. Okay, phlegm is an illegal accumulation of water inside our abdomen. So if you get phlegm here, of course, you will get much more accumulation. Remember, phlegm is produced in the spine, but stored in the lung. So whenever you have spine, you have phlegm, don't eat too much sweety food. Don't eat too much chocolate. It's very, very clear that
Salty,
sweety food. For example, when you get exterior sunshine, you cough a lot, right? Never take sweet, never take candy. If you take candy, it will cause you more of coughing. And then never take chocolate, because chocolate inside your spine will cause too much dampness, and then you get too much phlegm and very, very heavy, right?
Is that true of even dark chocolate that has none of the gracie?
Of course, yeah. Any kind of chocolate.
Even the pure like nibs?
Yeah, no. But for Chinese medicine, we are not allowed. We do not allow people to do it this way. And also in your Western food, cheese is a kind of a food causing dampness. Okay, so if you get coughing, don't take cheese. This is my advice. Dairy product besides milk, that's okay, right? But for those dairy product, no, don't take it. Okay, this is my advice. Okay, of course, if you overstrain too much, it will hurt your kidney. Your kidney will become weakness, and also it will also cause what we call dizziness. But dizziness, because of kidney yang deficiency, is really seldom. But usually dizziness is because of the kidney yin deficiency. This is more frequently. Okay. How when we move to the part of identification of pattern, you guys know that there are certain types patterns in the in the disease of the dizziness. One is because of excess disease. Excess disease, that means your liver yang is going up. Okay, that means what we call is hyperactivity of liver yang. Liver can have yin and yang together, right? But your liver, because to a yang organ, so it always tend to go up. I mean, the liver yang also go up. Liver yang go up, nobody knows. Nobody knows until you find yourself easily get angry. Okay, somebody irritated. You're irritated. Somebody make you angry. Easily make you angry. Second, you bitter taste in mouth. And then suddenly you feel your ear in tinnitus. Tinnitus can be divided into two types. One is you can't hear anything people is talking. There's a barrier between you and the speaker. Second, you have some humming sound in the ear. Those is inside the ear. Those are called the tinnitus. But some people like to divide the tinnitus into two types. One is a low pitching tinnitus. It's a high pitching tinnitus. Of course, high pitching, can refer to yang disease, while low pitching refer to the yin disease. This is how they classify that. But the time when I was when I was learning TCM practitioner, we didn't have any book mention about that. This is the as you know, the Chinese medicine is going to develop. Some people like to add more information in that. For the time being, I cannot accept this one as my criteria. But I just think tinnitus is some kind of disease either caused by excess or deficiency. Okay, so tinnitus is one of the symptoms. And then red tongue, of course. Red tongue. The tongue will be red, or you can see the margin of the tongue getting red. Okay, this is the disease of the liver, right? The matter of the liver. And the other very characteristic pulse condition is wiry pulse. Wiry. W-I-R-Y. Okay, this is the first reason, the first pattern called the hyperactivity of liver yang. Second, we are caused by the phlegm dampness. Phlegm dampness, as I mentioned before, because of the spin deficiency. How do you feel? For those people having the phlegm dampness, first of all, they feel their head being wrapped, whether like as if it was wrapped by the bandage. And then second, it will cause the chest oppression because the dampness here, obstruct the chi going up and down. Of course, you feel a heavy sensation in the body. Okay, and sometimes, and when you see the tongue, of course, if it's a dampness, we can find the tongue is white and also damp, covered with a little moisture. We call it this is greasy tongue coat. And the pulse, of course, is soggy. S-O-G-G-Y, soggy. That means the pulse is on the surface, but very soft and very, very soft here. And the third type, we call it the kidney yang deficiency. Kidney yang deficiency, of course, any time you get the kidney yang deficiency, you must experience the lower back pain, okay? And also the knees have no strength. You're really weak in the knee. So lower back pain and weakness in knee are all the two main characteristics of liver yang deficiency. Of course, some people will experience the seminal emission at night, and also his pulse is deep and fine because this is a very weak, because this disease belongs to deficiency, and the tongue is very pale. This is the third type. And the fourth type, we call it the both qi and butt deficiency. This is very, very tough because when you guys don't have qi, not enough qi, you feel very tired. Even a little bit movement will cause you panting. In this case, because you have qi deficiency. Right? If you suffer from both qi and butt deficiency, there is a double penalty because you always experience those shortness of breath, and also your face also get a pale profession. Tongue, of course, only blood deficiency make your tongue pale. If you suffer from both blood and tea deficiency, of course, the tongue is more pale in this case. The pulse is not only weak, but this is fine. As fine as a piece of fat. So this is the symptoms for the for this kind of dizziness. Okay, So when this guy come to your clinic asking for help, okay, what are you doing to do? Of course, for headache, having the head, right? So of course, you first deal with the head, and head, of course, there were a lot of problem. The dizziness because of wind. So first of all, you deal with the wind and head. There is something there's a GB20, right? GB20, and also the GV20. Both 20s are very useful. So GB20 and GV20 can be used. And anything concerned about nausea, you want to vomit, you want to nausea, please look for your 内关, that means PC6. PC6. Okay. If this dizziness is still to liver, try to find the liver point. Liver point in your toe, between the first toe and second toe, and then you get the LR3. Okay. And sometimes for dizziness, you have to tonify. Well, where we can tonify ourselves? Of course, the tonify kidney is important. So this is by KI3. Of course, in addition to that, if you got more liver young hyperactivity, of course, you have to sedate the liver. For sedation of the liver, of course, you can find the LR2, which is 行间. Okay. Phlegm, if I were you, I would just look for the phlegm point. Okay. Which are phlegm form? ST40, 丰隆. And then with the abdomen, the ran channel of the 中脘, that means CV20, CV12. And as I mentioned before, phlegm composed of water. So you can look at the water points just like SP6 and SP9. Those can be useful to remove phlegm. Or in case you do not have enough water, you're looking for the same point. Okay. And of course, kidney yin deficiency. Blood, qi and blood deficiency. As I mentioned before, blood. Remember those 3 points for the blood tonification? Okay, SP10, and then GB37, and then BL17. How about the qi? Qi deficiency. We're looking for 3 more points. 1, CV4, 关元. CV6, qi hai. And then you go up. Or some people will prefer the CV17, 唐中. And the most important and effective point, of course, if you allow you just tonify the 百会. So this time I'm not going to needle the 百会. I mean the GV20. You just do moxie. Give a moxie vision on your GV20. Okay. For kidney yin deficiency, of course, you tonify the kidney best shoe point, which is BL23, and also the Gansu, that means the BL 18. Those are also important for that. Okay. And this page is going to explain why we chose those points. I'm not going to explain, but you guys have to read through yourself. Why? Because those are for the foster and consolidate the foundation, and also can tonify that. Other measure, treatment. No, I'm not going to deal with that from the year and also point. But there one point is called a scalp acupuncture. Some people like to do it with 头针. They use the pin, the needle on those 3 points. Some people on the back. Okay, and those are some of the technique, but which are not, we will not consider this point so far. Okay, and for conclusion, please advise your patient that whenever they have this kind of dizziness, they take care of body. Don't take cold drinks. Don't take raw and cold drink. Okay, on the other side, don't take the spicy and also the greasy food. Abstain from alcohol and also, the tobacco. Okay, you know why? Because the alcohol, especially when you drink the wine, when you put some ice into it, of course it will increase the dampness. Okay, so we will increase the damp there. Okay. Moving to the prescription part. There's a very famous formula for treating people with dizziness because wind. We got 天麻扣藤饮, 天麻扣藤饮. So this is 天麻 with 香扣藤 and also 天麻. 天麻 is very famous. Even our mother like to take it. Whenever they feel dizziness, they will go to a Chinese herbal shop to ask those shop assistants to give them 圈松, 八子, 天麻, those 3 things, and then go to the market buy a fish head, a big fish head, and then chop into pieces, put it into the pot to boil with those herbs. It helps because those are dispelling the wind. So this is for Chinese people, of course. And of course, the people here, they can have all these things together. For modification, I'm not going to talk anymore. Okay, second, either we say upflaming of liver fire or a flaring of liver fire. They are the same. Upflaring, that means upflaming, okay? This, again, before the break, I mentioned this formula before. 龙胆泻肝汤, which can be used for 2 other purposes. 1, treatment of the shingles. 2, treatment with the women with the abnormal vaginal discharge, which is really smelly and also greenish color or also yellow color. And then we can use this formula to deal with the, the leukorrhea. Okay, this one. And the third one about the phlegm. Up the disturbance of the phlegm, turbid phlegm. Why do we say turbid? Because phlegm belong to turbid thing inside the body. Why? Because we get the clear qi and also turbid qi. The turbid qi also can be grouped into with the turbid phlegm. Phlegm, therefore, is not the original thing inside our body. It can be regarded as a pathogen. So we must take it away. So what we're going to do is use 半煞拔除天麻汤. Of course, now you can see 天麻 again. But why we use 半煞? Because 半煞 can get rid of the phlegm from our body. Okay? And 拔除, of course, is removing the damage. And the fourth, qi and blood deficiency. This is very easy. Okay, although the formula here is 桂皮汤, but for me, I would like to use either 细全大补丸 or we can use which one? 细全大补丸 to 25 both blood and qi. Okay, and because 细全大补丸 can also 25 both blood and qi here, and of course, the dealing with dizziness, I think there is enough for this one. So you can just make a replacement, either 桂皮汤 or 细全大补丸. You can take it. 十全大补丸. 细全大补丸. Okay, some people put me in the decoction becomes 四全大补汤. Sure, you can do the same thing. Okay, and also the 肝肾, liver and kidney yin deficiency. Of course, there's a very important formula over there, right? Kidney yin and kidney yang, they are different. But however, when you say kidney yin deficiency, for guys, you know this is for the 左归丸, right? However, 左归丸 is only for kidney yin deficiency. If you any concern about the liver, I would like to add 2 more things. What is that? 杞子 and 菊花. 杞菊地黄汤 is much more suitable than the 左归丸. Okay, this is my just a little bit reminder. Okay, how about the 淤血? That means how about the stagnated blood? For stagnated blood, of course, what I'm going to use, I will just use the 血浮猪鱼汤 or 桃红西服汤. But here the suggestion is 通窍活血汤. However, when you looked the content of the 通窍活血汤, they are similar to what I call the 桃红西服汤. Okay, so I'm not going to talk with too much there. Okay, and this is the 6th. Very good. Are there any questions? Just before I close, I just want to remind you guys that dizziness can just deal with simplicity, liver and kidney. Okay, liver and kidney. This is deficiency. Excess syndrome because of phlegm dampness. Okay, this is why. Okay, now we go to 7. 7 is called 余症. 余症. Yujing is a very important issue because it绝症. Just before we talk about what we mentioned about, just before I mentioned about dizziness, right? But now this one we mentioned about people getting fainting. Okay. 绝症. Okay. What do you mean by syncope? Syncope actually means some people getting fainting, but it's not unconscious. Half unconscious, half conscious stage. What do we call those? In Western medicine, they call shock, S-H-O-C-K, shock. That means that's half. So here, syncope is refer to a symptom called a sudden, sudden loss of conscious and activity. In this case, this is because of even yin deficiency or yang deficiency. When you consider about say 8 principle, I would like to say this is what we call the depletion of yang or depletion of yin. Also, the main cause of this kind of the syncope. Okay, so here is in the Western medicine, it's got a kind of transient ischemic attacks, but I'm just know this name. Okay, so what is the cause of this disease? Of course, this is because of the primordial qi. What do you mean by original qi? Actually, when you are in your mother's womb, you are supplied by your mother some kind of qi is called primordial qi, or here we call original qi. But once you came in from your mother's body, and then you had to supply your own qi, those is called the acquired qi. So primordial qi is a qi acquired by supplied by your mom, while pectoral qi is provided by yourself after you eat, and then the food will transform to the qi. Those qi we call the pectoral qi. So here it mentioned about why do people get syncope? It's because the primordial qi suddenly become very weak, and also and the other thing is for the women, after giving birth to a baby, he will suffer from severe loss of blood. Okay, at this time she must stay at home and then get tonification. However, at this stage, if blood loss is too much, and then she will undergo this kind of syncope. Okay, and the other thing, which is not so frequently for people, they work too hard, they work too much. Suddenly they will got collapse, and this collapse is a kind of syncope too. And this is because of the qi and blood we cannot go up to the head, and this time causing them some kind of not only the dizziness but the syncope. Okay, and the other problem we also mentioned about is about the emotional disturbance. Sometimes people will suffer from this kind of syncope because of external trauma, especially the head. Okay, and my son joined a football team, many times. And one day when he just was having the football match with the other team, he just knocked the head with other people's head, and then he suddenly lost his conscious for a few seconds. And this is also a kind of external trauma. Okay, and also this will also cause a kind of syncope at that time. Okay, and this is
also doing acupressure for somebody they have that the first time. It might happen to them too.
No, this is not syncope. Syncope is suddenly loss of answers, but this is because of fainting needle. Fainting needle, the duration is very short. He or she will not feel unconscious for a long time, right? You just in that type of just remove all the needles, and then ask him or her just to stay, getting rest, and that's okay. So this is different. This is not called syncope. For syncope, you must rush him to the hospital or see the family doctor, right? So this is a really slight, not less severe case for that. Okay. Yeah. When we are coming into the differentiation syndrome, we can just distinguish these patterns into a few types. One is excess type, the other is a deficiency type. Okay. No matter it's excess or deficiency, you can also find similar signs and symptoms. Just like suddenly, initially suddenly tiredness and also become dizziness, and also nausea. Actually, we find that before people getting faint or before getting vertigo, and then they will have a nausea feeling. You know why? Because it is lacking of oxygen. Okay, or a nausea. So if people ask you why we get nausea before we get fainting, because it is because of lack of oxygen. Oxygen supply, we get nausea. Okay,
Because
and then
what, sorry?
huh?
Oxygen.
Lack of oxygen or nausea. no, then lacking oxygen. Lacking oxygen supply to your brain. Then you get this nausea, and 1 second after nausea, and then you just fell down because of the fainting. Okay. Exercise pattern. We can also find people very strong with a strong constitution and suddenly fell down. However, this time we always find some football player and also some athletics after they finish the running and also the exercising. Some people will have this kind of action. You know why? Because he doesn't do enough warm-up exercise. Second, after a long time rest, for example, in the summer holiday, he just went summer holiday and coming back and do the exercise again. Some people will experience this kind of syndrome. Okay, and of course you can see him feeling unconscious and with a rapid breathing. Okay, a short breathing, and also he got what? He got the locked jaw, or we call it this clenched jaw here. Okay, this is one kind of a symptom. And his tongue, of course, you can see his tongue if we have a locked jaw, right? Of course, the tongue should be pale tongue with a thin white coat. However, the pulse you can feel. Even if you get locked jaw, you can just feel his pulse. When the people get syncope, his pulse is deep and also wiry. Why is deep? Because this interior syndrome, right? Why is wiry? Because when you get unconscious, because his liver cannot deliver the heat outside. All the heat is locked in the liver. Okay. In this case, you can feel his forelimbs get cold. However, his chest is still warm. Okay. This is the syndrome in the excess syndrome. Okay. This is okay for the deficiency syndrome. Of course, the patient is weak, and also he suddenly fell down because he's over strain or overworking. His face is pale white. He's cold. His limbs are all cold, including his chest. All cold too. Okay, and this time he got profuse sweating. So you can compare these two signs, right? These two signs. For excess deficiency, there's no sweating, or sweating is very little. However, for the deficiency people, will get profuse sweating. Okay, and the pulse is forceful. No, this time forceful. This pulse is really weak here. Okay, the tongue is pale and with really weak, and also this fine, slow and weak pulses in this case. Okay, if you get all these two types of symptoms, one is exterior, one is excess, the other is deficiency. What are we going to do with that? Of course, we have to do some emergency. I think some of you guys experience it, right? While you are walking on the street, somebody suddenly fell down, and then you can save him by using what? Using this one, 人中. Yeah. If you get needle, of course, just put the 人中at 45 degrees here, and then if you didn't get up, we just move the 人中 away, lifting, thrusting. In this case, you will get up, right? If you don't have a needle, what are you going to use? Using your knee. For women, it's good. The knees, nail. The nail, yeah. Using a nail. The nail is very useful, powerful tool for women, right? They can use this nail and then press it on here, and then he will get up, right? This is one of my experience when I see a patient getting epilepsy. Suddenly, in a sudden epilepsy, and just shaking, I just use my nail and then press it on his 人中. After 3 seconds, he just get up again. His wife told me that whenever he get this kind of epilepsy, he take about 15 minutes to get up. But this time, just press it, he get up within half minutes.
Is there any danger to actually resuscitating them like that?
No problem. This is safe, really safe for this one, right? Yeah, this is a good point for us. So 人中, remember, is a point for saving people, for resuscitation. Pardon me?
I experienced
Yeah, this is good. Okay, and also besides 人中, you can just use your needle to think 内关, that means PC6. Okay, those 2 points are very important. For others, I won't suggest you to do, right? Because you can just open this cover to do all the 关元气海 and those thing, right? 主三里. But 主三里, I mean the ST36 will not be effective, right? As those 2 points, right? Because it's quite away from the body. Those belong to distal point. But the proximal point, this and this, yeah. and also this finger, all can do that, right? And also the knife one, all can do. So those are the points for the supplementary point. Oh, here this slide just mention why we use all those points, because some belongs to the GV, that means the governing vessel. Some of them belongs because other crossing point, or they belong to some of the important form point for those channels. So I'm not going to deal with that. Okay, other treatment. This is what I mentioned before. Okay, in emergency time, use your thumb, the nail of your thumb, okay, to press on the 水沟 and also the 合谷 and 内关. That means the here GV26 and then your PC6 and also LI4 until he wake up. Okay, this is the point. Is no danger at all. Okay, because you are not using other instrument. Okay, this is the auricular acupuncture, and also sometimes for those people who suffer from a problem, you can just choose this 12 Jingwell point. Okay, for bloodletting, but bloodletting is not advisable when you are in the street, of course, because sometimes this is you get nothing. I'm not sure. For me, to play safe, I'm not do it in the street, but you can do it in your clinic. Okay, this is you can use bloodletting method here. Okay, yeah. This is the method of safety. Whenever people just falling unconscious, if you learn first aid, the first thing is just lying down. Chinese people would like to say that you just lift up his leg so that the blood can flow back to his brain. Okay, in this time, remember to keep warm. Right? Otherwise, this patient will get cold after relying on the floor. Okay, so you just make sure what will be the cause of the dizziness here. Okay, so those are the summary of the tables here. So I'm not going to deal with that. Okay, this is the end of the second case for this afternoon. Okay, so maybe we finish the third one and then we take a break. Okay, good. Some of the diseases are really common, although you don't know the name of symptom, but sometimes you are number 8. You can just use this kind of method, using your hand or using the some of the acupressure point for saving people from the emergency. Okay? Yeah, the F1. The F1 is concerned about 违禁. What does 违禁 mean? Okay, here. 违禁 means atrophy. I haven't seen this disease before when I was practicing in the early years, just like before 2000. But now I find this syndrome is getting more popular and more popular. You know what happened? I don't know. At the age of many young patients, even 20 years old or 30 years old, suddenly they find their muscle contract and degenerate. All the muscles degenerate under the head. So after all the bones and also all the muscle will contract together, and they had to sit on the armchair, sit on the wheelchair, and then push by their mom. I think this is very, really tough. Pity for me to see this case. However, what is the symptom of this one? What's the cause of this one? Some people don't know. We just say that this is because of Qi and blood deficiency. However, this will cause a lot of problem. And then for those people who just have a very good career, very good prospect, suddenly suffer from this syndrome, I think this is also a problem. And some people say this is just an inheritance. And this problem, what can I say? This atrophy syndrome or 违禁 is because of what? Suddenly you feel those muscles become, forceless. That means no strength, become weak, and the muscle become, contract. We got the muscle atrophy, and also the some of the part is not workable. In this day we got the flaccid lamp. The flaccid lamp in Chinese, in the modern Western medicine, they call those to be kind of acute myelitis. Myelitis, I think when the time I study biology, I know this is myelitis. Refers to the layer, outer layer of your nerve. Our nerve is composed of a nerve cell. Each nerve cell is covered by a thin layer, which is called the myelins. And we find that the problem happen in the nervous system, and then we find the result. The myelin sheath, yeah, you're right. The myelin sheath, I saw, I forgot the SH, EATH sheath. Yeah, this just like the protective layer, protective shell for shore, right? Because sheath, right? Yeah, and if anything wrong with those myelin sheath, and all, or we call it those problems of myoatrophy, and also what we call it the traumatic nerve impairment, all of them belong to the same category of this kind of atrophy syndrome. Okay, yeah, question.
Would Western medicine refer to that as like polio or diseases, viral diseases of the central of the nervous system?
Exactly. Yeah, and sometimes before you can know that there's some kind of problem when the kids, when they are 4 to 5, 6 years old, they get affected by some virus on their central nervous system. They got all the what the pyonephritis or something like that, PILO, something like, because they restricted poliophritis, right? Poliophritis. That's why they get the reduced in their leg. But those happen in the kid stage. However, this atrophy problem sometimes happen in the adult. Sometimes it happen in the age-type people. We don't know what or why. This is not because of the virus infection, but the other virus infection maybe.
Is electrolytes related to this? The body like calcium, magnesium, potassium.
Yes, some of the study, the recent mentioned about that. However, the Chinese medicine do not have those perspectives. We are not looking at the micro organ, micro view, right? Micro perspective. We are looking at the macro one, just like qi, blood, and also the organ.
About ALS?
ALS? ALS, you're right. ALS, yeah, one of them. Yeah, you're right. Okay, back to the Chinese medicine here. What is the cause of the atrophy? One, because of qi deficiency. And whenever you get qi deficiency, of course you get the damp heat, pathogen invading inside the body. Once this pathogen inside the body, it will cause lots of febrile disease. Febrile disease causing high fever. Remember, high fever will hurt many things. That's why when we get a kid who got high fever, we try every method. By all means, lower down the temperature. Because Chinese people refer to that if you get high fever, it will hurt our brain. And the people after getting the high fever will get, either they get mentally retarded or we get something, getting retarded motion for that. So high fever is no good to any kids in this way. Okay, this is one of the reasons. And some people will mention that after some disease, just like typhoid, just like something like dysentery. Epidemic dysentery. They got the high fever, have the high fever, and then those residue heat still inside the body, and this residue heat will hurt their lung, right? So this is very common for young kids. They get fever after fever, and they still get some coughing. And then when they take to the family doctor, family doctor cannot take away this coughing. And then after they take the TCM practitioner, they know, okay, this residue heat is because of the residue heat inside the lung, so that they can give some herbal prescription for nourishing their lung, because they know the lung yin deficiency causing those kind of chronic coughing, so they can get this question.
What are the best ones to reduce fever?
The best one for the acupuncture
to bring fever down.
Of course, you use the same point. Just like LI11, yeah, and also we got the LI4, and those with the point. Of course, for high fever, I advise you to do what? Bloodletting. high fever, I think this is a good way to do it. Otherwise, you only depend on those needles. This is no use, no use. Okay, and also, as I mentioned before, this is because of the lung heat, right? The lung heat and hurt the lung so that the water cannot be distributed. The third reason is because you always sit in the wet area, or because of the job. You do the work in the high humidity area, just like you are moving in and out the fridge room, or you are having the work as how can I say, the lifeguard. You always sit in the beach or the water pool, and then you always get water, and those will be one of the reasons why you get the dampness inside the body. Of the dampness in the body, of course, can be moved by taking some herbs or doing some exercise. However, if the accumulation of wet dampness too much, it will accumulate inside the body. Okay, the long accumulation of this dampness will become phlegm. This phlegm will obstruct the channels and collateral in our body. Okay, those will hurt our spine and also stomach. And I think this is also one of the problems. And this obstruction, of course, will hurt our muscle and also tendon. And this muscle tendon obstruction and then make the body strain and is not able to extend. And the last reason is because of the long-term disease. Okay, just like those people suffer from prolonged illness. Okay, it will hurt what? Hurt qi, blood, also kidney. Okay, and making the kidney and the liver and kidney blood deficiency. As you guys know, liver is important in storing blood. If liver blood deficiency, it will cause all the tendons in the body, inflexible. This is the reason why we got this kind of atrophy. Okay. Yeah. Coming to the part of the differentiation syndrome. This is easy. Yeah, when somebody coming into your clinic, presenting this kind of disease, you can see his body, is getting weakness, and the muscle will getting flaccid. So we call the muscular facility. The muscle getting flaccid. Okay, and sometimes not even flaccid, you get pain, or they call it paralyzed. Okay, in that case, it cannot move, and also get strain, atrophy. Okay, when we move to the patterns, we can see that the first type is because of the lung heat. The lung heat consuming the body fluid. When the lung heat consuming the body fluid, we can find the patient suffer from profuse sweating, and then after getting the fever, he suddenly, all of a sudden, collapse with all the muscle, showing that all the muscle become flaccid. That means has no energy, has no strength for all the muscle. In addition to that, of course, he will get dysphoria, thirsty, and scanty, and dark urine, red tongue with the yellow tongue, with yellow coat. And of course, the pulse will be fine and rapid. Again, I just want to draw your attention to this pulse, fine and rapid. Okay, this is also again show you this is the I want to show you this is the yin deficiency pulse, right? Because now this is yin deficiency, not kidney.
So it should be fine, not wiry. Right?
Not wiry. I think this is wiry. Yeah, this one. A red tongue with and a wiry. Okay, this is wrong. This is wrong. Yeah, no.
It should be fine.
It should be fine. Yeah, you're right. Fine and rapid pulse. 1, 2, 3, 4. Line 4. Okay, you're right. Thank you. This is a fine and rapid pulse instead of wily. Wily is also wrong spelling. Okay, somebody get it wrong. Okay, the second reason is because of the dampness. Okay, when dampness is invading the body, of course you guys know that. Okay, fire and wind going up, while dampness will move down. So it is the lower limb that will be affected. And when the lower limb is getting this kind of sickness, it will become a little bit swollen, but with the paralyzed feeling, numbness, Okay, a little bit. You have a feeling of a little bit swelling, and also numbness. And the most typical symptom is you can find the both sides of the bone here. They have a sensation. Okay, so you can see the sensation and the affected limb both sides here. You get heat sensation. This is a very typical symptom for this type of a pattern, getting the the atrophy. And also his urine this time also dark and scanty, but he got the feeling of a pain sensation. After urination, the patient will get the pain sensation. This is because of damp heat in the urinary bladder. Okay, red tongue with yellow greasy coat. Okay, the pulse is soggy and also rapid. And then the fourth type is the liver kidney deficiency. Okay, as I mentioned before, if liver does not get enough blood, you cannot walk, you cannot see, right? Because it will have the problem on the lower limb. It causes the limb become emaciated, and also it's not workable, right? The muscle will contract, and with also all the problem will appear in the lower part of us, just like the lower and the knees. Okay, and the patient will suffer from dizziness, tinnitus, with the crimson. We say it's a crimson, CRIMSON. So here it mentions reddened tongue is not enough. Redden. It's not reddened. And I think more red, you can say a crimson tongue with also the pulse of rapid and fine and rapid. So you can see fine and rapid pulse here below, right? So this is also the situation in the in the atrophy. Okay, looking in the how come we don't have let me check. Yeah, this way, moving up here. Yeah, so moving to the treatment part. Principal treatment will be depending on upper limb, middle limb, or lower limb, right? I can tell you we have many patients coming to our clinic who suffer from all sorts of numbness inside the body. Okay, either they suffer from the recovery stage of the stroke, or they just get part of the body get numbness. So what we are going to do is we will find the most significant point. For example, the whole hand. Of course, we're going to joint point. Which joint? Either the 肩盂, that means LI15, and the banking and the joints, you get the LI11, and down here, of course, you can get the 髋骨 LI11. Of course, other points you can just add it according to your will, but usually we will needle the major point. Here, you mentioned the same thing. If anybody find the atrophy problem in the upper limb, of course, according to the textbook, 1 LI15, second LI11, third is 髋骨 LI4, and one more thing you got the 匝肌 is the in the back, okay. EXB2, sometimes we will put it in the neck, in the chest here, right? So this is another point for dealing with the atrophy, but this is just for temporary, I think, because you need to know what is the cause of that, and then you jump into the relevant organ or jump into the relevant channel to deal with that, right? So this is the upper limb. The general, remember, I'm talking about the primary point, there, okay? And the lower limb, of course, the lower limb is 1, 2, 3, right? So here, one tail is very important, right? One tail, we got the GB30, okay? And then down below here, between the one tail and here, of course, since this one is the middle, the joint, right? So we got this GB34, which is 阳陵泉. What is the point between the one tail and 阳陵泉 here? When you pat here, right? It just touch the point here. We got the 风石. This is GB31. So you get GB30, GB31, GB34, all those upper limb here. Okay. For the lower one, of course, you must get those points just like 昆仑 that means the BL60. BL60 is also important for this part, although it's not listed here. But I just make sure you guys know all these points here, right? Similarly, we got also the 足三里 here. This point is also important because of the tonification of spine and the stomach, and also the leg local point in the leg. Okay, all those ones you have to take care. 阳陵泉、三焦is in this side, right? All those important too. So for me, I would like to concern on those 4 important ones. 1, 2, 3, 4. Okay, all those points. And with it, you need to needle the 三阴交. That means SP6. I'm not really care, but the outside. I mean on the GB channel or on the ST channel. I think one important. So yes, GB is here. All GB. I mean the gallbladder. And here is the lung. Okay. I mean the stomach going down here. Those two, yang position is more important in dealing with atrophy. Okay. Of course, if somebody suffer from yin deficiency, you have to consider SP6 and SP9. Right. Okay. How about the supplementary points? Okay. In the upper limb, if you get supplementary point, of course, 七角 is very important. The lung. Okay. If anything concerned about the lung, please consider LU5. And the back, the lung shoe, BL13. Okay. Those 3 shoes is very important. Okay. How about the heat? The heat. If somebody suggests 带锥, that means GV14. This is very important. GV14 is a point for exterior syndrome. Or in addition, it's also a point to release the heat inside our body. Okay, so GV14 we got to remember. Okay, and also when we concern about the spine and stomach deficiency, one point you must remember is the 三阴交, the 足三里. Since we have 足三里, the principal point, so here we just move to the back to find some best shoe point for tonification. As I mentioned before, the best shoe contain lots of tonification points. Here, if we want to tonify the kidney, so if you want to tonify the stomach and also spine, please find BL20 and BL21. 20 is the for the spine, while 21 is for the stomach. Okay, and in the front you also find another point. We got the 中脘, that means the CV12. Okay, and for those people who suffer from the kidney and also liver yin deficiency, we always also find another 2 best shoe points. One is the 肝腧, the other is 肾腧. 肝腧 is BL18, while 肾腧 is BL23. All those can work in tonifying the kidney and also the liver. Okay. Yeah. Okay. This page also explains why we chose those points. You guys remember this point has the function of removing the obstruction and also restoring the function of tendons. As you know, the tendon is most important. What Chinese people refer tendon include 3 things. Tendon, okay? As you see, the jin, the Chinese word jin, actually includes 3 things. 1, it means what? Actually, it means the muscle. Second, it means the muscle end, which is a very long yellow substance, which is called a tendon. The third thing is the ligament. Ligament is the structure which joins 2 bones together. So in this case, if you tonify the liver, of course, you can tonify all these 3 structures, means muscle tendon, and also ligament inside your body. Okay, so these are very important for you. Even in Chinese medicine classics, just like Su Wen, he mentioned about this kind of atrophy. Okay, they call it 伪镜. He also mentioned about some treatment principle. How can you do it? How he mentioned that he mentioned that if in case of this thing we are getting the Yangming channel. What is the Yangming channel? Yangming channel includes 2 organs. 1, stomach. 2, large intestine. That means if those things happen in the above, we are using the foot Yangming, large intestine. If the atrophy happen in the lower limb, we are taking the the hand yamming, hand yamming, and also the the large intestine. Lower down we use a stomach channel, and the upper part we use the large intestine channel. Both of them belongs to Yang Okay, this is one of the suggestions made by the Wang Di Nai Jing. Okay, other method. Sorry, I'm not going to deal with this other treatment here. And for conclusion, since this syndrome is a very lingering syndrome. Okay, for those people who suffer from atrophy, I think we better advise them to keep the appropriate position, and when they are working, when they are doing exercise, be careful that they will not hurt the ankles. As I know that muscle contraction is a very degeneration of the muscle is a very serious problem. In addition that, if you also get the twisted ankle or you get a fracture, I think this is a double penalty for that. So be careful in this way. If somebody suffers from this one, ask this patient to keep calm and also be careful of their work. And of course, they can just get the treatment from the herbal prescription and also from the acupuncture. And those can sometimes, I think one more is 推拿. Yeah, you can also get it recover, get the treatment, improve the effectiveness of the treatment by using 推拿 or massage in this case. Okay, going back to the atrophy, we will talk about the herbal prescription. Okay, before we do the herbal prescription, we have to know the etiology and also the pathogenesis of this kind of atrophy. Okay, and sometimes it's because of damage, sometimes it's because of the spleen and stomach deficiency, sometimes because of the liver, kidney deficiency, or of course some of them will be lingering, some of them will be temporary. But usually, I think the long-term disease will be much more common in this case. And if people suffer from this kind of a symptom, of course, as I mentioned before, he get powerless and not lack of energy in their walking, in their working, because this is the obstruction of qi and blood. And some people have more severe case. In severe case, if the problem happen in the chest, of course, these kind of people will experience breathing difficulty. Okay, in this case, and also some people also exhibit some kind of purple nail and purple lips in this case because lack of oxygen. That means anosmia in this case. Okay, and we need to tonify the patient because atrophy is anyhow a deficiency case. Most of them deficiency. So we need to tonify them. Some people they lose the chance, they miss the chance of tonification. Of course, that means they will lose the blood and also the yin by and by, and later on they will become very serious in this case and very difficult to recover. Okay, and again, some people will say this kind of symptoms is much more similar to getting stroke. Okay, or what we call it in retinal apoplexy. Okay, and we can say that people suffering from apoplexy may suffer from paralysis for long term. Okay, and muscle limb numbness and also facial paralysis. But in this case, there is no facial paralysis. In this case, no facial paralysis. Again, just weakness in the forelimbs, especially in the lower limb. The lower limb. I think this is the most common. And this again because of the qi and blood obstruction, and this takes long time. It takes long time to get recovered. Okay, and this is what we explained before, right? In Chinese medicine classic, it mentioned that you must take the Yang meridian to replenish the deficiency. This is what we have in the Wang Di Nai Jing. It mentioned about that, right? So during the acupuncture, of course, you guys have considered all the Yang channel, just like large intestine, just like stomach. Okay, in this case, however, according to my experience, for all the deficiency symptom, we are not going to use Yang only, because as I mentioned before, this symptom it has much more relationship with the spleen and also the kidney and also the lung, right? So we have to take care not only in the large intestine and the stomach, but we have to know the qi, blood, and also other organs to help it to recover. Okay. So how about the symptom? Let's look at the symptom, right? One, pattern one is concerned about consumption of fluid due to lung heat, right? If the lung get more heat, in this case, you can see that the body will get dry. Whenever in the autumn, you guys always experience the lip is dry, the mouth dry, right? Always you get dry coughing because it's your lung have not sufficient nourishment. Now in this case, too, not only in the autumn time, even in the fall season of the year, and people sometimes experience this kind of atrophy, right? This atrophy will, make them unable to walk because of the facility of the muscle. Okay, and what are the accompanying symptoms? People will get restlessness, thirsty, coughing, dry throat. Why is dry throat? Because not enough water. Coughing, as I mentioned, because it's a kind of a dry coughing. There's no phlegm at all. Okay. About the urine, sometimes you get very little urine or even no urine at all because the water have been, steam consumed away, right? In that case, constipation, of course, exists, right? And the most important feature is you get the joints and limbs numbness. Getting numbness, that means this is not enough water there. So the pulse and also the tongue condition will display in this way, that the tongue will be red and with yellow coat, while the pulse will be fine and rapid. This is because, as I mentioned before, this is a kind of yin deficiency pulse, right? Okay, and this is the analysis why we have all those symptoms in the body once we get the yin deficiency. One, because of the food. All of them concerns with food, right? Either this is yin deficiency caused or because of the lung heat, because which will consume the body fluid inside the body. And also, as I mentioned before, the lung is responsible for distribution of water inside the body. So if the lung get any problem, the water cannot flow away. Sometimes the water will stay in the lung or in other organ, resulting in what we call the edema in this case. However, when the water cannot transport it to the large intestine, what happens? Constipation, right? When the water cannot transport it to other organ, we got all the kind of dryness there. So the heat will appear in the organ. For example, when water cannot transport to the stomach, we got the stomach heat, right? This is very usual. And the patient, of course, will display some red tongue, yellow coat, and also the small and also rapid pulse. And this is what we call the yin deficiency, consuming the body become dryness. Okay, question?
When a yin deficiency, though, is usually you said middle coating or scant coating. How come this one's just pure yellow coating?
Yellow coating?
Yeah,
because it's yin deficiency transforming to heat. That will be the yellow coating.
So a true yin deficiency is a little bit different than that?
Exactly. You're right. This is why in thinking we always experience some contradictory symptom. Okay, just as you mentioned about the patient may just diagnose as yin deficiency, but he got the yellow coat. Sometimes yellow and white mixed together, but the yellow is not, clear as those people who suffer from excess heat. Those coatings are very terrible and also dry and also yellow.
So it's a yellow dry
yeah,
coating.
And yellow and little. Sometimes yellow mixed with white. I think this is the dryness there. Okay, go. So how about the heat? If you get in this way, what we're going to do? As I mentioned before, anytime you get heat, please clear. So clearing heat or disperse heat is one of the tasks we are going to do. And besides clearing the heat, you guys have to think of how to nourish your lung. Your lung nourishing is very important, right? And this time we have one very important formula. which called the 清臭灸肺汤. 清臭灸肺汤, what does that mean? It's clear the dryness and save the lung. And so this is very important because we're trying to nurse the lung yin by this formula. Okay, and then this explains why do we got all this one, and also explain this also explains why you get all these profuse sweating and the cold limbs in our hand, and also we got all the toxin thing here. We mentioned about how the Chinese medicine theory explain all this sort of thing using the theory of the kidney and also the lung to explain the sign symptom there. And then later part you also mentioned about what is a pulse, why to get those pulse, and then why do they get those tongue condition. And at the end of the passage, we mentioned about two important Chinese formula. One is 生脉散, the other 生附汤, and 生脉散. All those are important in saving the people from yin depiction and yang depiction only. Okay. These are the formula for the 清臭灸肺汤. And then number 2, we're concerned about the dampness heat invading the body. Remember, anytime the dampness invading the body, we always get a heavy sensation in the body. Heavy sensation is because of dampness, right? In this case, if people suffer from this kind of atrophy, of course you get much more water inside the truck. Remember, water inside here, but no water here. So in the forelimbs, you will got forcefulness, facility or weakness, and all this is much significant in the lower limb. And about the accompanying symptom, of course, besides getting the flaccid limbs and also weakness limbs, you also have some fever, sometimes dyspnea, breathing difficulty because this part. Okay, more water accumulate this part and then make the breathing little bit difficulty. And sometimes you get what? Incontinency in both urination and also feces. This is a very common case in people suffering from wind stroke. Okay, 中风. Wind stroke, we also got this kind of incontinence of the urination and also the feces. Okay, and the tongue condition, of course, red tongue and also yellow coat. And the pulse, you get slippery pulse and rapid pulse here. Okay, and this passage tends to tell you guys why we get all those symptoms. When we get the dampness, when we get the damp heat, this is because of the obstruction of qi and blood. I think the most important thing is when the qi and blood is obstructed, those tissue cannot get nutrient, and then it will become numbness, and also it will become weak in this point, right? The reason we got the little urine because we get dampness in our body, and also this the manifestation of in the situation of atrophy because of damp heat. Okay, so what are the treatment? Heat, you can cure heat, right? Damp, we're trying to remove the damp. So in this way, I would rather say curing heat and removing the dampness. But the slide here says it is disperse the heat and eliminate dampness. It is no different from my explanation. Okay, what we're going to do is the 2秒散. Okay, ER powder. Okay, 2秒散 is good for you guys to use to remove the dampness, even as a daily use in our herbal formula. Okay, and those are the suggestions for you. If you're using 2秒散, you're curing the damp. In this way, the muscle can free off the dampness. Okay, and the stem, the spin will be normal in this case, right? So this is a function of 2秒散 to do it. The third case is a spleen and also stomach deficiency. Spleen and stomach deficiency. Okay, same case. The patient will suffer from the same case of weakness and facility in the limb. However, this time when he just a little bit exercise, he will feel really tired. Okay, and also his muscle also get flaccid at the same time. how do you know that he suffers from spleen and stomach deficiency? Just look at his just appetite, right? He's a gut poor appetite. He does not going to eat anything because of the fullness. Second, he's really tired. A little bit exercising, get tired. His face pale. Sometimes you get phlegm, a lot of phlegm. You can hear. This is why we do the diagnosis in our clinic, because we are using our ear to hear the people's talking. When they're talking with some phlegm here, you know that surely he get the phlegm. Or when he coughs, you know whether they cough with phlegm or the dry cough. Okay. Looking at the tongue, there will be a pale tongue, also a white coat, right? Pale tongue and white coat. As I mentioned, for pale tongue always means blood deficiency or qi deficiency. And then you also get what? Get the pulse, fine pulse, and also we got the white fine pulse only. So this is the okay. Here is being why we got those pulse, we got those symptoms. Because of the spleen and stomach deficiency. The most important thing is if we do not get enough qi and blood, the liver cannot be nourished. Since the liver is not nourished, all the tendons and also sinus of your body will become weak, and so also the accumulating water inside the spleen will cause some kind of edema inside the body, so the patient will not have more desire to eat. So those are the important indication. So guys, when you have a spleen deficiency, what are you going to do? Of course, invigilation spleen, right? Spleen weak, invigilation spleen. So now we are using the word invigilate. So this is the example I want to. We are not going to use the strengthen, but invigilate is the good. And then benefit qi. Benefit, this word I'm not going to use it. Either you tonify the qi or you raise the qi, right? Some people call it invigilate qi, but you can just boost up the qi. And what we're going to do is a very famous formula called the 圣灵宝珠散. This morning I just told you guys that you can use 补中益气汤, but 补中益气汤 is just for raising the qi. But 圣灵宝珠散 is raising the qi and also remove the dampness. This is why I shared this morning. Okay. After treatment, the qi and blood of the body getting regulated. And of course, we had to take care about the diet. So the diet is more important. This always shared by the ancient Chinese TCM practitioner that if we got not enough qi, of course we'll have some something wrong with our talking, something wrong with our speaking, and this is because the qi is responsible for talking, responsible for warming, and also for protecting our body, which is for immunity. So always when we want to save ourselves from atrophy, we need to save the organs, especially the spleen and also the stomach. So 圣灵宝珠散 is one of the solution for that. How about, I think this is the second last one, the liver and the kidney deficiency. Kidney. The authors have to use a very, very, difficult word, hepatic and renal, which is in Latin. But I will just use the simple word, liver and kidney yin deficiency. Of course, same thing. For those deficiency symptoms, we will have a very slow onset. And then, since this concern with the stomach, of course, the lower back and also the knee will be affected. And besides the lumbago, or because the lumbar region and also the knee problem, you also have other disease just like the dizziness, tinnitus, and also the seminal emission, and sometimes if it gets worse, you will have incontinence of the urination and defecation, right? The feces, incontinence of the feces and urine. And of course, you have the same symptom as weakness and facility in the lower part of the body and soreness of the lumbar system. I think those are usual. Concerning about the tongue, In this case, the tongue is red and little cold. Remember this morning, something else asked me what are the 3 symptoms for the tongue. Here is one: red tongue with a little bit cold. Also one of them. Okay, red tongue with no cold, red tongue with a little bit cold, or a thin tongue. Thin. If you have a cat, go home and see the cat's tongue. This tongue is really thin. Okay, it's small amount of food. Those are the typical tongue for people who suffer from yin deficiency. Okay, you get those things, and this explains why the people who got weak in the body. Because one, you guys will know that in TCM Foundation, you mentioned that kidney governs the bone, okay, and liver governs the tendon. So if you get liver and kidney yin deficiency, both your bones and tendons will get weak. This is why people will get atrophy.
How about gallbladder? Gallbladder is opportunity.
Gallbladder is going to be a bowel, is not organ. So in this case, gallbladder just got the fire, and also qi, gallbladder qi. Still very seldom case for this kind of entropy caused by the gallbladder. No, because this symptom always caused by deficiency more than excess. So fire will not be one of them. Okay, yeah. And sometimes the fire, even the fire, they call the deficiency fire. This deficiency fire is because of the yin deficiency, right? And how do we treat with the yin deficiency? Of course, it's easy. Anytime we get yin deficiency, we just remember nourishing. So we just nourish the yin, okay? And after we nourish the yin, of course, the heat will go away. Of course, you have to tonify the liver and the kidney together, right? So he mentioned about Hu Qian Yuan. But I tell you that I never use this one because this is concerned about the tiger, the bones of tiger. No, I'm not going to use that. To play safe, anytime we find the yin deficiency with the liver and the kidney, we use the 几株地黄汤. That means the 鹿地黄汤 plus the 杞子, 枸杞子, and also the 菊花, and those are more safe than using the bones of the tiger. Okay, and those are the example for the that. Okay, it's a TCM practitioner or acupuncturist. Please advise the patient that if the people suffer from this kind of disease, don't eat cold and raw food. Don't lie on the wet area. Otherwise, the dampness will go up again, and this will occur. If they are lucky, they get cured from this kind of atrophy. Next time, advise them all of the lifestyle style, just like proper diet, just like work and get more rest, and then they can just protect their liver and kidney by not doing too much work. Okay, so this is what they suggest to us to do, though. Okay, of course, this is one of the lifestyle. And the other thing is, after that we do more exercise, because one of the cause of atrophy because lack of exercise. So do more exercise in order to train the muscle, and also we be careful of protecting our kidney, and also to never avoid getting hurt. Just avoid going up and down. If you do the housework, you must avoid, otherwise you fell from height and get the same problem. Okay, this is the end of this part. Okay, we're going to talk about the 中风. In English, we got a stroke. Okay. Okay, keep on talking. Okay, stroke is very common now in nowadays over the world, because it's got to be I think the 4th or the 5th type of the disease which cause death, right? And here 中风 means stroke. Usually we use another word to denote the difference. One is the what we call it the wind stroke. That means the stroke because of the wind inside the body. The other called the heat stroke. That means in the hot summer when you're walking outside, suddenly you fall down with a red face, with you get no sweating, and this is called the wind stroke. Sorry, this is called the heat stroke. So for the wind stroke, the common appearance is for people suddenly fall down and unconscious, and after we wake up, we get the eye and face and the mouth get deviated. Okay, and sometimes they get hemiplegia. That means half the body get paralyzed in this case. And sometimes this is not only a kind of the disease. And then, as I mentioned before, the death rate of this kind of disease is high, not because of the stroke, sometimes because of the complication made up by this stroke. Okay, and this in Western medicine is just call them to be the cerebral infarction and also the cerebral hemorrhage or cerebral embolism. All those names will refer to the same case because of the breaking of the blood vessel in certain parts of the body, even the brain or in the body. Okay, so we can just consider this is another important kind of a disease which commonly we see commonly seen in the daily life. Okay, actually, when we consider the stroke, we know that stroke is usually caused by three things: wind, fire, and also flame. Wind, fire, and also flame. And the starting onset is always the wind play the main role. But after 3 days, the fire will come up and become, okay, and also take the role to place. And after 7 days, wind, fire, and flame play together. Of course, after 1 or 2 months, there are two more things coming up. One is the deficiency. The other is the stagnation. So stagnation and deficiency will come after the long-term disease. Okay, and of course, this kind of a disease happen in the brain. However, not only the brain, we also concerned about the heart, liver, spleen, and also kidney. Okay, and what is the cause? Cause, of course, sometimes people sudden anger, and then they will become, get stroke, and some people because of working too hard, and some people because of the sexual activity. Okay, this word in Chinese is very, very funny. Okay, this word doesn't mean, and in Chinese people they say 防劳, which refer to sexual activity. Okay, and also those will cause the rising of the fire, rising of the wind together, and this wind will go up. Okay, and sometimes it's because of the spleen deficiency, and get more flame. As I mentioned before, flame always is troublesome. Flame will cause fire. Flame will cause dampness. And the flame's fire will always upflaming and disturb our mind, leading to some mental disease. Okay? And those are very important. And those will lead to a disorder in the organs. And as I mentioned before, there are two types of the qi and blood obstruction will cause a lot of disease. And when I was teaching internal medicine in this college about this apoplexy, we always mention there are two types of the disease in stroke. One is concerning about the channels and collateral. That means the stroke happen in channel collateral. Second is happen in the organ. Okay, and whenever it's of course the most serious type is the what we call it the organ stroke. Because organ stroke concerns about the blood. There is some the internal bleeding happen in the organ stroke. For the less severe one, we call it the channel stroke. Channel stroke, that means just the stroke happen in the channel, which will not lead to any internal bleeding. Okay, and concerning about the organ stroke, which is more serious, we got two types. One we call it the closed type. Second we call it the flaccid type. Closed type means the SS type, while the flaccid type means the deficiency type. Of course, the deficiency type will be more dangerous than the closed type in this case. Okay, and here you concern about those two types of thing here. Okay, first of all, let's consider the first one. The first time in Chinese is the 重经络. 重经络, you use the name translating directly. You got attacking the channel. But I would like to say it's a channel stroke. channel stroke. This one is less severe because for this one, the stroke only happen in the channel, not in the organ. If you ask me, which one is more important, organs or channels? Of course, according to the structure of the body, okay, the channels are outside, okay, protecting the internal organ. Internal organ is inside. So what I mean is internal organ are more important than the meridian system. Therefore, the channel stroke may be less severe than the organ stroke. Okay, so let's first consider the less severe one, the channel stroke. For channel stroke, people just suffer from the problem of the hemiplegia, and the deviation of the mouth and slurred speech. That means it's difficult to talk, difficult to speak, and due to the stiff neck, the stiff tongue, the tongue cannot move. Those are all the superficial symptoms. However, there are several types. One type is caused by phlegm, right? If this people stroke is caused by phlegm, he will have dizziness and also the blurred eyesight, and with the tongue showing white and greasy or yellow and greasy tongue coat, and the pulse will be wiry and slippery. Here again, when you guys see wiry, that means they concern about the liver, right? The liver vein. And then when you see the slippery, that means the stagnation. So wiry and stagnation, that means the stagnation and also some accumulation inside the body. This is belong to the accumulation of the phlegm and also concerning about the liver problem. And secondly, when we talk about the liver yang hyperactivity, and then we find that people have a red face, also red eye. You know why? Because those are the yang, the yang sign, the symptoms of the yang hyperactivity. And besides the red face and red eye, we also find him get dizziness and also headache. And this one easily get irritated. Therefore, when you guys get hyperactivity in liver yang or upflame liver fire, you easily get angry. Okay, and of course the mouth is bitter taste in the mouth, including the dry throat. And also we got the constipation and the yellow urine and all these things, all these symptoms. This is showing that this is a heat syndrome. Okay, whenever you see dry throat, constipation, yellow urine, and also red tongue with yellow coat, all those showing that this is a heat syndrome. In addition to that, you get the forceful pulse. You can see that forceful and wiry pulse. This is actually exactly what is meant by the heat syndrome. Okay, and the other is a deficient syndrome, which we call it the qi deficiency with the stagnation of blood. I think they are the cause and effect. Why? Because if the qi is not enough to push the blood will stay there and become stagnation, right? So there will be the two situations come together. I mean, qi deficiency and blood stagnation come together. As I mentioned before, if you get qi deficiency, of course you will get shortness of breath, and also you're not willing to talk, and the face will be pale. If you got blood stagnation, of course you will get all the body will get really, really tight, and also you get stuck into your body. Or sometimes it goes more severe. If it goes more severe, we become the paralyzed over all the body. Okay, this is one kind of disease we can find here. And also sometimes the hand get the edema, and then it's not edema because it's swollen, and the face will getting pale, shortness of breath. Sometimes the tongue is not pale this time. Why? Because we get blood stagnation, right? The tongue displays some purple color. Sometimes it will become even purple to dark. And also the pulse, of course, you get choppy, small and choppy. So choppy mouth, choppy pulse, loose tongue, and also you get all the general body got pain. All those things with some kind of the stagnation, blood stagnation, and this blood stagnation, of course, the cause of this kind of channel the a kind of channel shock. Okay, and besides that, yeah.
What do you do at that moment when you have that?
Some people get no. All the things we were dealing with is after the happen of the stroke. You mean at the moment the people get stroke, what will you do, right? Of course, you send them to the hospital. You cannot do anything, right? For the
call
sake.
911 and don't touch them.
Yeah, you're right. You're right. If you are attending examination, remember, you're not going to deal with anything. No.
I know
Okay.
that, but, here let's say for studying that's what we do with that with
Exactly. Yeah, but of course, if you are the only one there, you want to save the person from this side, you just lie him over there, right? Just observe the changes, right? And then of course you can have needle to just get unconscious, because you are afraid that after getting unconscious you will just get suffocated, because the tongue will just stop the breathing, right? So make sure that he get a regular breathing. Okay, he has a resting position. I think this is what we can do, right? We are not going to deal with him anymore, right? Of course. Okay, question.
Yeah, you said that with blood stasis it's a choppy pulse.
Yeah.
But under the paragraph here it says thready pulse.
Thready pulse. Okay, let me go. Let me see. 中间了.
Previous, 之前.
Okay, this is this one, yeah, okay, yeah. With a 30 pulse. No, here we got the choppy pulse and also small, right? So let's take with little coating. Let me see because I can't see around here. With 30 pulse is wrong. You're right, because mine is getting down. Yeah, please correct it. It's not 30 pulse. It should be. I mean the last one here. You can see in the bottom. Yeah, you're right. You have to get a very equal eye here. So please correct it. It's not 30 and pulse. What do you say? 30 and choppy. 30 and choppy. It left out some choppy. Please write down choppy before the pulse. Yeah. When somebody write this up, he forgot to put the word choppy. I think 30 is not important. Choppy is important, right? Because it denotes this. It indicates that this one is a kind of blood stagnation. Thank you. Okay. So when we are concerned about the organ shock, they always display the similar design. However, you can see it's suddenly fall down, suddenly collapse, right? And with loss of consciousness. I think this loss of consciousness, this is very important. And after even he get up, he likes sleeping. And snoring is very, the snoring sound is very obvious in this thing. And now even he got up, he cannot control his saliva flowing from the side of his mouth, because his mouth get deviated, and also he cannot control the mouth because it get all the paralyzed in the mouth here. This is one of the symptoms. As I mentioned before, inside this series case, we got two possibilities. One, we got the closed type. The other, we got the flaccid type, flaccid collapse type. Okay. Some people just write tense type or closer type. Okay, and here I mentioned there are two types. One is closer type. For closer type, people will get the clenched joints and fist, clenched joints and fist together, and the face is red. And when he's breathing, you can hear the breathing sound, and his throat lot of a phlegm. You can see all the sound, blocking his flow here, and he cannot also suffer from the symptom of incontinency of feces and also urination, and his pulse is wiry and also slippery and rapid. This is what we've seen in the closer type. In the closer type, you can see all of them display a heat excess type. However, on the other hand, when we consider the flaccid collapse type, In the fascial collapse type, the patient will just close the eye but open the mouth, and always he cannot control his urination or the defecation, and his snoring sound is very small, okay, and his four limbs getting freezing cold, and also the pulse is very fine and also weak. However, another time you can see he kept on sweating, and those sweat is not in water. It feels just like a greasy. No, that means he sweat with grease. It's not water. In this case, it's two cheek here getting a little bit red. His pulse is very minute. What do you mean minute pulse? Minute pulse is very feeble. That means the pulse is so thin that you can hardly palpate. And then sometimes the pulse will be bigger, but I can tell you that you rather have a minute pulse than a big pulse, because the big pulse means the pulse without any string, without any root, is going to die before the case. Okay, so when you compare the closed type and the flaccid type, you can find that the closed type belongs to the excess type, while the flaccid type belongs to the deficiency type, and the flaccid type is more dangerous than the closed type, because you can see all the weakness. Okay, just like the breathing is so weak, the four limbs are getting cold, and the pulse is getting minute, and the most important thing is his sweat. His sweat is not water, his sweat is grease. That means he just make out all the subcutaneous fat from his body. Okay, so this is a very serious type, and I think you have rushed him to the hospital. In this case, you can't take it. Okay, so this is a description of the people suffer from organ stroke. We have this type of problem.
So we pass. If we get the question, send him to the hospital.
Yeah.
So we pass.
Yeah, you're right. Pass.
You get this question.
No.
Yeah, you wish.
No. Yeah, you're right. Okay. So
So they need to write an exam. Like I have sent the patient to the hospital. I've admitted the patient.
You cannot do. Even in the multiple choice, again, you get 4 choices. One of the choices is send to the hospital. You are right. You're right to do it. Okay. Yeah. So you're concerned about the channel stroke. In case in the upper channel, of course, as I mentioned before, just in the case of atrophy, you consider all the limbs. Of course, those cases like LI15. This one, we get LI11. Now, the author wants you to get one more point. Besides the LI11, also get LI10. Okay. Sosani is also help the hand to get, recover. And 外观 here, 合谷 here. So in comparing with the acupuncture prescription with the atrophy, here we just get one more point, which is Sosani. That means LI10. Okay, in the lower limb, and you get one tail, that means GB30. And also yin ling quan, middle, 足三里 here. And some more point, 解七, and also Kunlun. As I mentioned before, Kunlun is a very important point because this just between the angle, the angle. I mean, and also the back middle here. This is the the BL60. However, one point you guys notice is the 解七 where you can you take your shoelace, right? And those points we call it the ST41. So here you can get all the points from the upper limb and also the lower limb. Of course, you had to take other supplementary points, just like the yang qi is here, just in the middle here. Okay, yang qi. This is also for the circulation, for the movement of your hand, and the other the hou qi. Yang qi is this point, which is the let me see. Yeah, the ST33. Is right? ST33? Yang qi. No. Yang qi. Yeah, you're right. T4. You're right. T4. And also the other thing is this point. Hou qi. SI3. Usually when we read the from the any Chinese medicine classic acupuncture, this point is for the head and neck. You get the headache or the next stiffness also we point to this TE3. Okay, and how you see, and lower limb of course you have 腹土. 腹土 is where? Just midway between the 鼻关, this one. So we can how ST40, 31, ST32, 33, 34. Okay, because 1, 31, 32, 34. This is 鼻关 31, 腹土 32, and then we get the 阴矢 is 33. While we got the which one is 阴矢 and also what's this one? 梁修 is 34. Okay, and of course along this point you can just pick up, you know, the 腹土, that means 34. Okay, and 阴矢 also you 33. So ST32 and ST34 can be used here. Okay, and 悬中, as I mentioned before, this point is for tonifying the blood. So there are two purposes when you needle this GB39. One, you're going to tonify your blood. Second, you're going to do it in local area in order to recover the the leg, the lower leg, in order to get the movement. Okay, so this is the point for the lower limb and upper limb. Here, you also mentioned about if in case the mouth get deviated, we get 地腔. Remember 低腔? 低腔 is ST4. Okay, remember ST1, ST2, ST4, ST6, right? ST8. And if you get the mouth deviated, of course you can get 低腔 here. That means ST4. Or sometimes you consider ST6 too. And ST7, 下关, those three you can do. Okay. So now here, even here, he taught us how to use the ST4, ST6. Okay. And in addition to that, we tried to CV24, 临床. Okay. And also you can add all those things here. And of course, if you have a flame, remember you are going to use ST40, 风龙. And in order to get rid of wind, of course, 风池, GB20 is very important here. Anything concerned about liver, please pick the liver point, LR3. But how about we get Tai Chi? That means KI3. KI3 actually does not belong to the liver. Okay, it belongs to the kidney. Here we just use the kidney point to tonify the body in order to get rid of the lower the liver yang in this case. Okay, and if you got the qi deficiency and the blood stagnation, of course we are going to use qi hai and also sanjijiao. That means the CV6 and also the SP6 in order to tonify the body. Okay, but down below here you just mention about why we use those points, because we know that the Yangming channel, it belongs to the channel containing more blood and qi. So we use needle the Yangming in order to get more qi and more blood over there. Okay, and however, when you are dealing with the point in the lower limb, we are talking about how to regulate. Okay, and the qi and blood by using the lower Yangming and use the lower Yang channel. We are not using the Yin channel for this case. Okay, let me explain why. Yeah, the other type of stroke which seems more serious, we got the organ stroke, or they call it the taking the chance for organ. In this case, as I mentioned before, this is a very, very emergency case. Just suggested by this classmate that if you suddenly see this case, what are you going to do? If you're the only one there, there's no doctor, there's a remote area, you just take out your needle. Okay, one, you try to point at his 人中, that means the GV26. GV26 is the point for you to save him. And since he got the 闭经, that means the excess, you are trying to sedate instead of tonify, right? So you are using on those 12 减 point. That means on 受香, this one, and also 襄阳, and also 中冲, and 关冲, and also all those, okay, T, LI1, TU1, SI1, and also you get LU11, and you PC9, and also HART9, those points, and also you get all those points because we want to sedate the patients, right? For other than that, you can just consider the the tension and the liver, and also the 劳宫 here, okay, in order to sedate. If we got too much phlegm, just consider the 丰隆, okay, here. So this book use the do not use closed type, use the tense pattern, okay. For the flaccid pattern, as I mentioned, more secure, more urgent in this case, because the patient, besides getting unconscious, they also got a clenched jaws and clenched feet. So what you're doing to do is you are working on his 假切 is ST6. People get clenched jaws, you just make a little here so that he can release his jaws, okay, and here. And of course, if you cannot talk, you consider the 哑门 and also 练拳. You know where's the 哑门? 哑门 is here, okay, here, just here. And then here we get the 风符, that means 16, GV16, which also help which also help the GB20 to release the wind. But that's 1/2 inch below, this is 15. And then this is called 哑门. 哑门 is what? Sometimes you get loss of speech, sometimes you get sore throat, you cannot talk, you can just make a little 哑门 in order to release your voice. This is all. And then 练拳 here. Use your finger here. Just this here, touch there, right? This is CV23. This is 练拳. 练拳, remember, not perpendicular. Okay, it's 45 degrees, and then to the root of the tongue. And this is one of the method to deal with the people you're getting the slurred speech or difficult to speak, okay, in this way. So 练拳 is also another point for doing that, okay. This paragraph tends to explain why we use those points, just like there's 12 gene, the 12 gene well, 12 gene well point. Why do we use those lower and the upper those Yangming channel? And because we want to use that, and also in this case, because this flaccid collapse type is a deficiency type, so we are trying to use moxibustion rather than use the acupuncture, because the moxibustion can just tonify the people more, right? So here he just mentioned about why we use that, okay, in order to returning or restoring the yang, in order to rescue the people, okay, rescue the patient. So the restitution part. Okay, we also consider about the scalp acupuncture. Okay, scalp acupuncture, and then if you are familiar with that, you can deal with that. But for me, I'm so sorry, I'm not that good in this case. Okay, and also electro acupuncture. Electro acupuncture, as I mentioned before, doesn't belong to the traditional one. I'm not going to use that, but some people may be familiar. Last time when I was teaching in a class of acupuncture therapeutics, one classmate told me that she did use this kind of electropuncture in her husband. He found that this is very, very effective. Okay, so you can keep on doing. But for me, I will stick to the traditional one. Okay, no electricity for me. Okay, this is the sentence. Yeah, this part we just remind us that we're using the acupuncture in how good is using the acupuncture in treating the people getting the having the disease of the wind stroke. So it mentioned that usually the progress will be very quick, within 3 months, 6 months, or 1 year. However, I can just tell you guys that there's a golden time for you to treat these people. If somebody get the stroke for over 6 months, asking you to treat with them, I think the chance for getting well is low. Okay, the faster the better. This is what my principle is. Okay, you also have something to prevent, just a preventive measure. Okay, for this disease, just like you have a good preparation for that. And these are the very important. You guys should know some of the preventive measure. In the class of the internal medicine, I also advise the people, how to advise the patient to prevent from 浮重. 浮重 means reoccurring, because we know that this 中风 can sometimes be reoccur because of the body situation, because of the qi and blood. So in order to prevent 浮重, then we want to prevent the reoccurring. We do have some other preparation for that. Okay. One, about exclusion. As I mentioned before, for first of all, let's deal with organ stroke. In organ stroke, I think first of all, when we deal with the vein phlegm, first thing is 先进场. 先进场 is herb to deal with the phlegm. Okay, it consists of all the herbs for the settling down the kidney, and also to get rid of all the phlegm here. And second, hyperactivity of liver yang. 千金散 is used in removing the vein phlegm, while the 天麻扣藤汤 is going to release the liver yang, so the liver yang can be lowered down. So when we are using these formulas, we get to be very careful, because each pattern can have their individual formula. We cannot mix them. Okay, so this is the 天麻扣藤饮. And number 3, we get a phlegm, but this phlegm is not in the channels. It's a hot phlegm inside the 腑 organ. So this time we are using 行气汤. 行气汤 is always used in the case of constipation, but this time we add one more thing into it. This is 瓜蒌. The 瓜蒌行气汤. 瓜蒌is the function of removing the phlegm, especially the hot phlegm. Okay, the heat phlegm phlegm heat we can use that. And the fourth one is the organ stroke due to the qi deficiency and blood stagnation. And actually, we can just remove the qi individually, or remove the stagnated blood individually, and also we raise the qi individually. However, this formula, 补阳还五汤, is able to do both. One, you get the 桃园红花. These two things can remove the stagnated blood, and also get a 黄芪 to raise the qi here. So this is one of the solutions for that. And besides the qi and blood, qi deficiency and blood stagnation, we also have another pattern, which is called the qi and blood deficiency. Of course, as I mentioned before, I'm not going to use a 桂皮汤, although it contains both qi and blood 25. I will try to use 补中益气汤, use it, and this is another solution. Of course, I've got to give you more choice for that. Okay, sometimes may not be single answer. Okay, and I think this is the last one about the yin deficiency, stirring of vein. Yin deficiency stirring vein is very, very common case, because many type of stroke will caused by yin deficiency, which will cause the vein. So in this time, we are use a very popular formula, which is called the 正干息风汤. 正干息风汤. That means for those people who have a vein going out, we use a settling down the vein and soothing the liver. So this is 正干息风汤. Now we move to the organ stroke, which seems to be more serious. Okay, the first type is called the phlegm heat blocking the heart. This word is very important, obviously, right? Obviously, because the heart get many holes. If you block the hole of the heart, that means this guy is going to be unconscious. Okay, so what we're going to do is to remove the phlegm, which is blocking the heart, right? So what we're going to use is 羚羊汤. 羚羊角is the horn, okay, of the some kind of horn is which called, this is the kind of shape. What's the name of the shape? Not skeleton or something like. I forgot the name. 羚羊. What's the name of 羚羊? No idea. Okay, she's not study biology. Sorry, I studied biology in Broad, but I forgot. This is a kind of shape in the horns. Okay. And second, about the frame dampness. If the heart is brought by the frame, which is because dampness, we got another formula. Okay, which is a 调痰汤, of course, it contains lots of the herbs for removing the phlegm only, just like 陈皮, 党参, and also 猪肉. All those things are famous in removing the phlegm, especially the stagnated phlegm there. Okay, number 3. Yeah, this is a very, very serious case, in critical phase, which is called the exhaustion of primordial qi. That means this guy is going to die. He's leaving the primordial qi, is the last stroke of a man, right? Last straw of a man. If even the last straw of qi is, this exhausted, and then we cannot help it. So including this one, just as the people who suffer from the depiction of young, we are using the 肾附汤. Okay. I'm advised to those Chinese people. There's a 父子 here, right? 肾附汤. And of course, 肾附汤 is 2. 肾附汤, 对. So this is the 父子的父 here. Okay, 肾附汤. Okay, please add one more here. Okay, last one. This is the end. Okay, so let's move to another. So are there any questions? No, good. So we have about 40 minutes to finish the other 2. I think this is easy. So this time you guys have some idea about the 中风, right? The 中风 case, which seems to be a more complicated. But now you know that at least there are 2 types. One is organ stroke. The other is the channel stroke. For me, organ stroke is really difficult to deal with because it is always fatal. Some people usually die, right? Okay. Yeah. Move to the number 10. 闭经. 闭经, this word, 闭 is appear in the 黄帝内经, that means in the Yellow Emperor's internal medicine, he's saying that 闭, that means obstruction. Something obstruct. Whenever wind, dampness, and also cold attacking a certain location of body, and then the 闭经 will result. However, 闭经has 3 characteristics. Either it's because of wind, and then it will move it. Because of dampness, and then it will be really, really painful. Okay, and the fix. And then we got the painful B, and the other is because of coldness. Then the B because very fixed in this case. Yeah. So the B, first of all, you can see all this in Western medicine. We call all this thing to be because the obstructed by urea. Okay. Yeah. Gout, G-U-O-T. It's like a gout also belongs to this kind of. So in Chinese medicine, we call those to be wind, coldness, and dampness, and attacking people, obstructing the collateral and channels. Okay, and so what is the result? The result is either soreness, either painful, and then numbness, and last time it affects the flexibility. Okay, many people cannot bend their finger because they will get lots of urea on this place. And where does urea come from? Come from the meat. The more meat you eat, the more amino acids. Meat. Come from meat. Okay, you get more meat. The more meat will be decomposing in the body into amino acid. The amino acid must be, excreted outside through the kidney. However, if your kidney is poor, cannot perform the function, more uric acid will accumulate inside your body. So for these people suffering from this gout, never eat too much meat, okay? And because meat with accumulation of those things, okay? So those are the characteristics of that because of the tendon, the joints are under attacking of all these things, right? So in Western medicine, they have a rheumatic arthritis and also rheumatic fever or rheumatoid arthritis and even osteoarthritis or fibrostatitis on nephrasia. All those belongs to what we call it the B syndrome in Chinese medicine. Understand? Good. So how about the etiology? What is the cause of this thing? First, I told you guys, because exterior syndrome. The wind blow your hand, and then it will blow your face, and then leaving all this But the thing is, not everybody get this syndrome. Depends on the constitution. Two people sitting here, one get it, the other not get it, right? Because of the constitution. Okay? And because if you are Qi deficiency, your constitution is weak, and then you are defensive Qi is not enough, of course you are the first one to get infected, to get affected. Okay? And you're leading to what we call the B syndrome. And B has a meaning of obstruction. What does that mean? That means the first reason is because you are under attack, being under attack of the exterior syndrome. In this case, you have 3 types of B. One B, we call it the wind B, or some people call it the wandering B. That means called the wind. Second, we call it the painful B. In this case, it's really painful. This will cold. The other, we call it the fixed B. You will not go away. So we have the damn B. We can divide B into those 3. Okay. However, if you get a weak constitution and under the attack of the exterior syndrome, and then the cold will become heat, and this heat will stay in your body. Sometimes this syndrome will become heat, making your joints red hot or swollen. In this case, right? This is because the cold transformed it into heat. Therefore, inside your body, remember, this is not cold is not forever cold. Sometimes the cold will transform to heat because of the different situation. Okay. Going to the patterns. First type, we got the pain of the muscle and joints with limited movement. That means they move here and there. So this kind of wandering pain is a migratory pain. What will be the problem? As I mentioned before, since it's caused by wind, you have all the characteristics of the wind syndrome, just like aversion to cold, pale tongue, and also the white coat, floating pulse. Somebody told me, I get the floating pulse, but do not have exterior syndrome. I'm so sorry that this is because of wind. So even you get the wind, and then there will be the internal wind, also will make your pulse become floating. That means superficial. Okay, this is some kind of the wind syndrome. And the other is a painful B. Okay, whenever you have a painful B, and then you get the painful B here. Yeah, this is a painful B. Painful B is because it is being painful. It will stay there. Sometimes you guys will know that if you get hurt in your body, the weather is cold, you will feel really, really cold yourself, right? Because your body doesn't have enough warmth there. So painful cold is characteristic of very pain. Of course, your pulse will display some kinds of a tight pulse, and also you can moderate and tight pulse. And the last one is what we call the fixed pain. Fixed pain, of course, is because of the dampness, and you have a heavy sensation in the body. The limbs get numbness. Okay, and the most important thing is when the weather change. Whenever there is a rainy season, rainy day or overcast day, your pain in your area will really, really intensify. So you are going to be the Royal Observatory. You tell people when will the rain come. You will know before the people in the Royal Observatory. Yeah.
Why some people they feel the weather change before it happened?
Before weather change? Before it happened?
They feel it before it happened.
Yeah. Why?
Yes.
Yeah. The reason we're trying to explain is because the tissues and also all the bones in the joints here, they have expansion and subtraction there. Before the weather comes, they have a sensitivity for that. This is what I feel. But the actual mechanism, I'm not sure. Yeah, the pressure, right? The blood pressure measure. I think this is one of the reasons, so that they can foretell the weather change before we know, right? So this is very interesting. And besides the wandering B, the fixed pain B, and also the painful B, we also got some heat B. This means, as I mentioned before, because transformation of the cold to heat. In this time, the patient will have what we call the yellow, the red tongue with yellow cold, and the pulse still got slippery and rapid because of the heat. And these people also got what we call the aversion to heat. Okay, aversion to cold and also get fever in this way. Okay, going to the treatment. We get the OC point. Okay, OC point, where you get pain, and then you get it. Of course, for me, besides the affected area, you have to choose some point around the area. For example, you get the elbow here. Of course, don't needle on the pained area. Okay, it will intensify the pain. We always pain it in the adjacent area, and also we will pain needle some point, just mean the important point nearby. Those is the experience. And also depends on whether this is wandering pain. With wandering pain, we are going to find some points to get rid of the wind, just as the GB20 or others. If this is because of the wind, we are not going to deal with the wind point, because according to Chinese medicine, the blood deficiency will cause wind, right? So we are going to tonify the blood so the wind will go away. This is why we are using BL17 and also SP10 in order to deal with the wandering pain. And for the painful B, we concern about the kidney and also the guanyuan, that means the CV4, because we want to tonify the kidney in order to warm up the body. This is the painful is caused by cold, right? So we warm the kidney yang in this way. And how about the fixed pain? The fixed pain, of course, deal with the water. What we're going to do? So we are trying to remove the dampness in the body. So you are dealing with the water points, just like SP9, SP6. Those points are very important. Lastly, when we deal with the heat B, the heat syndrome, of course, we are getting rid of the heat by using the daijui, that means GV, the GV14, the G here. We are using the LI11 as we did before, right? The daijui, all of them can get rid of it, right?
For the wandering bee, it's because of wind. Why we don't control the wind?
Why not?
Yeah,
because those want to control the wind by exterior wind.
Okay.
Now the wind is journeying inside the body. So what we are going to do is, we know that, because the wind is because of deficiency wind. Once you deal with the deficiency of the blood, once you deal with the blood, the wind will go away. Yeah, those are very important statements in Chinese medicine. Okay, yeah. Exactly this sentence, right? Can you see that? I'm so sorry. Can you see this sentence? Very important. Okay, you deal with this because we are going to get away the wind by tonify the blood. So this is very important. Okay, and also we mentioned why we use the points for dealing with those, the fixed pain and also the painful B. Here he mentioned about if we are tonifying the spine and stomach, we always can, get away those, fixed fixed B, because we are going to tonify the kidney, the spine, so that we can remove the damage here, right? Other treatment, I just appreciate one thing. Okay, cupping is good. Cupping is good. Whenever you do the cupping, you will find the area with the color and also the moisture. Okay, after you remove the cup, you will see the color is becoming gray and also dark. That means you're full of heat inside. And you just touch the surface. If you find the surface is wet, what does that mean? Full of dampness, right? So in this case, I think cupping is a very good method to deal with the pain syndrome. Okay. Guasa, of course, but the function is just for expand the wind. But cupping can also take out the heat from that, right? This is better. Here, and of course we need to we will advise the patient to keep warm. When they have those the obstruction symptom, avoid immersing by the pathogenic wind and also cold, right? So how about we deal that? How about we deal with that? Now, in order to deal with that, we are going to differentiate them in the different syndrome. One is the wind B. The wind B and also the characteristic of wandering, aching in the body, and also you got other, inflexibility in their joints. Of course, the seat itself is red. So this word, please correct this one, Chinese people. Okay, seat is red, not sit jing. Okay, sit again, and the seat, the tongue. The tongue is a little bit red and with the little bit, white coat, white and thin coat. The pulse, it doesn't mention pulse here. Although we got Chinese here, but there's not pulse here. Please write down floating pulse. Floating pulse. As I mentioned. Floating. That's a bit, yeah. Then superficial. Sometimes they get a mistake here. They leave out something here. Yeah. Yeah. Yeah, here is the analysis. Why we have all those symptoms, because we know that wind is able to move. Wind is able to, to bring any evil in the body. So here you can see that if the body is having some problem in the qi and blood obstruction, of course you will get all the pain in the body, and of course it is going to explain why we got those pain, explain why we got the light red tongue with the thin coating there. The pulse is floating is because of what? Because of the wind, for infecting the body. Okay. How can we deal with that? Of course, as I mentioned before, wind. Of course, you're going to expel the wind, so you can see the word expel here. Okay. When you guys taking the examination, wherever you see wind, please expel the wind. Okay. When you see cold, expel the cold. Okay. Or warm. And then if the cold belongs to inside the body, we are going to warm. If the belt is from outside the body, brought up by the wind, also expel. You expel the wind, expel the cold away again, right? So you remove the dampness. And also you can drag the channel. In this way, you can promote the blood circulation inside the body. What we're going to do? 防风汤, 防风汤. 防风, the name here means getting rid of the wind. So you got the very good explanation for that. Okay. And in case some modification, if you can get the soreness in the body, aching in the body, of course you can get some 江火 or other things. Those has explained there. Okay. Those are the formula for that. Okay. Number two. What we call is a painful B. But the pain, as I told you before, is because of coldness, right? So what we are going to do is we supply more heat there. So the symptom will be we feel cold. And this location for feeling pain is fixed. Especially when you eat something cold, when you eat salad, when you eat cold drink, you will feel more and more serious in the place where you get the painful B, right? And also it also has some characteristic of you cannot move your leg, you can move your hand. And when you touch on it, it's cold instead of warm. Okay, and also the tongue. Now you get the tongue is a normal tongue. However, we get a moist coating. The pulse is floating intense pulse here. And here is the And here is the analysis of that. I'm not going to talk too much, and you guys will know why we get the pale tongue. Why we get the tongue with the white and also thin coat. Sometimes this coat is come with some moisture. That means this is the combination with cold and dampness together. So you get some cold and moist tongue there. Okay. How do you get rid of that? The treatment principle again. Whenever you get cold, please expel the pathogenic cold and then expel the wind. However, this time you have to remove the dampness. What are we going to do? 乌头剑. 乌头汤 is very hot, because 乌头 is much better than the food in this case. So 乌头 is able to get rid of any cold symptom inside the body. Okay, I always mix this 乌头 with the 薏仁汤, and then they can treat both the dampness and also cold together. Okay, question.
On this page 108, when you talk about how to treat all of these, if you look at them, they're almost the same. Except for this one? Is that true? You're basically eliminating wind, damp, and cold in all of them, no matter which syndrome it is. It says cold here, wind here, damp, it says cold,
Yeah.
damp, so all
Yeah,
of them.
yeah, all of them you move them, you're right. Since B syndrome is caused by three things, right? Wind, cold, and also dampness. So whenever the focus is wind, focus is dampness, focus of the coldness, we still use the three method. Originally, because this location is affected by the three pathogens, right? So it's right for us to use all three methods in dealing with either is wind, either is cold, either is dampness. Yeah, this is right. Okay, the last one, 绝壁. 绝壁 is the fixed B. In fixed B, it means that the place for getting the painful area is really fixed. You will not go up and down. Or this time it will be intensified. When the temperature falls down. And of course, the most important thing is the sensation, heavy sensation, and the aching of the body. I think heavy sensation is some characteristic, meaning that this is because of what? Because of the dampness. And also swelling, heavy feeling, all that you guys will know. So here you can see it's getting red and also swollen in this place. Okay, and also the pulse. Concerning the pulse. The pulse here, what does that mean? Okay, let me move that. Normal tongue with white and greasy coats, right? And then soft, and also moderate pulse. I would rather you guys correct it to be SOGGY, soggy pulse and moderate pulse. Okay, soggy and moderate pulse. Instead of saying this is moderate means slow. So soggy and slow pulse. Okay, this is the solution for that. Okay, explain why we can use all. Explain why we can have all these signs and symptoms because of the joints affected by the dampness, and then so you cannot move, and you can why do we have a heavy sensation in the body? All those because of the yang qi. What is the treatment? Yeah, same as this lady talking about. All of them we are talking about what? Removing dampness, dragging the channel, expelling the wind. The last one, this is different. We're clearing away the cold, This is the most important we need. Okay, so we're going to do, this is the formula I just mentioned before. 一语人汤 consists lots of, besides getting the herbs for the removing the wind, also it will also remove the part of dampness, just like 薏仁, and also the 樟树. All those will be able to get rid of the wind and also dampness together. Okay, and those are the formula. And last one, as I mentioned, heat type. This is because the cold transform to heat. In this way, you can in this type of symptom, you can find they always get pain and feeling of burning heat. Sometimes you feel and don't press it. Okay, and the only way to get release is to use an ice pack. Okay, to get it cool in temperature with better. And of course, the accompanying symptoms include a fever, aversion to cold, and also thirsty. The pulse, of course, must be floating with the wind, right? So it doesn't have floating, so it just got slippery and rapid. Okay, and this is the heat one. And sometimes I think if you got the wind, it doesn't consist of wind, so we cannot do that. Okay, how to deal with that? Removing dampness, dredging channel, expelling wind, and keep away the cold. Yeah, you're right. The same thing. We're going to use them. You're right. Anyhow, this is good. This is analysis. I'm not going to deal with that. Okay. Yeah.
One more question.
Yeah, question.
You said I know slippery means stagnation, but
yeah.
Does it also mean dampness?
Stagnation of water, then it's a dampness, right? Okay. So when you say, I should say, I'll speak in this way. When you find the tongue, all the tongue covered with water, right? This is called a slippery tongue. Slippery tongue, that means you got all the water inside, water in the abdomen, right? So we just say that this is a stagnation.
And if it's a pulse, though, it's...
Yeah, the pulse also get the stagnation, that means it is the accumulation. That means the stagnation of that, right? So here, we have got another type of that, right? And this also, we repeat the same formula here. I'm not going to deal with that because this is still with another formula. which formula is called what? Yeah, 七小豆, yeah, 薏仁. Yeah, still talking about the 薏仁汤 here. Okay, the last one, 星币. 星币, I think, Sing has the wandering bee. This is also concerned in the Yellow Emperor's, internal medicine. We're concerned about this thing. 星币, that means the, the symptom characterized by, the joints which are fixed. You cannot move your joints, and the joints are really big. Some people get a crank neck, okay, just like the crank, and those because of the invasion of the wind, dampness, and also the other coldness inside the body. Okay, those will intensify. Okay, and just think that this is not the common case, but I just share with you guys about the tongue condition and also the pulse, because in this case you can find the tongue always considered dark and also blue, and also there will be some blue stain on that for those symptoms caused by those kind of 性病. Okay, and also you can see this pulse is very difficult. You can see deep pulse with vary, sometimes with the deep pulse vary with the qi position. That means the last one will display some weakness. That means these two will have deep and fatty in the front, while the last one you get the the fatty.
What's TOUT supposed to be?
Talk.
TAUT, I think I'm typing mistake. This is wiry. What I think is the wiry and deep pulse, wiry, deep and fatty pulse in the Chen and Guan position. While in Qi position, you get the weakness. Okay?
Yeah, it's very close, right?
Yeah, this is analysis. I'm not going to do it.
Close.
Okay, how will you deal with this kind of problem? Of course, the problem is still with the kidney yang deficiency. So what we're going to do is tonify the kidney and disperse the cold, and this is what we can do so that we can drag the channel and make it through. Okay, this is the what we got. The formula here we got the Sudi and other things together. Okay, this is the solution for that. Okay. How about the measuring? How about the preventive measure? Of course, those are preventive measures. You guys think of, how about when the situation is extreme in the starting case, in the stable case, and after the stable case, and then what you give, or advice you give the patient is to have a stable condition, and then also the room keeping warm, and so that the pain will be decreased. Okay, all those are these are also the preventive measure in the diet. Okay, and also sometimes you use the warm pad to warm the cold thing. Okay, so this will be the end of the 11, the 10th one. Now let's go to the 11th. This one is quite simple because we all get a 虚劳. 虚劳, what does that mean? That means you are really weak. You're weak also in the qi, in the blood, in the kidney together. They combine the weakness in the body, combine deficiency. So we call this 虚劳. So in the Western medicine we call it to be chronic fatigue. Chronic fatigue. I'm sorry. Yeah, chronic fatigue. What do you mean by chronic fatigue? Chronic fatigue means what? Means you feel really tired. Always after going home you feel your whole body cannot get up. Okay, and this is because of sometimes you feel the fatigue in the muscle, sometimes you have the insomnia, your forgetfulness. The only thing is you cannot concentrate yourself. So this thing, when you go to see the Western medicine doctor, sorry, I have nothing to do with you, right? Do you want vitamin? Do you want any supplement for you? But of course, in Chinese medicine, we know that you are 虚劳. You are 居虚, that means everything you get deficiency. So in this case, we are going to tonify yourself. So tonification is the only method for this. Why we get this 虚劳? Be careful of your work. Don't overload yourself. Okay? Sometimes because of the emotional. Sometimes because of the overstraining. Or overload yourself. And which organs were responsible for this kind of 虚劳? It's because the liver, spleen, kidney. All those, even the liver qi cannot express itself. Second, it's because our heart do not have enough blood. And also because of the spin qi deficiency. All those will be the cause of them. And also it's because of the kidney yin deficiency. Okay, we can divide them into several types. One, these people will get what we call it the depressed. That means depression. Okay, and being a depression, they always have some insomnia, forgetfulness, and also depressed. Sometimes it's emotion unstable, and even what we call the psychosomatic means the thing at the brain, and the brain will affect the body. In this case, it will go out the muscle, and the muscle problem, and also somebody get the lymphatic enlargement here, the lymphatic node, and what we call it the sore throat, also the neck with the scapula here in this way. Okay, and those will be a disease caused by the depression. So whenever people get this 虚老, what are we going to do? Of course, we deal everyone on the head. Okay, we get 保会, that means the GV20, and then we also get the 印堂, this position. This is a special point for either on the nose or in the head. Okay, and then the 神门, of course, everyone concerned of heart, please remember 神门 here, HT7, and also in the middle you get the 带气, I mean in the leg you got the KI3 and also LR3 for those places. For tonification, don't forget 朱三里 ST36. Okay, and for the supplementary points, I want you guys to concentrate on one point called the 四神冲. 四神冲 is the point 1 inch before, 1 inch after, 1 inch left, 1 inch right of the GV20. Okay, 1, 2, 3, 4. Those is helpful in releasing your stress, and also increase your concentration on things. Okay, and if you have some more problem, just like insomnia, of course you can see 安眠 in this position, and also 内观 安眠 is a special point for that. Okay, and this explains why we chose 印堂, why we chose 神门, why we chose 太阳, because those are the source point was, and we get 足三里 三阴交, all those are because tonifying the body so that we can recover the body as soon as possible, because this syndrome belongs to deficiency syndrome. We are going to tonify it. Okay, other method, of course, you can use a needle or 白罐. I think cupping is good for that. Not sure, because cupping always in my concept is just extracting some heat, some water from here. Whether cupping is good to this kind of 虚老, I have no idea. I haven't seen that. 安门
is extra point.
Yeah, extra point. You're right. 安门 here, extra point, just between the 鱼峰 and also the GP20. I mean the 风旗, just middle of them. Okay, so this explains why the acupuncture can be useful in dealing with this kind of disease, right? So let's look at the prescription. One, if people get lung qi deficiency, she suggests we use 补肺汤. However, for me, I will use 细菌鸡汤 or 补中医气汤. Okay, this one is all going to deal with the lung qi deficiency. Lung qi deficiency, you can use 补中医气汤 or 细菌鸡汤 instead of 补肺汤. Okay. Second, about the qi. Okay, and qi. Next one, please. About the qi in the heart qi. Heart qi, we get a very formula called the qi fu yin. I'm so sorry that I have no idea of this formula. For me, even heart, I will use something called the 桔甘草汤. 桔甘草is very famous for people to dealing with the palpitation, and you also treat about the profuse sweating and other disease concerning about the deficiency in heart qi. And about the spin qi, what's the wrong with the spin qi? Spin qi, that means the spin do not have enough qi, right? So this is a very good formula. Everybody knows, right? 细菌鸡汤 细菌鸡汤生熟灵巧 细菌鸡汤 is for in Chinese we call four gentlemen soup. It's very famous. About the kidney qi deficiency, Kidney qi deficiency, they use 代保元剂. This we mentioned before. This to bring up the qi inside our body. So this is the kidney qi. So however, when you compare this 代保元剂, it's same, more or less the same. Okay, as the Louis D. Wang Tang, but it also increased both of our qi. And how about the blood heart deficiency? Okay, heart blood deficiency, either you can use the 桂皮汤 or this one 养心汤. 养心汤 is also same as the 桔甘草汤. It's the same function, tonify the blood. Okay, 养心汤. This is also, I also used that when I was in Hong Kong to Korean people. They got the publication. Okay, I also spleen blood deficiency. Okay, we got the 桂皮汤. Yeah, I agree with that. 桂皮汤is good in dealing with the deficiency. Okay, and liver blood deficiency. Come on, use 西湖汤. 西湖汤 is not enough. If you are using the liver blood deficiency, I don't think 西湖汤 is enough. Please add something just like the 杞菊地黄汤 with the 西湖汤. I think that's good. Okay, and number 3, yin deficiency. Yin deficiency, that means you got the dry mouth, easy coughing. Of course, we are talking about the 麦门冬汤. However, here we give the 沙参麦冬汤. I think they're the same. But according to Jiang Zhongjing, we also 麦门冬汤 other than the 沙参油猪汤. Okay, and the last one, we get the 心阴, that means the heart yin deficiency. There's a very important soup called 天王补心丹. That means the heavenly God curing the people suffer from insomnia, suffer from distress. We also use 天王补心丹. This is a very good formula for people suffering from insomnia because of the kidney and heart disharmony. Okay, and last you get the yin in the spleen and also the stomach yin deficiency. Next one, please. Yeah, this no. Yeah, go to the kidney deficiency. Now have a 益胃汤. This 益胃汤 is just with the 沙参 and 乳煮. All those can tonify the body. Yin, liver yin, of course we have the 保阴汤. Sorry, I have no idea of this soup. But for this 保阴汤, we just advise people to take the 杞菊地黄汤 in order to tonify yin. Yeah, this one is right. For the kidney yin deficiency, the most important is 左归丸. 左 means left, means we tonify the left kidney, so it's 左归丸. On the other hand, if you use the heart yang, the 保元酱 is also another way to solve your problem, the heart yang disease. Okay, the 脾阳, that means the spleen yang. Spleen yang, yeah, 附吉理中汤 or 富贵理中汤, the same thing, right? 理中汤 means dealing in the middle. So 附吉 and 药桂, those help in the kidney. Therefore, we can tonify the kidney and the spleen together by use this 附吉理中汤. Okay, those are the formula. And also 药桂丸 is right. You guys remember, it's not bad. You just remember we have 左归丸, that is left. We tonify the left kidney. Now we get 药桂丸. 药 means what? 药 means right. So we are tonifying the kidney in the right side. That means you tonify the kidney yang. So remember, 左归丸 is tonify the kidney yin, while 药桂丸 tonify the kidney yang in this place. Okay, is that all? Yeah, I think that's all, right? Yeah, finish. Yeah, thank you very much.